many of the different fields in science most people aren't exposed to in their day-to-day life. The more you can get out there and communicate to the young people coming up that are the future of science, the better. You never know what's going to grab one individual, and so that's vital to inspire the next generation.
The Nobel Conference brings together students, faculty, and members of the general public to explore revolutionary, transformative, and pressing scientific questions and the ethical issues that arise alongside of them. We bring leading researchers to Gustavus, including nearly 100 Nobel laureates. We're trying to explore the ideas of science using all of the liberal arts, so the arts, the humanities, the social sciences, all of them working together.
There are a lot of people who are not scientists who like to share in the adventure of discovery, and to be able to share that joy with people who also get it, that there's something really exciting and cool going on. It just makes it just an enormous amount of fun.
There's sort of a festive atmosphere, which makes it part of a broader experience.
There aren't that many forums for us to have the discourse at that level with that sort of range of expertise, yet still focused on one sort of overarching topic.
One of the wonderful things about the Nobel Conference is it does give people the opportunity to ask people questions in an informal way, and you never know what statement somebody makes or what interaction that happens will make a change in somebody's life.
It's always very, very encouraging to see other colleagues of yours who are at the top of their game, and it makes you want to lift your game.
As you can feel the audience, and you can really feel when you've helped people to know something that they never knew before. It's really a feeling of discovery that you share.
Hello and welcome to day 2 of the Nobel Conference at Gustavus Adolphus College. This is the 58th annual Nobel Conference. This year is entirely focused on mental health inequities and young people. We are back for day 2. My name is Tane Danger. I'm a 2007 Gustavus alum, and I am your host for the live stream this year. We've got an entire full day of programs. We've got 4 amazing presenters from around the world who are coming to speak on this year's topic, as well as Q&A for each of those speakers with the panelists and things that you all submit, and special arts performances, which is actually how we're going to kick off in just a few minutes with a musical performance by the Gustavus Wind Orchestra. But before we do that, we are going to kind of set the table a little bit. And to help me do that, I've got the perfect person, one of the co-chairs of this year's conference, Professor Marie Walker, who is a professor of psychological science. But as I said, one of the main 2 people who helped pull this year's conference together. We went through day 1 just for, in case there are folks who kind of checked in today for the first time. Can we maybe just give a quick sort of overview, a little bit, if you were to give sort of the 30-second view, what did we hear yesterday?
Okay, we heard about identity as African-American youth and how cyberbullying occurs on the internet and impacts the mental health of those young people, and it's pervasive, and it is also a way for youth to connect with their identities and create positive communities as well. We also talked about, Priscilla Loy talked about using virtual reality to try and understand people's experiences of microaggressions, which are, smaller daily, but once again, pervasive experiences with discrimination. And how that is something that is a technology that might be very useful.
Right. And she actually showed this in her talk yesterday, how they're using sort of literal virtual reality situations to test sort of how some of these things work, which also led to sort of an interesting conversation about is that potentially fraught to even do that kind of a research because it requires microaggressing people in the process.
Right. And when you're thinking about any type of clinical intervention, you're going to arouse emotional distress, right? It depends on how you do it. So virtual reality means you're seeing something that looks very real and you're interacting with it. But for example, what Brandisha Tynes has a grant in to do is to have people re-experience microaggressions. Think about what you've experienced, both of which are probably, pretty difficult experiences, but otherwise, how do we know what to do and how to teach people to deal with microaggressions? It's a hard process, there is a risk, and that's what the whole review process is about when it comes to ethics, is to make sure that people aren't harmed.
And that is one of the cool things we talked a little bit about yesterday, but I think it's very neat about the Nobel conference is that you're getting to see people at the top of their field in this space have that discussion. And there's not sort of just like a pat answer that they're all just sort of repeating. They're working through this, and we get to actually almost be a fly on the wall for some of that conversation of, well, what if we do this? Here are the pros and cons. What if we do that?
Mm-hmm. And, I had a conversation with a colleague about this, saying, okay, what do we do when we want to test a new drug for people, right? I mean, mental health is not at all funded compared to the pharmaceutical industry or the healthcare industry. So what do we do to protect people? What do we do with the groups who are the control versus not? And I think it comes down to having more money available for perhaps treatment afterwards for individuals. I think it kind of gets at the disparity between, mental health funding versus sort of more medical. I mean, they're all tied together, but that's how our society differentiates them. So, we aren't doing enough to help with clinical interventions unless it's pharmaceutical. It's just not funded as much.
Right. And one of the things we heard over and over again yesterday is we hesitate to say causation, but definitely we can kind of point to correlation between rise of use of technology, more and more people, especially young people, being connected in a variety of different ways online, in different types of ways in different places, and potentially some of these issues that we're discussing around mental health and whatnot. And again, everyone was very careful not to say, like, you can't say this is causing this, but we have seen these numbers go up and up, particularly over the last decade and a half or so.
Well, yeah, and I know, I think it was Daniel Eisenberg said it's been going up, since, the 30s, right?
Yeah.
And so it is a controversy. Is technology directly leading to young people having mental health distress? And it probably is for some, and it might not be for others. And so, I mean, that's all about, intersectionality, right? What is your identity? How is your identity impacted? But it's hard to test because we are not putting one group who gets technology and one group who doesn't have technology. Right. It's just impossible to do. So we can only look at maybe after the fact, what kind of things are related. If you're 8 or more hours on your phone, are you more at risk for mental health problems?
And that is a great setup for what we think a lot of today is going to be about, that term intersectionality and identity and community. We obviously started to get that on some of the talks yesterday, but that's going to be, I think, a big part of the talks that we hear today. How does individual identity, group identity, community identity inform, help potentially complicate some of these issues of mental health in young people?
Yeah, and I'd say Meryl Alper did talk about, technology tied into kind of a neurodiverse identity and how it can be helpful, right? Today, I mean, that was our intent. Let's look at community. Let's look at how the community buffers and serves to support young people. And I think we'll see that coming up over and over again, but we also will see how the community has certain stigmatizing expectations.
Right.
Like if you're lonely, do you internalize that and say, it's all my fault? Or do you kind of look out and say, well, no wonder, I'm an immigrant, I've moved to this country, and my language, my accent is not appreciated, and so people aren't talking to me, right?
Yeah.
Do we make that differentiation? So that idea of, it's never certain in psychological science. We're always open to looking at things differently, but it looks like communities overall serves a very important function, but it also stigmatizes people.
Yeah, I mean, if there was an easy answer, we wouldn't be talking about it at the Nobel conference. And I mean, one of the things, I don't want to sort of jump ahead to lessons learned or morals, but I do feel like over and over again we heard from presenters, and definitely from the conversations I've been having with students and faculty who are working on mental health issues here on campus, that there is a desire, a push for people to reach out and make more connections, particularly with young people in their lives, to make sure that you're talking to those people, and very importantly, listening to the young people in your life. That, again, there's no silver bullet, but that we know that actually having sort of those connections and what we can do as individuals, that is a really important piece of this puzzle.
Yeah, and I'd say noticing what our young people are doing, noticing when they are, closing their door and hanging out in their bedroom and not wanting to come out, noticing when their academic performance is dropping. And Daniel Eisenberg recently published some work on alcohol consumption and suicide risk. And it's not necessarily the amount of alcohol you consume, but it's the adverse effects after consuming that alcohol, whether you blacked out, whether you have some sort of repercussions because of your behavior. And so parents can notice those things. They can say, oh, you got suspended from your sports team because you were drinking alcohol. That's really meaningful to a young person in high school who now can't play on their team. Those sorts of things are things family members, friends, peers can notice. And I think that's really important too. Peers need to stand up and support their friends with their mental health crises. They can't fix everything, and they've got to, help maybe find avenues for support for young people. But they need to be there for their friends too.
We are going to start this morning with 2 lectures. I believe we're going to hear Manuela Barreto talk about loneliness, which, again, I feel like this is something that a lot of folks are going to hear and resonate with. But this is actually a study not just sort of like on the individual, but potentially how this is pervasive and maybe increasing, how we're seeing it in different ways showing up. Not just in these communities, but all over the world in all different kinds of ways.
Yeah, it's very global. It's global research, and she talks about differences. If you're in a collectivist culture, which really has a focus on community and fitting in with your groups and supporting your groups, that you actually might be at higher risk for loneliness because within that setting, the stigma attached to not being connected with people is greater. But there's also this finding that, well, she'll talk about it, but there are gender differences. Right. There are differences, age difference. So it might be something that people are older and younger are sharing, this loneliness and how they respond to it based on their gender.
Right. And that gender piece is a segue into the next talk, G. Nick Ryder, who is talking about healing and inclusivity, particularly centering transgender and gender drivers of community, is the second part of our morning sessions this morning.
Yeah, and their research is, I think, sort of even more relevant to us in Minnesota because the data set that they're using is some of it is Minnesotan young people in the high schools. And, they're talking about how the labels we use aren't what young people are saying about themselves. So it's even hard to do research if we aren't asking the right questions. How do you identify? are words like pansexual and genderqueer. Are those being used to allow people to check off the boxes when you're asking young people how they're feeling? And so that kind of the research has to catch up with what our young people are experiencing. But I do think she's going to talk, I think, on an anecdotal level and on a level of what's the big picture too.
Right. Well, we are just about out of time. Quickly, are there, in about 30 seconds or so we have, are there things you'd really encourage people to listen for, be open to as they're watching today?
Yeah, I'd say this is a panel, a group of people that we don't see enough of coming together and talking with each other. And I think that this is a great model, not because Gustavus put it on necessarily, but these people came together and are sharing their research. So I'd say, notice what they're saying. They are providing us with perspectives that we might not always be open to seeing or hearing. And I think helping us to answer some of these important questions about youth mental health.
Yeah. Well, co-chair Marie Walker, thank you so much for helping us kick off this second day of the Nobel Conference here at Gustavus Adolphus College. We are just about ready to go to the Lund Arena, where we are actually going to start with a musical prelude by the Gustavus Symphony Orchestra. We got to hear them actually yesterday. Actually, just a quick teaser that this afternoon, over the lunch hour, we're actually going to hear an entire performance that happened last night. So it's a good reason to stick around this afternoon. But for now, I am actually going to throw it over to the Lund Arena, where the orchestra is getting going. So thank you for being here, and welcome to day 2 of the Nobel Conference at Gustavus Adolphus College.
Well, how much fun was that? Oh my gosh. Thank you all. And welcome back to all of you. So happy to see you back here. And in the thank you department, I want to say a special thanks to the people that you're seeing wandering around here with very long lenses. The marketing department, especially designer Neely Prenslow, Ann Volk, who's running the desk out in front, Rachel McCarthy, our social media maven, Steph Ash, who's taking my picture right now, who designs the Gustavus Quarterly, Tim Kennedy, the Vice President for Marketing Communications, and the more than 25 student workers in marketing who have helped with tickets, managed the Learning Lab, managed the workshops, helped create content for the website and promotional emails, and helped with the live stream. And with respect to that live stream, thanks to Matt Dobosinski, also of that office, and Gusty alum Tane Danger, who's serving as our online MC. A reminder, please ask questions via paper or via nobelconference@gustavus.edu. And please, I've noticed a few of you starting a conversation online on your own social media. Please do that, and if you'd use the hashtag Nobel58, we'd appreciate it. And about that Nobel name, the president yesterday mentioned that we had the opportunity to meet with Vidar Helgeson, who is the director of the Nobel Foundation in Stockholm. And it was a huge honor for me.
we entered his office, and he made a special point of pointing out to us the print that was on his wall, and it's the reproduction of a portion of Alfred Nobel's will. And he chose the portion of Alfred Nobel's will that says, "for the benefit of all humanity." And he said, my emphasis as the director of the Nobel Foundation is to think about how we can use these prizes and the prestige of these prizes to show that every human being has the capacity to make the world a better place. He has a vision of a new museum in Stockholm, which will be a place that every Swedish school child visits every year to come to see the amazing contributions that Nobel Prize winners have made, but also that they can imagine themselves being one day a person who makes change in someone's life. And I think it's really that spirit that we try to embody here also with the presentations, with the discussions, and with all of the activities that happen around it. So as the president said yesterday, we consider ourselves deeply honored to be given the right to use that Nobel name to call our conference the Nobel Conference, and we really strive to live up to the honor that prize bestows. At this point, I would like to welcome to the stage my colleague, Angelique Dwyer. Unfortunately, Professor Thea Cooper is unable to be with us today, and so in her stead, Angelique Dwyer will introduce our next guest. Angelique?
Good morning, everyone. I'm thrilled to introduce our first speaker for today, the second day of our Nobel Conference, Dr. Manuela Barreto. Dr. Barreto is a full professor of social and organizational psychology at the University of Exeter in the UK, as well as researcher at the Wellcome Center for Cultures and Environments of Health. She was born in Portugal and received her PhD from the Free University in Amsterdam in the Netherlands. She's an expert in the intersections of marginalization, identity, and stigma, especially its impact on health and well-being. One of her major contributions to the field was serving as co-investigator for the BBC's Loneliness Project, which surveyed more than 50,000 people across the world. Some of the project's key findings were that young people were the group that felt the loneliest, and that people who were discriminated against were more likely to feel lonely. 3 of her most recent articles were Stigma, Identity, and Support in Social Relationships of Transgender People Throughout Transition, and Exploring the Nature and Variation of the Stigma Associated with Loneliness, and Are We Doing Enough to Address Loneliness in Adolescence? Her research is extremely relevant for us to understand the issues facing young adults today and their impact on mental health. Please join me in welcoming Dr. Barreto.
Thank you very much to all of the organizers and the students and everybody who is taking part in making this happen today, and not the least the audience, without whom, well, this would just be silly, really. Yes, I am here today to talk to you a little bit more about loneliness and obviously the relationship between loneliness and mental health. And what I want to do today, aside from giving you some of the basics, because obviously I have no idea what people already know about the subject, is to try and challenge us to think about loneliness a little bit differently from how we are led to think about it by the media, and also, in fact, by a lot of the academic work on the topic. So I want to make us think about loneliness not as a deficit in individuals, but in fact a deficit in communities. A social justice issue that we can and should motivate it to address. Okay, let's see. So first of all, what is loneliness? Now, there is not one definition of loneliness. There are many, and I'm sure each of us has our own idea of what loneliness is for us. But that said, there are some definitions that we use in the literature, and the one at the top here is the one most used, the idea that it's an aversive feeling, and it's related to the discrepancy that we experience between the kinds of relationships we would like to have and the ones we actually perceive that we do have. So that is sort of pretty dry, but a definition to start with. The second one I put in there because it's the one that most chimes with my own feelings when I feel lonely, which is the idea of the experienced lack of empathic understanding. It's also how many people feel when they feel lonely, but of course people feel in different ways, which is also why we like to listen to how people describe their own feelings of loneliness. Now, a couple of notes as well, because people may have heard about this kind of distinctions. Yes, we do sometimes distinguish between transient and chronic loneliness, and the difference between the two is just one of how long have we had this feeling. Transient loneliness is perfectly normal. We have it a lot, hard to capture in surveys or experiments or any other type of study because it's transient. And usually given very little importance because that's not the one that is associated with all of the negative effects of loneliness. Chronic loneliness lasts a longer time, and it's then the one that tends to be problematic. People also talk about emotional and social loneliness a lot. The terms are a little confusing because, of course, loneliness is always something social and it's always something emotional, but the labels tend to refer to emotional being a lack of intimacy with someone and social being social networks or friendship networks that we are not happy with. So, as I said, we like to also listen to what people say when they speak about their feelings of loneliness. So I put in here a few quotes from a study we have done across 5 countries in Europe with 14 to 16-year-olds, telling us what is loneliness for them, how do they experience it. And so there's other kinds of things people say. It's a big sadness when you cannot find someone to help you or to share your sorrow. You feel alone, sad, misunderstood, not heard. And the other one I can't read, but hopefully you can. So this, although different from those more drier definitions that I've just shown you, they do connect to those through the idea of lack of connection, right? Now, can loneliness ever be positive? That's one of the first questions I get asked. Is the microphone still working? Yeah. Is one of the first questions I get asked is, can loneliness ever be positive? And of course, we do see people also saying positive things about their experiences of loneliness. So these are quotes that we got from the BBC Loneliness Experiment that was mentioned earlier, where we also had some open questions and people could actually tell us how it felt for them. So people will talk about it as a stimulus to reconnect, an opportunity for reflection and personal growth, an opportunity to engage in meaningful activities, or time out from the world. Now, when does loneliness become a problem then, if it can be positive and it can be negative? Now, we can look at the evolutionary theory of loneliness that was developed by one of your American scholars that speaks of loneliness as functional. So it's a way of signaling to people that they need to do something to address a need that is very fundamental to them. So it should make you motivated to reconnect, and therefore, and after that, subsequently, it should make you reconnect, because being on your own is not a good thing, evolutionarily speaking. It's not safe and it's not efficient. So the problem is, people don't always have the opportunity or the capacity to reconnect. So think of people who don't have the financial resources to socialize with their peers. And this happens a lot in adolescence, and young people don't have necessarily their own resources and sometimes have very little access to resources to keep up with the kinds of social activities their peers are doing. Think of lack of time. So informal carers, for example, often complain about having no time to do anything aside from caring and then resting from the caring. So actually socializing there's no time for. Or, for example, restricted mobility or even lack of transportation. So think of people who are chronically ill and have very little capacity to move around. In addition to the opportunity, there's also the capacity. So people might be too afraid to engage in social interactions. They might not speak the language. They might not understand the norms that are prevalent and valued and respected in their surrounding. So in these cases, loneliness does not lead to reconnection. It leads to more loneliness, and then becomes a self-fulfilling cycle, and which is where the problem arises. So feeling lonely is fine, as long as you can get out of it, right? So that is ultimately the message. Why do we care about loneliness, though? Why do we care? Well, first of all, because it's prevalent. It's quite common. So, sound? Okay. So, for example, this is data from Europe, where we saw that pre-pandemic, between 6 and 13% of the population over 18 was feeling very lonely. Post-pandemic, or during the pandemic, that went up to 22 to 26%, which is, quite high. Data from the US shows that compared to other causes of concern, loneliness is a lot more prevalent. And importantly, and as was already mentioned during my introduction, it's not just a problem of old age. So this is data from the UK, from the Office for National Statistics, which is drawn from representative populations, whereas the data that was mentioned earlier from my own BBC loneliness experiment was not from a representative population, but it was from a very big sample from all over the world, so it matters in that way. But this is from a representative population, and basically what you're seeing here is that, first of all, people can feel lonely at any age, but second, the people who feel most lonely are actually lonely people. This is from 2018, pre-pandemic. But what we also see with data collected during the pandemic is that actually everybody felt more lonely, but any discrepancies remained. So if you imagine a graph showing a difference, it just went up, but the difference remained. So a quick note on prevalence estimates, because after all, I am an academic and I, for some reason, care about these things. So I just want to pause because we see a lot of media attention to numbers. This many people feel lonely, that many people feel lonely, and the numbers tend to be very different from each other. So I just wanted to pause briefly to reflect on how we should look at those numbers. So prevalence estimates are very hard to get right. And when it comes to feelings, emotions, and things that actually are very often very hard to admit to experiencing, that's even trickier, right? So how many of you here would say that you feel lonely? Maybe now that I'm talking about it more than before, but not many people would just straight out say, I feel lonely, or I feel lonely a lot of the time. So it really depends on how it's measured. And these 3 items that you have in there are examples of how this is usually measured. And in fact, in very large-scale studies, it is really these items that are used. The options are never, sometimes, often, always. The options also matter. If people, instead of asking you how often you feel lonely, they actually ask you how intensely do you feel loneliness, you will get very different results. So when people are saying 20% of people feel lonely or 50% of people feel lonely, you need to think about, well, exactly what was the question, right? We also need to think about who was asked. So how representative was the sample? Now, if you say 20% of the people in my class feel lonely, that's very valuable as evidence of how many people in your class feel lonely, but it's not evidence about how many 16-year-olds or 20-year-olds feel lonely, right? Because it's not a sample drawn from the whole population of people in that age. So, little bracket here. Now let's get back to loneliness. So why do we care? Because it's prevalent, as I've already said, but also because it has a whole host of negative consequences. Now, I could speak for hours about this because there's a lot of evidence for this and it's quite interesting, but I want to move on, and so I will just give you some indications of what these consequences might be. So stress, sleep disturbances, depression, suicide, addiction, heart disease, inflammation, dementia, and premature death are some of the illustrative examples here. So this has led some to claim and argue for loneliness to be considered a public health priority. But there are consequences beyond the individual. So the individual suffers from their loneliness experience, but so do employers, so do societies, so do communities. So in the UK, for example, there has been a calculation, this is what economists like to do, a calculation of how much it costs to employers in the UK for people to experience loneliness. There's also costs to democracy because people get more withdrawn and they care less about society and they might not vote, for example. Also costs more general to society, for example, due to the healthcare services that are then required to meet the needs, and it weakens communities. So this is why we care. If we care, and if it's so problematic, then what are we doing about it? Well, if you want to, at some point, Google loneliness prevention or something like that, you will find quite a lot of hits just like this. The hits that tell you what you could do about feeling lonely. It's about what you should do. A lot of mental health charities share this kind of idea as well. You can go out more. You can think differently about social life. You can get a pet. Now, perhaps unsurprisingly, this is just to show you that the vast amount of strategies that exist out there and that people talk about can more or less be grouped in this kind of category. So psychological therapies or cognitive behavioral therapy to challenge your ideas about the social world, which is what people call maladaptive social cognitions, to improve your social skills. There's also training to become better, a better social being, better social skills, befriending services, people who go to people's houses to have chats and to try and get them out of the house, and just generally campaigns encouraging people to get out more, join groups, volunteer, all sorts of things that are social in nature. But there's little evidence for the efficacy of these interventions. And we might be surprised about why there are so many interventions that are not very effective, but the reason why, I argue, is that they are based on a dominant approach that ignores the context in which loneliness emerges. It's all focused on people's personality, people's social skills, their self-esteem or lack thereof, and helpful cognitions, their mental health. So this idea is about loneliness as a product of individual deficits that require solutions at the individual level. It's about the lonely person as a thing, different from the non-lonely person. And it's about what can be done about them, to them, by them as individuals. Now, I argue that feeling left out, which is core to the feeling of loneliness, is not just in someone's head. One of the papers that is quite well known on the topic is actually called "It's All in Their Mind." That's the dominant approach. But I argue that, as I said, feeling left out is not just in someone's head. It's often not caused by their own thoughts or their own behavior. It's often actually reflecting real social exclusion. And it can be at the interpersonal, at the institutional, at the community, or even at the policy level. So current interventions address only a very small part of this. So just the ones we were talking about, they're really just there in those little circles. What about all the others? So I think to do better, we need to consider the social ecology of our relational life. This idea is also problematic because it's very stigmatizing. It portrays the person who feels lonely as this sad, inept individual that resents the world and turns against the others. The idea of the violent incel or the crazy cat lady or the sad, lonely old person. Of course, this is not only sad in itself, but it also adds to the loneliness the burden of moral reproach. So why do we have such a narrow focus? Again, this is something we could talk about for quite a while, but a couple of ideas is that, first of all, it's very relatable. Loneliness feels personal. It feels very much as something that you are feeling as an individual, and so it's relatable. It's something that makes sense to us. It's also appealing because it gives you a sense of control. If it is a person's fault that they feel lonely, then clearly I can steer out of it because I will behave in ways that help me avoid it. But more importantly, it's consistent with prevailing ideologies, and particularly neoliberalism and individualism. So the inherent idea of competition between people, personal responsibility, really make us draw our attention to the individual and away from any other structural factors. But this narrative is not only misguided in the sense that it doesn't really capture the whole picture, but it's also problematic because it can increase loneliness. So we know that both historically and cross-culturally, where there's more individualism, where there's more neoliberalism, there is more loneliness. So we need a shift. And I think the shift we need to make is to go beyond considering just factors at individual level as drivers of loneliness. And funny enough, research is showing those. It's just that they're not very well talked about, very well considered when thinking of interventions. So for example, aside from those that I've already shown you at the top, there's all of these other factors that are already evidenced to be important in causing loneliness. So in the rest of the talk, I want to focus on this shift to consider loneliness as not a deficit of individuals, but as a deficit in communities, and particularly the role of marginalization and stigma. As someone very recently wrote in the British newspaper, The Guardian, talking about mental health, but I think it can really be very easily transposed here to the topic of loneliness. If a plant were wilting, we wouldn't diagnose it with wilting plant syndrome. We would change its conditions. This is really, I think, what we're talking about. So to start doing this, we need to first consider that loneliness is patterned by a whole host of social factors. So if it were just an issue of individuals, it wouldn't be patterned in this way, right? So, for example, it's geographically patterned. So in America, this picture is showing where the highest levels and the lowest levels of loneliness are experienced. This is a map of the UK, and that's Exeter, where I work. A map of the UK also showing the patterning of loneliness due to geographical distribution. We don't need to go into detail. The idea here is really just it's patterned. Why this variation across communities? Because communities do differ in drastic ways, and within communities, people also have different experiences. So these are some of the ways in which communities differ. So poverty and unemployment rates differ across communities. Spatial features, I will go into that in more detail in a minute. A sense of neighborhood and a stigma regarding minorities vary very much across neighborhoods. So when it comes to poverty, for example, this is data from the Wales Centre for Public Policy, showing that the more deprivation in a given area, the more the people who live there report feeling lonely. Regarding spatial features, different studies are showing that we need appropriate and safe and accessible places to meet, particularly young people. They need to be accessible. You need to be able to walk around in those places. They need to be safe. If there is no lighting, who is going to use those places? So in this particular graph, what we see is that being able to walk around in a neighborhood, especially for older people with depression, really decreased the loneliness that they experienced. Sense of neighborhood. Some neighborhoods have more of a sense of neighborhood. You go into the neighborhood and you feel, this is cozy, and other neighborhoods don't. And people can very much sense that. So in our BBC Loneliness experiment, we asked people to what extent they felt that their neighborhood had that feeling of trust in your neighbors. And the more people reported feeling lonely, the less the sense of neighborhood, or the other way around as well. And the hopeful aspect here is that a lot more people reported a low sense of neighborhood. So there's plenty we can do there to improve things. But what's in a neighborhood? Well, there are some studies, and there's a very interesting and impressive paper, for example, by Matthews and colleagues, that shows that there's nothing objective about neighborhoods that is causing loneliness in people. Aside from questioning that from some of the other evidence that I've already talked about, I also question that what's in a neighborhood must be seen as objective, because people have very different experiences in neighborhoods. For example, in this particular study, and apologies for the rather difficult graph, but really what you need to see here is that to what extent you as a family are deprived in that neighborhood really matters to the sense to which you feel the neighborhood is cohesive. So if you're deprived, that same neighborhood seems less cohesive than if you're less deprived. And ethnicity matters. If you belong to a minority group, an ethnic minority group in that neighborhood, you feel that the neighborhood is less of a neighborhood, less cohesive. This is data from the same paper that shows that racial minorities during the beginning stages of COVID were reporting a lot of racial insults and attacks in their neighborhood. So no wonder that they're having very different experiences in the same neighborhood than those who are not racial minorities. Loneliness disparities exist also across a whole host of other categories, and these are just two more examples to make sure that we do think of this as more broadly about disadvantage rather than just about a particular group. When it comes to sexual orientation and gender identity, we see those disparities emerge as well. A lot more loneliness when you belong to a group that is less valued and potentially a minority. So the BBC loneliness experiment, as was already said, had a lot of data. There were over 55,000 participants, depending also on the part of the study. And what that gave us was the ability to do analysis we wouldn't otherwise be able to do, like this one, which used 32 predictors using computational modeling. And we were then able to see what was the strongest predictor and the hierarchy of strength in predicting loneliness between these variables and their interactions. And really the strongest predictor was daily experiences with prejudice and discrimination. Out of 32 predictors, it was not living alone, as people often think. It was not personality. It was experiences with stigma. Those other two that I'm pointing out there are relational mobility, to the extent to which people keep having to change their social networks, or culturally value changing their social networks, and social capital. So social factors, not personality factors. There's also longitudinal evidence for the powerful effect of experiences with racism in this case over time to increasing depression and feelings of loneliness. So structural stigma is also extremely important to consider, because stigma is not always about interpersonal relationships. It can actually characterize whole systems, such as institutions, states, countries, schools, workplaces. And this European Commission report really just shows that the areas where more loneliness is expressed are the same or similar to the areas where people perceive their society to be most exclusive. And with our BBC data, we actually were able to also test this by using ILGA scores, which are scores of structural stigma towards sexual minorities, and at the country level. And so the score exists for 113 countries. So we coded the countries on the basis of this score index. And we saw that the predictive value of structural stigma existed over and above daily interpersonal experiences with discrimination. And this applied at all ages. It didn't matter how young, middle-aged, or old you were, your daily experiences with stigma and the structural stigma present in the country where you live predicted how loneliness you felt and how much trust you had in your neighbors. Structural stigma can also function as what we call a moderator. It can change or exacerbate the relationship between interpersonal episodes of discrimination and how lonely you feel as a result of that. And why does it do this? Well, there's various mechanisms here, just three. One, it pushes people out. If you are excluded, why would we be surprised that you feel left out? It makes people feel undeserving. and that might lead people to withdraw. Via lowered self-esteem, social anxiety, hypervigilance, stress. Remember the first category of predictors I talked about earlier, the hypersensitivity, the poor social skills. So they actually come from somewhere. So they actually can come from your negative social experiences, like experiences with stigma, the context of loneliness. Also, there are dominant notions of what it means to be sociable that are really about structural stigma. So if all we value in sociality is particular ways of being social, then all the others are wrong, excluded, pushed out. And we can refer back to our discussions on autism yesterday, but also cultural differences, ethnic and racial differences in how people value relating to each other. So what are the implications of this shift? I'm sure you can already imagine some for yourself in the context where you live. But first of all, if loneliness is socially patterned, if loneliness is so closely related to experiences with discrimination, then we need to see loneliness not just as a public health issue, but as a social justice issue. The responsibility must be not on the individual suffering from loneliness, it must be on the communities that are not taking care of including these individuals. We need to think about certain things about our community that can help, and these are some examples. Social spaces that are safe and accessible, well-lit and well-maintained parks. What kind of people will join each other in a place that looks like the above? What mothers and fathers with young children will go to that playground? They'll stay at home and feel separate and lonely. What kind of people will join the one below? I think I would. And I have no babies, but I would. A bit creepy. So, so that allows people to connect. And they will connect, not only there will be more people to connect with, but also they will connect happily and safely and in a good mood. And they will have good interactions that are full of belonging. So communal spaces that are nice to be in, that encourage a sense of value. You are valued because we cared enough for you to make a space like this in our community and motivate social gatherings. But also, this move towards the disappearance of what we call third places, third spaces, like shops, neighborhood shops, the barber, the flower shop, the place where you can go and buy things to sew with. Sorry, my words are gone. So these places tend to close in residential areas and then to be moved to areas that are more like shopping areas. But that can be really damaging to people's sense of connection, to people's opportunity to interact with others. We need to improve public transport and ensure that it is safe, accessible, and affordable. The three things at the same time is quite rare to find. We need to be deliberate about inclusion in each context and for each group. We cannot go into a school or a workplace with a template about what it means to be inclusive. Yes, we can have some suggestions, we can have some ideas, but we need to talk to the people in question and talk about their specific issues, what do they feel excluded by, and how alternatives could work. And we need to educate and be open about different ways of being sociable. So I want to end with these statements. They're not mine, but I agree with them all wholeheartedly. So the hypocrisy of governments that talk about loneliness while systematically destroying key sources of social connectedness is breathtaking. To combat loneliness, we must be fiercely invested in combating colonialism, white supremacy, cis-heteropatriarchy, interphobia, ableism, saneism, and all other forms of oppression that cultivate the ideal conditions for loneliness to flourish. A good society is a society where people are not lonely. Thank you for listening, and if you want to contact me anytime, and these are the authors that have worked with me in all of this work. Thank you.
Thank you, Professor Barreto. Our next presenter will be introduced by my colleague Darsa Donnellan in the Department of Physics.
Dr. Nick Ryder is an assistant professor in the Department of Family Medicine and Community Health and coordinator of the Gender Health Services Program in the Institute for Sexual and Gender Health at the University of Minnesota. After earning their PhD in counseling psychology from Howard University, they became the first Randall and Fred Ettner postdoctoral fellow at the U of M's program in human sexuality, which is now the Institute for Sexual and Gender Health. Dr. Ryder examines health differences between gender nonconforming teens and teens who are cisgender, who is a person who whose gender identity aligns with the sex assigned to them at birth. Diverse gender identities are more prevalent than people would expect. More teenagers identify themselves with non-traditional gender labels, such as transgender or gender fluid. With growing trans visibility in the United States, some youth might find it safer to come out and talk about gender exploration. But differences in estimates may also reflect differences in how gender identity questions are phrased. Dr. Ryder's research into trans and gender nonconforming youth has found that in order to improve health disparities affecting transgender teens, doctors should help them feel more comfortable about seeking health care by asking how they identify and if they have experienced bullying, discrimination, or other victimizations. This is important because this conveys competence, inclusivity, and caring. Dr. Ryder's continued work to build and understand how youth understand and express gender is a critical step towards reducing health disparities in this important and valued population. Please join me in welcoming Dr. Nick Ryder.
Thank you for that wonderful introduction. I want to first give a thanks to the Nobel Conference Organizing Committee, the staff, the students, everyone online, and for putting this together, for welcoming a talk like this, for welcoming a person like me, and also just having me here to do this talk. I'd also like to give a shout out to Rox Anderson for further bringing attention to my work. They have been instrumental in a lot of what I've done. So Dr. Barreto and I were actually saying, coming into our talks, that we would have some overlapping themes, or at least we thought we would. And I think that that is actually true now, hearing her talk. But one of the things that I want to highlight is that this idea of moving beyond the individual, that is what's going to be an overlapping theme between our presentations, but I think that that's an important repeated theme and really highlights the importance of a paradigm shift. So I'm excited and honored to be here to talk about healing and the trans community and trans health, a topic that is incredibly important and also incredibly political. Yet it is also a topic that I've been very passionate about. It's a lot because of my own identities as well, and I've dedicated much of my career to. With that said, welcome to my talk titled Radical Healing and Inclusive Change-Making, Centering Trans and Gender Diverse Communities. So as I say that, I also want to highlight that to all the trans and non-binary and queer people listening, this talk is for you. We are not centered enough in the work that we do, and so sorry, I'm going to get emotional. We are not centered enough in the work that we do, and this presentation is for us and to bring everyone else along with us. For this talk, you'll see various art displayed on the slides, which is a form of communication, storytelling, and a means to share a message. And it is, in itself, a form of resilience and resistance for many, including those in the trans and gender diverse community. Is it showing up? Okay. The artwork and images from my study that you will see also uses the words of trans and non-binary young people of color. Here, you will also see two cartoon-like people. This is Taimi and Jai. We've been doing this work together, and I didn't want to miss an opportunity to highlight them as well. We also had an artist consultant, Aja Gildersleeve. I didn't have explicit permission to have a picture of Aja, so that's the only reason why we don't have one. But Aja was instrumental, incredibly important to this project as the artist consultant and with helping guide the project and also giving really helpful insights to trans and gender diverse youth who participated. So all of this is to say that I wanted to make it clear that much of what I'll be presenting is not quote unquote mine. It is part of a collective and a community effort that I get to be the one to share with you. The project that I will be talking about used a method called photo voice. In a nutshell, photo voice is considered a social justice and participatory approach to research in which participants co-create and share knowledge through photos and discussion. It is an approach that has been used in healthcare and in settings all around the world. And for this project, the focus was on health and healthcare experiences of queer and trans young people of color. And many of the participants chose to really focus on mental health. There's some overlap between mental and physical health. They often talked about their experiences in healthcare systems and what they describe as resilience, sometimes resistance, or what's protective for them. For this project, we had 11 participants whose ages ranged from 17 to 25 years old. Participants had a range of labels for their sexual identities, including queer, bisexual, gay, aromantic, among some others, and a range of labels for their gender identities, including transmasculine, non-binary, genderqueer, just queer, among some others. And all participants identified as a person of color, including Black, Indigenous or Native American, Afro-Caribbean, Asian American, and a few others as well. You will see, along with the pictures along the bottom, hopefully the words on the screen will let you see it, but that would be the demographics for the participants. So it'll say that they wanted to share. Most of them shared their name, their gender, sexual orientation, racial or ethnic identity, and sometimes some other important things that they wanted to let people know. Staying safe. When saying this phrase, it seems like we would all know what it means. Yet it is understood vastly differently based on power and privilege and when understood from an intersectional lens. So let's take a second to think about intersectionality. Intersectionality is a framework created by Black, lesbian, and feminist scholars to understand how multiple forms of stigma and discrimination intersect to create unique and complex experiences. So for example, how racism, sexism, and homophobia or transphobia interact together and affect people in their daily lives. When thinking about safety, I came to one of Dr. Lisa Bowleg's work, and she wrote an article in 2020 that critiqued the phrase, "We are all in this together." She noted the realities of how historically marginalized groups carry the intersectional burden of structural inequities. With ongoing structural oppression, such as the social political backdrop restricting access to education, healthcare, and sports involvement, and the COVID-19 pandemic, trans and non-binary youth of color experience nuanced challenges. Bringing both the phrases, "we are in this together" and "stay safe," into question about what's really being said, what's really being meant, and what's really at stake for people when talking about safety, and how these concepts and these phrases are much more complex than what we might initially think. As this participant said here in this art, safety is rarely a single solution problem. Safety is access to nature, housing, food, healthcare, and supportive community. The imagery represents the underlying anxiety that queer and trans people of color experience. In previous oppression-related research and scholarship, the primary focus has been on one identity category, such as sexual identity alone, gender identity alone, racial or ethnic identity alone. Trans and gender diverse people of color are exposed to intersecting stigma and discrimination, as I was saying before, racism, transphobia, ageism, adultism, sexism, and all of these come together and affect the resources that they have access to and their mental and physical health and well-being. A person's identities and social positions, however, are not the problem or a source of mental health concerns. Instead, the problem is the stigma, discrimination, and oppression they are exposed to that are related to their identities and social positions. Intersectionality embraces the complexities inherent across individuals' multiple social identities and positions, acknowledges that one identity like gender and the experiences related to that identity, such as transphobia or sexism, must be understood in relation to other identities and experiences such as racism, ageism, and ableism. And that social and structural factors create and exacerbate the inequities across social, economic, and health based on these multiple interlocking oppressive symptoms. Again, this complex oppressive experience translates down to affecting people in their daily lives and can have an effect both on their physical and mental well-being. Our systems and institutions are typically designed and focus on helping individuals as individuals, to identify and help those who are considered vulnerable or quote-unquote at risk. But really, they're just focusing on this one person, and often the whole person is not really considered. For example, there are many stories of trans and non-binary people seeking care for something like a cold or a broken bone, but the discussion ends up being about their gender identity when really they're just wanting the care that they need. Prejudice, discrimination, and violence significantly affect the mental health of trans and gender diverse people of all ages. These social and structural issues certainly impact people on the individual level, and this can ripple out to communities. But focusing solely on individuals in a conventional sense will not address these issues. Focus is shifted away from and basically ignores the important contextual factors, political forces, and other inequities. And again, these are all factors that go beyond the individual, that affect them. Often, mental health approaches, such as those conventional approaches I was mentioning, suggest that people need to learn how to regulate their emotions when they have experienced some type of oppression, such as transphobia and racism, as opposed to focusing on strategies to address the actual problem, the oppressive experience and traumas. Such an approach for some can be experienced as another aggression against them, so against the affected person. The responsibility is placed on that individual and not on the issue itself. Naming the discrimination and oppression can be healing in itself, and further, focusing on a shift to bolstering strengths and incorporating community-specific and culturally responsive strategies can foster and bolster well-being and resilience. I just spit on myself. It is also important that the work being done in trans health including considerations for research, education, and clinical work is in partnership with trans youth and adults, including trans people of color, and that it strives for community engagement and advocacy. Trans communities have often been left out of knowledge production and in trans healthcare, which can significantly impact healthcare education and the public scientific literature. And ultimately what this means is that it affects the healthcare that trans communities are receiving, as there may be a perpetuation of assumptions, inaccuracies, and misinformation. By focusing on inclusion, we honor the knowledge within trans communities in their own lives and their own healthcare. It helps to foster stronger relationships across these systems and communities, and it responds to the social, political, and structural factors that often are instituted that exclude these communities. The picture on this slide illustrates this point by saying that we need to move beyond focusing only on the individuals and include movement towards oppressive forces, like fighting the patriarchy that contribute to health disparities. Prior studies have found that trans and gender diverse youth experience stigma and incidents of discrimination, ranging from a blatant or explicit refusal of care to microaggressions like not using a person's pronouns or the names that they've requested. Providers also lack education and training regarding gender, including gender identity and expression, which creates challenges for providing pretty much any type of care for this community. Additional barriers to healthcare include trans and gender diverse individuals' fear that their gender identity or expression will be invalidated, or that they will be told their identity is not real, is a trend, because they spent too much time on social media, or that they will otherwise be treated poorly or in an insensitive manner. Such barriers have resulted in trans people avoiding and delaying the use of important health-related services and may contribute to poorer mental health and physical health outcomes, including, as this participant said, facing existential terror. As such, it is important to bolster the strengths of trans and gender diverse people, including youth, and to inform them or remind them of the storied history of strength in the trans and gender diverse communities who've resisted and persisted. Or, when relevant, share about gender diverse communities who may not use the terminology trans, who were and are honored and revered as healers and storytellers and held important roles in their societies. Over time, there have been a number of studies looking at health disparities in the trans and gender diverse populations. Existing research shows that trans and gender diverse people have elevated rates of substance use, experiencing bullying and violence, and they have poor outcomes related to various health conditions and access, and also other systems such as education, employment, and housing. And although this existing research has given us some information we need and has affected some change, as I've mentioned, these disparities are often framed on an individual level. So what can the person do to change these conditions? And this misses an important piece of the story. For example, this participant shared through their artwork that they wanted providers and healthcare institutions to recognize the complexity of their realities as a person living at multiple marginalized social positions. They shared how it is terrifying to work with providers because they're not sure if they will be understood, listened to, or whether assumptions would overshadow the conversation. In their words, they said, "How are we supposed to balance expectations, perceptions, and multiple realities when we are still trying to figure out who we are? Put in the hands of people who never understood where you've been or where you're going is as terrifying as a free fall. We are so much bigger than the rigid boxes they put us in. If only they could step outside themselves and into each other. Recognize that we have power, but we are not all powerful. Give us the tools we need so that we can thrive outside the need to survive." This is an important point, as many multiple marginalized community members sometimes make a distinction between resilience and resistance. Some argue that they are tired of hearing that they are resilient because they don't feel like they have the choice if they want to survive. Instead, they want to resist. They want a life that isn't only about simply surviving. And it is possible, and it's possible to do this without overly focusing on pathology or pathologizing the trans community and uplifting trans joy. Similar to our ancestors who fought for a better future, as this young person said, the beauty the young possess all come from the capacity to dream. to be able to analyze the oppressive power dynamics negatively impacting them and work towards creative solutions for their well-being and for a better future. Resilience is often described as being able to overcome adversity or the ability to bounce back from adversity or something bad happening. To some, it goes beyond this definition, to imagine and create a way of being and living that goes beyond survival, that gives hope, mutual aid, belonging, and connection. Resilience can also be understood as actively finding ways to enhance well-being and promoting growth, which may further buffer against the minority stress and oppressive stressors in their lives. On the left side of this slide that you can see, there's a picture of a zine. And for those who don't know what a zine is a self-published booklet or magazine that has parts of its roots in social and political activism. And so this zine is called Trans People Exist in the Future, a zine of art and poetry celebrating trans resilience. It's free online if you would like to download it. And the picture on the right, called We Keep Each Other Safe, which was also at the beginning of the presentation, is one of the pieces of artwork featured in the zine, along with several poems. So resilience has historically been defined and understood from an individualistic perspective. Over time, the focus has shifted to include community and contextual factors that could promote or hinder resilience. Resilience is something that develops over time, but for many, it is not only about the individual person, but about connecting to others and being in community with others. It is about honoring multiple ways of knowing and honoring what people and community know to be true, even if those truths shift and change over time. Leaning into the wisdom of ancestors, those who came before the person, as well as those currently in their lives. And for some, it's also about considering future generations. It is about integrating all of these aspects in order to learn, grow, feel connected, and be able to thrive. The importance of community and being active in community through conversation and advocacy and activism is an act of resistance against forces that continue to try to harm, create barriers for, and erase trans and gender diverse communities. Although these oppressive forces have significant and negative effects on mental and physical health, trans and gender diverse young people look to community, which can mean many things to many different people. But community are those that work together to keep each other safe, are the ones people can be themselves around and not have to continually hide or pretend or mask parts of themselves. Excuse me. Reading this young person's words, they said, "The butterfly specimen was emblematic of the way that queer and trans people of color are able to be open and vulnerable with their communities, which allows people to see the wonderful things that are often hidden by the need to blend in with surroundings to survive. Being open and colorful is dangerous, but valuable within community." And then for those that are interested, I wanted to highlight two really amazing resources that I'm frequently sharing with people. The first is the Black Trans Prayer Book, edited by J. Mace III and Lady Dane Figueroa Aditi. And it includes poems, offerings, spells, and a range of narratives written by and for Black, trans, non-binary, and intersex people. And then another resource that I wanted to share that is also really amazing is the Queer and Transgender Resilience Workbook by Annalise Singh, again, a by and for trans community book. It is an excellent workbook that discusses the importance of resilience, but it also provides exercises to develop resilience strategies. And so as I wrap up this presentation, I'm going to leave you all with this poem called Beyond Resilience. It is a collaborative poem written by a group of people for Trans Day of Resilience. One person wrote one line, and then whatever was there prior, the next person wrote the next line. And so it was truly collaborative, and it's also a really powerful poem, and I'll go ahead and read it with the caveat that I am not a poet. I'm not trained in spoken word. So where we're going, we can breathe, safe in public, safe at home. We can live out our dreams, not stuck on survival. Clean water flowing free, prisons defunct, abandoned. Trans and cherished, trans and central. Healers, artists, leaders. Forgiveness, empathy, and love. The world we have to imagine. Our genders exist before and beyond your borders, surveillance, and control. Trans and loved. Darling, do not fret. We weren't born for nothing. We were born to be creators. Trans and powerful, thriving in a community that welcomes. Trans and fighting for Jews, people of color, mad people, and Crips. Accepting perspectives, sharing privilege, embracing identity, supporting humanity. Truth is a carapace from the thorns of ignorance. We understand our strength and celebrate it. Where we're going, there are no limits. We are without fear, without chains, without doubt. We speak our feelings and care for our bodies, shea butter rubbed and filled with water. Trauma is not our name. Survival is not our identity. The future is unbound, the chains broken. Free movement for all the Black, trans, disabled femmes. May you move unfettered, flying on the winds of your own deep breath. Truth is the fire in our throats. Dragon-born, we burn down cities and warm our young. We are not limited by transits and portals. We exist out of time and out of place, but perfectly whole. Wanting to be loved, held, pleasured, nurtured, adorned, protected. I want these, I need these, I deserve these. Perfectly whole, with bodies which defy definition, defy standards, embrace fantasy and reality, embrace each other. Thank you, and this is my contacts.
I'll invite our panelists to return to the stage for our next Q&A, and the rest of you can stay close, but know that we'll have a little bit of microphone putting on time. Our moderator for this next session will be Angelique Dwyer.
Hi, welcome back. This is the live stream of the 58th Annual Nobel Conference here at Gustavus Adolphus College. This year, we're focusing on mental health inequities in young people. We just had two very powerful presentations this morning, as well as a performance by the orchestra. The conference is changing over, getting ready to do the Q&A with the entire panel, reacting to the two presentations we heard this morning. But before we do that, to help me set that all up, I've got two fabulous guests with me who are actually hosts of one of the speakers that we just heard. Can I ask you each to introduce yourself, your year and major here at Gustavus, but then also what your role is with the Nobel Conference this year?
Yeah, so my name is Ashley Sosa. I'm a senior communication studies and LILACs major with a minor in Spanish. And my role right now for Nobel Conference is I'm a student host for Dr. Manuela Barreto. So for the last 48 to 72 hours, we've been with her, just helping her stay and making it go as smooth as possible.
Very cool.
Yep. And my name's Amanda Nyakwada. I'm a senior psychology and English double major with a minor in African studies. And I'm another student host for Dr. Manuela Barreto. And yeah, I think Ashley explained our role pretty well. We're helping her have the best day that she can have.
That's awesome.
Yeah.
That sounds very, very busy. I'm glad that you had time to do this. So So thank you both. So you got to hear the presentation this morning by Dr. Barreto. I'm just curious, like initial reactions, things that really stuck out to you or that really resonated with what they were talking about.
Something that really stood out to me in her presentation was the different definitions she had for loneliness, and then how she kind of stepped back and said that it's not an individual thing, but it's more of a community-based thing that needs to be resolved. So instead of placing blame on the individual who's feeling lonely, it's more of the community's fault, that we all need to work together and fix it.
Yeah.
So.
Yeah.
Yeah, and I share the same sentiment. I think the context of loneliness is often ignored, and especially coming out of the pandemic. I think a lot of us probably struggled with loneliness.
Yeah.
So this was a very exciting talk for me to listen to, and I'm sure for everyone to listen to.
Yeah, I mean, so you're both seniors, so you have a unique experience where you were here at Gustavus before the pandemic, before COVID. Then there was a very different type of 2 years where things were entirely remote, then sort of we were kind of back, and now we're back. I'm curious what you mentioned, like, there's loneliness that's sort of built into everyone's COVID experience, but I don't know what that roller coaster of a college experience has been like for you all over these past 4 years.
Yeah, I think it's super interesting because pre-pandemic, it was kind of like you went to go find your community, but then like during the pandemic, everyone was trying to make everyone a part of the same community. So like we're all here for each other. So it was just an interesting way of building connections, because I feel like since we're all on lockdown for like most of like our freshman year, like it was just like everyone was trying to connect with each other. Oh, you're a Gustie, I'm a Gustie. Oh, you go to college, I go to college. It was like finding very minimal similarities and building a community based off of that.
That's interesting.
Yeah, and I guess it was interesting because we had one semester, right? We're both seniors, so we had one semester, and it's this interesting transition. And I happen to be an international student, so I stayed on campus. So that also makes it a bit different. But yeah, it happens very gradually, but then at some point you realize how much of a toll it has on you. Right. And now that things are getting a bit more normal, it's just, just the comparison is fascinating to me.
Well, were there things that you or any of us learned, I guess you would say, over that period of time? I mean, you mentioned that there was like a different type of outreach and trying to connect. I'm curious if there's things that still live on from that time in this area of like trying to make more connection, more community.
I think there's a bigger role of social media now, or like FaceTime. Like, if you don't see a friend, you're like, oh, I'll FaceTime you. Or do you want to Zoom? Or, well, I guess not Zoom anymore, but like Google Meet now. So like, just like doing more virtual activities versus like in person. Like, you don't have to be in person to do things. But now that like there's less restrictions on campus, like there's more people taking advantage of that. Like, let's go do something together. I don't want to message you anymore. Let's go hang out in person. Let's go get coffee, lunch, or something small.
Right. I mean, I am very curious about your experience as an international student coming here and then, having the whole world like change very, very radically. I mean, I've got to imagine that was hard. It's I'd be interested to hear about that, and then what it's been like, as you say, sort of coming back to some sort of normal.
I think coming back to something more normal, I feel like I learned to appreciate social connection more, because I prided myself as an introvert, but there's something very different about being forced to be socially isolated. Yeah. So I definitely am looking more for connection. It's made me appreciate that a lot more. But yeah, as for like my experience as an international student, I mean, on one hand, I had Gustavus all to myself, so I had this large space where I could exist, but on the other hand, it's me and my dorm. Yeah. So it was a tough experience, but I think there's a lot to be learned from it, and that goes to Dr. Barreto's talk about how loneliness isn't just like all bad, it's also like a call to change something in your life. So, yeah.
Yeah, and also to the part she was talking about with it not being about the individual, or we want to frame it as, oh, this person is lonely. It's really sort of a community responsibility for that. I mean, this is a part you can be totally honest, like, it's just us chatting. I am curious, like, how you feel like the community here does in reaching out, whether it's like students or the college, whether there's things that are good, things that you feel like could be better. I'm honestly, sincerely curious how you feel like Gustavus is in trying to create that, I don't know, anti-lonely community.
I feel like there's so much on campus, like every single week. Like there's always an activity. Like you see it on social media, there's posters everywhere you walk. So like there's always something for everybody. Like I'm really trying to get into embroidering, so I'm like holding myself accountable. I need to go to at least one embroidery event. But like there's something to always try, which I think is really nice. As a private institution, there's more money allocated to these events and like different like stuff for different students with different interests.
Yeah.
And I think we do have a very welcoming community. Like, I guess it comes to the Minnesota nice. But
Which is a complicated thing.
yeah, it's just complicated. But yeah, we have a very welcoming community. And as Ashley said, there's a lot of activities on campus, which you also get to appreciate more after having like COVID years where there was nothing to do. So yeah, I think Gustavus is doing a pretty good job.
That's good. So we've only got about a minute left. I am curious, are there ways that you imagine sort of taking some of these things and into the rest of your lives, into your career? Are there things that you're still thinking about and you're like, I gotta think more about this aspect of what we've talked about?
I think listening to Dr. Barretto's lecture, I'm a communication studies major, so I just want to investigate more how our communication styles impact how the types of loneliness we feel.
Okay.
Yeah. As a psychology major, this talk was like very close to this conference is very close to my heart, and just getting to see these professionals in their field and how they carry themselves has been a great experience for me, so yeah.
All right. Thank you both so much for taking this time and chatting with us. We are just about to cut back. I'm sorry, I'm getting like different messages in my ear. So we are just about to cut back to the main conference here at the Nobel conference this year. We've heard 2 presentations this morning, and so now what happens is we bring all of the panelists back up on stage to reflect on the 2 pieces that we heard this morning. Primarily, our first talk was on loneliness and how that shows up in a variety of different ways in community. And then we had a second powerful talk on the transgender and gender nonconforming experience and how that plays into this conversation we're having on mental health and equities in young people. So they are getting the entire panel back up on stage. Dr. Lisa Helke, the director of the Nobel Conference, is going to be up there and helping direct a Q&A. I will make a quick note. It is very open and encouraged for you all to submit your questions. If you're watching, you can email those to nobelconference@gustavus.edu. So if there's anything that you heard this morning, or frankly, if there's anything that you didn't hear this morning and you'd really like to hear the presenters address or reflect on, this is a great opportunity to submit that. We actually got to meet some of the students yesterday who helped bring those questions up to the front of the room. So it is real, like that. You are helping drive that conversation. So submit those questions. Again, the email address is nobelconference@gustavus.edu. And so, without much more, we are going to pull away from here and go back into the Lund Arena, where the Q&A with our entire panel is just about to begin. But please stay with the live stream through the Q&A, and then we will be back right after that with more presentations. We're actually going to talk to the hosts of Dr. Nick Ryder, who was our second presenter. So we'll have a lot more later this afternoon. I'm going to stop now and turn it back over to the Lund Arena, where we will have our panel Q&A. All right, thanks so much.
We're vamping a little bit because we wanted to wait until our online audience returned to the stage. Again, Tane Danger is ably managing that. I'm a little jealous. For the last 2 years, I got to be the person online standing in front of the green screen, but I have to say, it's much nicer being with you all in the flesh. So again, Angelique, yes. Yes, here's to in-personness and also onlineness. Angelique Dwyer will lead off the questioning for us.
Thanks very much. Well, thank you very much to Dr. Barreto and Dr. Ryder for your wonderful presentations on the importance of the paradigm shift, right? Focusing more on community and less on individualistic aims. I'd like to allow questions now or welcome questions from the panel.
Sure, yeah. Well, first of all, thank you so much for your talks. The overlaps and divergences were so fascinating to see, and the themes that you brought up, and also your attention to multiple forms of marginality was really, really important. And one thing that I noticed, and I wonder if you could both expand upon or maybe be in conversation with one another, is the distinctions between community and being in community, and thinking about how that shapes things like mental health, resources, stigma, thinking about the idea of choosing community, but sometimes how community gets chosen for us, and sometimes those communities then, if they're reflective of our religious backgrounds or cultural backgrounds, have innate, stigma sort of built in. So just thinking about maybe just that conversation of being in community, because I'm sure maybe that's a phrase that some people haven't heard before, and so how those work together, or sometimes not.
So I'm not completely sure I understand the distinction you're making, but I do see an important one, so I'll go with that, and then we see. So one way of looking at community would be a community based on the identity that is being marginalized. So, for example, the other autistic people that I know, or other trans people. That community, a community of identity. What I was talking about was mostly a community of place, so more the school community, the workplace, the neighborhood, the city, the country, And I was talking about that because that includes those who do have that identity, those who don't, those who have power, those who don't, and those who can actually do a lot structurally. So, thinking of the example of schools, it includes teachers, it includes administrators, it includes people who can actually think about how these issues should be tackled in the school to make sure that, one, there's less homophobia, for example, and two, that when there is, it's clearly sanctioned. It's not tolerated, and that's a clear message that is given. And it's handled, it's dealt with. So that was my focus during this talk, but obviously there is the other one, and I think you were focusing more on the other one. Is this the distinction you were talking?
Yeah, just running it. Yeah, Nick, you had something to add.
Yeah. Do you want to?
Yeah, I think that what Dr. Barreto was saying is that there's this scientific understanding of what community is, and this may be different kinds of systems, like healthcare systems, school, housing, these kinds of things. And then there's also this part of being in community. And I think that one of the things that I would challenge a little bit was that, I personally think you get to choose who your community is. You may be born into a family, born into certain contexts, but that might not be your community. And I think that's an important distinction to make, and I think it's really important, especially for some marginalized communities, to say, no, this is my chosen people. These are the people that I feel trusted and safe with. And so I think for me, that's the distinction between in community versus a community from a scientific standpoint.
Mm-hmm. But I guess another thing I also wanted to say, and it might apply, I think it applies in both notions, but it perhaps a bit more in the one I was talking about, is the idea of not romanticizing communities, to be sure that communities are a source of strength, but they aren't always a source of strength. They can always be a source of exclusion, precisely, and that holds in both cases. So, I know, for example, that in LGBT communities often there is a lot of racism, and vice versa. We need communities, but we need to understand that the communities are defined by boundaries, and those boundaries need to be thought about very carefully. They are also usually defined around prototypes of what it is to be a good community member, and those need to be elastic, they need to be flexible, they need to respond to the membership rather than be fixed. Otherwise, they really end up representing no one.
I just want to note here that psychology has numerous subfields. And when you think of a psychologist in mainstream America, you might be thinking of professional psychologists who are trained in clinical psychology, counseling psychology, school psychology, learning how to do assessments and tests and measures and how to diagnose people with mental health problems, how to do counseling and guide young people in career paths and so on. And that is the majority of people who are acting as psychologists. But in terms of subfields, there's a really important subfield called community psychology, which has existed for over 50 years. And it's a group that really rebelled against what they felt as the constraints of clinical psychology back during the 1960s when there were a lot of progressive politics at work. Community psychologists really wanted to get out of the healthcare setting, out of the medical model or approach to people's problems, and to make communities, locations, people living in settings, as sort of the main focus of activity. They engage often in what is called action research. So it's not just knowledge for knowledge's sake, but knowledge that can help to transform life for people in community, undo social injustices and so on. And this is a field that continues to persist today. It's sort of small, and there's not the clear sort of job path in community psychology that there is in clinical or counseling psychology. But for those of you or young people who are still thinking maybe about psychology, I'd just love you to as we think about these issues of reframing away from the individual, recognize that there is a branch of psychology very committed to thinking about engaging with communities or citizens or people in processes in which solving their own problems on their own terms is really the whole point.
Very important. Thank you for adding that for all of our students as well. Other areas we'd like to explore with questions or comments? Yes.
I wanted to ask, I guess, both of you, thank you for the wonderful talks, about something that was on my mind as I fully agree with the kind of broadening the focus to the community level, I think, for almost any major public health issue or mental health related issue. But at the same time, I kept thinking to myself, the little that I know about kind of research on social relationships and mental health is that it's the quality of relationships that matters more than the quantity, or having just a couple of very good close relationships actually predicts mental health better than having a large number of kind of less close relationships, even if those are supportive. So I just wanted to, if you could reflect a little bit on how that maybe fits into your conception of what's important for mental health in the areas that you're looking at.
Yeah, I guess the first thing I would want to say is that that is definitely true. So that's said a lot and it's evidenced a lot. But what's also evidenced and not so much spoken about is that quantity can also be a precondition for quality sometimes, or at least quantity of people in your network. So not necessarily quantity of friends, but quantity of people in your network. So you need to have a certain level of contact to be able to have that quality. So that's definitely the case. And I think what often happens with these obstacles that we've been talking about is that they affect both. They affect the quantity and the quality, right? Yeah.
Yeah, and I would say this kind of goes back to what Dr. Broda was talking about in her presentation around like some of the research that we have. I think it's important. I think it is true that like a lot of the data and the results say that like having, for some people, even one person that's like close that they feel safe with can improve mental health and feeling of connection. But I also think it's really important how the question is asked, because there's some questions that get asked like, do you have a person in your life like that is an adult or another person? It doesn't really even say like, is this person a friend? And that is a very different question than asking, do you have a person in your life, adult, peer, fill in the blank, that you feel safe having talking about your problems, for example, and being able to say like those questions are different, and I think that that's important for contextualizing some of the research that we have. And I think that also gets a little bit to more of the nuance around like the quality of a relationship, because you can have a person in your life but never like talk to them, right? But the person, the person, they're in your life, and then there's another when you have someone that you can really talk to and confide in.
I guess I'm also thinking about what you said first about the public health angle, and I'll just take the chance to have my little rant about that, because yes, it has been extremely important that loneliness was highlighted as a public health priority. I think it has been very important to mobilize resources and attention for the problem. But it has also had some side effects that were not so positive. And some of them was the medicalizing and the sort of individualizing of this, paradoxically, I know, because that's not what is intended. And one of them, I don't know how many people have heard about it, but there's this whole idea of developing a pill for loneliness, which I don't know if it's hilarious or problematic. It's both, really, because, you know, what are we talking about then, really? But then again, I guess we could say the same thing about depression.
I mean, that's interesting. It seems to me that the question of why we need to counteract or counterbalance the individual focus of some of these issues pertains to why it slips into a medical frame of reference to begin with, which is that's where resources are, that's where expertise are, that's where there's someone tasked with doing something that could make a difference. So you can certainly medicate people who are lonely, and some of them will feel better. Is that the right thing? Is that the right responsibility? I think we're saying no. At the same time that you can see then why it becomes individuated, it becomes medicalized, which is all about taking a patient and having a doctor work with that patient within a healthcare system that's paid for in certain ways to help a person feel better. That may not be the remedy for society, but who else in society is tasked with really thinking about this and doing something about it that matters? And so in some ways, I guess my question for you both is, how optimistic are you that the call to reframe away from the individual to societal level interventions that change structures and systems instead of individuals is actually going to make a difference?
Well, I think we are at a particularly good point for, at least in my field, in the focus on loneliness, because silver line, the pandemic silver lining, has really given more attention to loneliness, and people have become all concerned about it at political level as well. And unfortunately, not necessarily in the right way, but they're still listening. They're still listening. And I think a lot of these issues could be talked about in different areas, in different ways, perhaps would have less, they would be listened to less. But if we tag it onto loneliness and to those discussions, perhaps this is a good time to be listened to. You know, I've been working now with the Wells Center for Public Policy, for example. They are wanting to listen. They are wanting to develop an implementation plan now. And if you don't do it now, perhaps you miss the boat. Is the boat that you miss? Yeah. So, yeah, a little bit hopeful.
Yeah, I say hopeful as well. I lean into my hopefulness, and I think part of it is because I do see change happening, right? And it may not be at the pace that I would like, but it is happening slowly, and I see it on multiple different levels. Like, we see interventions in schools now, or at least programs being created in schools, even though there's still some problematic ones, but we do see some really helpful ones, like around bullying or including different communities in curriculum, although we have a problem right now with book banning. But we are also seeing policies being changed. I'm reached out to very often from different psychology programs and medical schools about, like, how do I change our, like, policies and practices to actually, like, include, like, gender diversity or intersectionality framing of these courses. And so I think it's, again, like, it's a slow change, but it is changing. And this is beyond the individual, because then we're training in a different way, we're educating in a different way, we're being more inclusive. That isn't just like being like, you, the individual, need to use this coping skill, right? And so.
Well, I have some questions from the audience that are relevant to what we're discussing, but would anyone else like to add before I transition? Great. So how do communities and school districts in particular support LGBTQ youth, especially transgender and gender-expansive students, in settings where doing so may actually draw attention to them from those who preach hate? And how do communities navigate inclusion for each group when one group's cultural beliefs are in direct conflict with another's?
Well, I have a grant being evaluated right now to find the answer to that question. But I think it has to start, and I'm sure you'll have a lot to add on that, Nick, but I'm sure it has to start with speaking to the pupils in the school. Also to the school, to the teachers, to the administrators, but above all to the pupils, to really discuss with them what the experiences are, what are the key issues, what are the ways in which people can be respectful of each other's needs, cultural, social, inclusion needs. There is no easy solution. I don't think we should even pretend there is one, but that is no excuse to not do anything. That has to be a motivator to really have those careful conversations, and and that also means that the resources need to be available for that. So you can't do this by going in for a morning and leave and there's a program. You know, you need to take time, you know.
Yeah, one of the things that I think about is that for a lot of systems, like school systems, to change, they want to see the data. They want it to be like quote unquote evidence-based, even though we have like tons of anecdotal evidence, like youth coming and talking about their experiences, right? But they want to see it in numbers. And I know in Minnesota, for example, we have what's called the Minnesota Student Survey, which is a population-based survey across all of the state of Minnesota. It goes out to all public schools in the state are invited to participate in it, and it's offered every 3 years. And for 5th, 7th, 9th, and 11th graders. And so it kind of gives a chance to kind of understand what's going on with youth in the state. And it's also done in collaboration a lot of the times with the school districts. And it does ask questions about sexual orientation, gender identity, race, ethnicity. The questions aren't perfect, but it gives a good idea. But it also asks questions about experiences of bullying, general bullying, and then also bias-based bullying. It asks about health behaviors. It asks about healthcare access. It covers a lot of experiences and behaviors. And this information then goes back to the schools. And this has been very helpful for schools saying like, oh, we really do need to invest in this because our students are the ones saying, like, and rating these things. And this has also been some of the resources used to even create, like in Minnesota and St. Paul, there's a guidance for schools and school districts around to how to be more like trans inclusive or LGBT inclusive. There's like an entire, like toolkit for that and guidance around that. And so I think that there's, in certain places, of course, I will say that Minnesota is a state that tends to be a little bit more progressive around some of this, but there are efforts, and some of these efforts end up getting used as what is this called? A framework for other states. And I know that at least in Minnesota, because this is the work that I'm also involved in, the legislation and the Minnesota state governance is listening and they want to know, and they also then inform schools too.
Would others like to comment? I don't know, Dr. Eisenberg, the work you've done with youth in schools, or anyone else? Okay, moving on. So hearing Dr. Barreto's talk make me curious as to what communities can do to improve the social structure of neighborhoods, where social class is a huge indicator for creating division and isolation. Or what specifically are you seeing in the way of urban design to address loneliness? Any spots particularly innovative? In what ways? Yeah, there are some, obviously, I live in the UK, so I don't really know what's going on around here, and I apologize for that, but I'm sure there are similar initiatives, and if not, then we can be inspired by those elsewhere. But in the UK, there are actually companies that dedicate part of their activity, for example, to urban design for sociality. So they will have, for example, a focus on making sure that if any new neighborhoods are built, that there are spaces that encourage and promote connections, such as communal gardens, sometimes on the roof, if that's all there is.
people's gardens looking forward, or at least some of it looking forward, so that people can sit out and engage in conversation with their neighbors. Workspaces as well as student residence that have social areas rather than just rooms. Social areas often actually at the entry level, so when you get into the building, so you can't avoid it, you can't not go there, it's not tucked away. Making sure workplaces still have the water cooler corner, because in most places, at least in the UK, that's disappearing because, everything grows except for space. And so, you need to occupy everything. So that's in terms of structure and architecture, but also in terms of parks, availability of parks, making sure they are well maintained, because you can see in my own neighborhood, we have a really nice park, and you can see, when there's a public holiday and it's not cleaned, then, people start running away from it. It's full of dirt and it looks violent, it looks unsafe, it looks aggressive. People don't go, and those who go will contribute to the dirt, because that's what you do apparently here, right? And that's not conducive to a positive sense of company and connection. So a lot of it is really quite structural, quite practical, and this is also why each place is a place. You need to look, that place, what does it need? And it is about speaking with the population. But there are also other little things that we need to be aware of. So, when you create Facebook groups or WhatsApp groups for communities, to really keep an eye on the fact that a lot of the bonding that goes on in there is done around very restricted ideas of what it is to be a community member. So for example, when the pandemic started in my neighborhood, they created a WhatsApp group that I was placed in, and in 2 days I left the group because it all became very much about Britishness, and I'm just not part of that, and it started feeling very much like I wasn't part of my neighborhood, which was a thing I didn't want to happen, so I left. So that wouldn't happen, but some people might have stayed and received that more frequently, and started feeling quite left out. And so little things like that, if people become more aware of what they're doing, yes, they're functional for some, but they're actually really bad for others. So we need to think about those better. Yes.
So I could see people kind of rushing to develop interventions and programs that address loneliness. Do you have some design issues that you would want to share with people, or cautionary notes? Because I could see different groups have vastly different needs, and if we are really going to address loneliness, you have to have a different program for different groups of people. And so I just don't want people to come away from, these sessions we're gonna fix loneliness.
No, well, I would love it if people had at least the motivation, but to actually do it, yes, I do think you need to, not be too, and this is also why in my presentation I try to focus on different sources of marginalization, so that people would be thinking about these multiple groups and how different they are and how their needs can be very different. There are some similarities though, and the whole idea of exclusion is a very important, the idea of lack of voice is a very important one. The idea of making sure people do have voice, and that's not the one person who comes up, it's reaching out properly. They are there, they're not hard to reach. It's just we need to make an effort. So to go and speak to people. And we can also have multiple solutions in one place. So it's not like, the school can only have one gay club.
Right. Yeah.
Let's not focus on racial minorities. We can only do a gay club. Now, we can do different things. But what I would also say, and I guess you might also be flagging that, is what Nick was talking about earlier, is the importance of teaming up with people who can actually think about the design behind it. So the collection of evidence. Because without that, number one, you can be doing more harm than good. Number two, it cannot proceed because you will then eventually need funding to support that activity. So these are things that are quite important, and I guess you were referring to that as well in your. But I'm sure you have ideas too. So.
I think a lot of the challenges are some of the challenges that I'm coming up with, where I think you have to design digital literacy programs, for example, like for different groups, because they have such vastly different challenges, right? And my main concern is, when I see programs or courses that try to include everybody, 2 weeks on this or a week on this, and we're going to solve these different issues or address these different issues or teach people anything meaningful, in that little chunk of time. And so, yeah, I have the same, advice that we really need to be thoughtful and, bring in communities that you want to design for. And always keep their unique experiences, as the primary focus.
I wonder if I could follow up with a question, which is about loneliness in particular, and about where you think it comes from. Sometimes the origins of a problem help to give insight into what might be done about it. And, we've had this phenomenon referred to as bowling alone, the idea that people, for whatever reason over time here, and there's probably lots of explanations, I'd love to hear what you think where the action is in this, but are loosening in terms of their social ties. The bowling alone idea is that people used to be part of a bowling league and go out every Tuesday night and bowl together, but that now people don't do that as much. And so there's been an attenuation of the links or connections to churches, to the being on the school board, to all kinds of aspects where people used to assemble in communities and not be so lonely. And yet, we're somehow becoming more individuated, more individual, disconnected from those things, and now we're trying to fix it. But I'm just wondering, where do you see the action as for why? Good Marxists will say it's the economy. So people, since recessions and, have to struggle more to make ends meet, there's no time left for that. Or what? I'm just wondering how do you diagnose the problem exactly, the origins of the problem?
Well, I guess, God, I'm not that insightful. I think there's a lot of different reasons, and I would definitely say the economy as well, and neoliberalism, and the pressures to compete and provide and work all the time, and have very little time for sociality, and so on and so on and so on. But sorry, I got lost. I got lost, sorry. If anyone else has anything to say, let me think.
I have two questions, or maybe sort of follow up to what maybe help you bring up your thinking. Do we see kind of cross-cultural differences, cross-country differences, especially most of the world actually are more collectivistic?
Yes,
than
that's exactly what I was going to say.
So do we see differences?
Thank you so much. No, yes. So I just wanted to note that obviously it's always easier to understand our own corner of the world, and that's the description you just provided, and the Bowling Alone book are very much US focused, and that's true of other countries as well, not unique to the US, other countries as well, but countries are very different and have been moving in very different directions. So it doesn't really necessarily apply to other parts of the world, and what I've found is indeed more loneliness in more individualistic countries than in more collectivist countries, precisely because one, the strength of community ties, but also the type of ties. So in more collectivist societies, you tend to have more dense social networks. And so if something falls, you're still stuck. If you imagine a web, you're still stuck to the network. You're not let loose because everybody is connected. If your cousins and your aunts and you can't really get rid of them as much as you might want. You're not loose. Whereas in more individualist societies, the social networks are above all based on chosen relationships, so friendships and acquaintances and colleagues. And so if you can quite easily actually be set loose, at the same time you have a choice. So if things go wrong, you have a choice. You can rebuild your social network. So there's advantages and disadvantages there, but they're less resilient. And I think the other thing is also, and one of the common critiques of the bowling alone idea is that there is many other communities and many other ways of being sociable that are more on the increase. So, for example, interest-based groups. activities that are done online instead of offline. You know, there's a little bit of questioning of the truth behind that kind of observation as well. So, yeah.
Yes. And I realize one group we haven't maybe explicitly talked about is just thinking about displaced populations. So we've talked about like place and community, but people for whom that place and that tie is severed, whether that's through war or colonialism or climate catastrophe. And so the extent to which, I guess, like there's this ideal of place and community and place-based community, but the ways in which it can be hard, if not impossible, to like reestablish that connection to the physical environment and like how to cater, I think, mental health resources specifically for that kind of that disbursement is something that I think increasingly, due for various reasons, is something should be prioritized.
Yeah, and often what those mental health support for displaced communities, of course, it depends on what displacement we're talking about, whether people are going in groups or isolated and so on, but often it's provided in groups, and that's for a reason. It's not just so that it's cheaper. It's also because it's a collective phenomenon, and it facilitates the building and solidification of ties. So that's important too. So it is both a physical issue, so now I'm not in a place that I recognize as me. It's a psychological sort of well-being, mental health issue, but it's also a loneliness, social issue. So it's all of those at the same time. And they often do go together, right? So this is why we speak of loneliness in the context of mental health.
I do think we can't underscore enough, so thank you for sort of bringing up the idea that not only how permeable we need to think about our communities and ties, but also sort of the importance of like spaces. So I think, like oftentimes people are like, oh, just because you have a cultural center or LGBTQ and women's center, it doesn't mean anything. Well, that symbolizes, I think, for a lot of people, like I can go there and for a sense of belongingness, and my voice is, like people can see it, and I can go there for some support. I think sort of thinking about, broadly speaking, outside of individual consulting room, I'm a clinical psychologist, right? So thinking outside of how we fix, quote unquote, this individual, what are resources that we can glean, even from the design of our built environment, or the systems that we need to support our livelihood. Like I'm working with an engineer actually in Dallas, and they have had really, like you presented very like cool data as well. I think data is knowledge. I think just being able to see that there are these infrastructure deficits, and they tend to be represented by people of color, people of impoverished backgrounds and lower income areas where there are no green spaces, where there are no sidewalks, there are no parks, and there are these food deserts. So you can't get fresh groceries, or it's very expensive. You have to travel far, and the green spaces, it can help with air pollution, noise pollution, all those things that we don't think about but are very insidious to not only a sense of loneliness that you're speaking to, but also just mental health and thriving and physical health for sure. So I think having like a lot of kind of the data that you have shared, the types of analyses that we need to use to sort of overlay individual health, population health on top of built environment, and to show the legislature and also architects who are designing neighborhood zoning and all those kinds of things are just powerful.
Yeah, and I think one of the things that we need to just also make very clear is that architecture is only an aspect of it, and urban design is only an aspect of it. It's a very important one, I think, much more than we're used to thinking about, but it needs to go hand in hand with listening to communities and with a more sort of social sciencey approach, because it's very easy to regenerate a community in the wrong way. And there's a lot of evidence for really broken communities due to regeneration. So regeneration needs to be not just about buildings and spaces and parks and cleans and paint, it needs to be about people as well, and respecting what is it that they want. Is it the swimming pool or is it the community center? Where should it be? Who is it going to affect? Who is going to have access to it? And who is going to be displaced as a function of this, because that often happens as well. And what ties are going to be broken? Often these are deprived communities that really people really rely on each other a lot. So to break that is really to break a person's pattern of life and relational network.
I just wanted to follow up on that a little bit, Manuela, with a kind of a crazy question. Some of you know I'm a philosopher of food, and one thing I'm really interested in is the notion of the Food Policy Council, which, obviously policy councils, everyone wants to join those, right? Okay, no, but what a food policy council does is says there's this nexus of issues that are connected to each other that cut across myriad demographic groups, but that says we're all interested in healthy, safe, culturally appropriate, affordable food available at all times. And what it does is says, what are the bus routes in this community? It brings together all kinds of people who might otherwise be on very different sides of an issue. And so I'm wondering if you can think of if I'm crazy, or if I'm not crazy, are there other models like that enable us to maybe say, I'm finding common cause in an unlikely way as I form community?
No, I don't think you're crazy, at least not based on that. And, there are...
I think that was a left-handed compliment, my mother would say.
At least not, there are people thinking about that kind of food as a way of uniting people. I think even the most culturally narrow, to put it in a nice way, people will appreciate tasting other people's food. So, food is a really great unifier. And so there's that happening. And there's also some other related things. So one of the projects that I'm remotely but connected to is a project that has to do with primarily thinking about physical health of people in rather deprived communities who have very poor mobility and who basically weren't eating enough and were really very frail. And, so the project started with how do we get food to these people, good food, not just any food, not just calories, but good food, things people want to eat, and make sure. And then I said, well, what about talking to them as well? What about actually giving it 20 minutes instead of 5 so that the person can actually sit down and have a chat? And what about it being the same person every day? What about, And so we've piloted a system like this, and so far so good. So, there's lots of things that you can do that bring things together rather than having a plan for this and a plan for that, and they're all disconnected. Yeah.
Mm-hmm. Thank you.
Yeah. I do wonder if there's not also a really big issue at stake in all of this, which has to do with individualism and what we might think of as alternative, whether it's collectivism or there's different ways people language this. But in terms of individualism, I think that what you see in places like America and other affluent European societies, for example, historically, is that individualism emerges from great wealth or affluence, which came from plunder of the rest of the world through colonization. And in any case, it gives rise to the ethos or the primary values of individualism or egocentricity, which are really choice and freedom. Interdependence or sociocentric self-configurations, you might want to look to a kind of Marxist explanation. People end up in those kinds of self-configurations because they depend so much on each other for resources, for example, when there's not enough of them. So I guess my question is, once someone is affluent enough to have choice and freedom instead of what we might think of as the ethos or values of a sociocentric self-configuration, which are roles and duties, do people everywhere choose choice and freedom over roles and duties? And to what degree is our criticism of the social structures in which we're socialized and live in really override any interest in roles and duties because of patriarchy and racism and all the kinds of things that have structured those things versus the sort of choice and freedom. And I just think that we live, it seems to me, in an identitarian moment when we're perhaps obsessed in, certainly on college campuses, which is where I spend my time, with our identities. And I just wonder how much that is about choice and freedom in an individualist urge taken to an extreme. So I wonder, what does interdependence look like in the context of affluence? And who picks it? And how do they pick it? How does it get structured?
I think we will remain wondering about that because it's a very big question, but I do think that choice and freedom are themselves cultural concepts. So, I think, I'm Portuguese. It's not the most extreme collectivist society, but compared to the US and the UK, pretty extreme. And what we believe is a choice. So, the choice to remain in touch with your family, the choice to take care of your parents as they age, that's not a choice. That's a duty for us. But others might see that as a choice. So I don't see there's a box of choices and a box of duties, and we choose. No, what's inside those boxes really varies culturally as well. So,
There's an audience question that resonates with this. So why are communities of a singular identity important? It seems that loneliness and feelings of unsafety could be the result of no regular in-person contact with the communities with which one identifies. What are the benefits, for example, of spaces just for Black queer people? And as safe spaces, are they created for BIPOC, neurodiverse, gender nonconforming communities? How do allies support these communities without imposing or invading their newfound space?
Do you want to go for that?
I just want to make sure I heard the question correctly. So, are there spaces for Black queer people? And can you just repeat that?
So why is it important to have singular identity spaces? So a space, as was mentioned earlier, right, for, let's say, African American youth or queer, trans youth, people of color. So why separate these spaces? Why is that important instead of focusing perhaps on inclusion or on bringing people of diverse communities together?
Maybe I'll give us a start and then you can come after. Yeah, or do you want to start?
You can go ahead.
Yeah. So first of all, I guess I want to say also that just because you're Black, that doesn't mean that that's your identity. So you might actually choose to see the community where you live as your identity. So I wouldn't just say identity-based means race or identity-based means sexual orientation. Identity-based can also mean place. So, just getting it out there. I know that's not the key of the question. But second, yes, those places are extremely important alongside the rest. So it's not either or, it's alongside. And why? Because they are safe spaces of exploration and of, we know, for example, that even with the best intentions, interracial interactions are tense, they're difficult, they're stressful for everybody. They take away years of your life if you did them all the time. So, you have to also have those spaces where you're not constantly struggling, not constantly on your toes, and that where you're free to explore what you do value and what you don't. You do need the others as well, though, because you need to be able to be part of a broader community without boundaries. And so I think that it's not an either-or choice. It's really important to have both, but I'm sure others have.
Yeah, what I was going to say, I had a lot of thoughts pop up, and so I was like, okay, let me organize myself. But adding on to what was said is, I think it's, we have to understand that we all have multiple identities and multiple, social positions among ourselves. No one is one thing. No one is only a woman, right? There's people who are Black women, Asian women, we're all, along with a lot of other identities, right? We all have multiple, and how they all affect us is very differently. And historically, how some of these groups came to be is because certain groups of people were coming together because they felt excluded and they needed a space. And then there were more breakoffs from them. And so when thinking about intersectionality, for example, there was a group called the Combahee River Collective that was a group of Black, lesbian, and feminist women who came together and actually branched off from a Black space because they didn't feel like their needs were being heard or addressed. And so we have these examples in a lot of different spaces where there's these groups that come together saying, we are not being heard, we are not having our needs met, and so we're going to make a group. And then there's other identities within that group that are like, now we're not being heard, but we want to push this forward. And it doesn't mean that it becomes divisive necessarily, because in a lot of ways, some of these groups have worked together for a larger good as well. But it is a space where people are kind of come together and say like, okay, we have this shared vision or these shared experiences. How do we work together to make this move forward? And how do we then bring others along with us if we can?
So in individualist cultures, we are expected to feel completely self-sufficient, but social norms expect us to have a strong and expansive social network. Please discuss this cultural dissonance and its effect on perceptions of our own loneliness.
So I am definitely not an expert on individualistic societies, not having come from one myself, but I would imagine that the second part, that social norm for an expansive network, is probably a norm for a fairly superficial expansive network. So, for example, a professional network that reaches far and wide, but they're not your friends. They're just colleagues you can exchange favors with, or potentially being good neighbors. So that is not contradictory with being self-reliant and self-sufficient, because that network is there on a sort of exchange of, when I say favors, I don't mean necessarily, cold stuff, I mean, favors can be taking care of each other's children, for example, now and then. So those things are important, and they build ties, and they sustain and provide support, but they're fairly superficial. They do not take away from independence and from self-reliance. And I wish people would understand that everywhere and all the time, because those are really important community builders. So I don't think they're contradictory. I think they're done differently in different places. Those people who are in those networks will be different in different cultures, but they are always there. We all have those to some extent. But I guess someone who knows individualist societies better might have more to say.
I'm betting there is someone on this panel. There are several someones, 6 of them perhaps, who have thoughts about that.
Well, yeah, I think one thing that's interesting is, and I think it's a really important concept, talking about interdependence, because, or at least I guess through the framework of disability, in some ways, independence gets valorized and then dependence gets pathologized. And there's a greater movement towards this notion of interdependence, in part because of disabled people needing to develop networks of kinship and aid within the context of societies that were built explicitly to exclude them. And so I think that we can think about interdependence and like designing for interdependence. And I guess I applied design, which is its own fraught concept, but it's not just the design of spaces, but I think a lot about the design of technologies, the design of digital environments, the design of policy, I suppose. And there's been a lot of really interesting work coming out of disability, critical disability studies, and thinking about interdependence as this value that doesn't get kind of talked about or emphasized enough, that it's just this duality, this binary of dependence. You're either dependent or you're independent, and one means something or the other does in certain ways.
Dr. Alper, would you follow up with an example of that, actually? Because I know that you've podcasted about this quite a lot, for instance. And if you could just give a particular instance of a design technology to put you on the spot. Yes, I'm sorry.
Yeah, no, I mean, I guess thinking about youth and like bringing it back to sort of that context, thinking about, my child does things independently. They can independently, play video games or something, but they depend on me to help them with their homework through this, computer technology or something. But there's certain ways that we then, add a layer of, well, don't become too dependent on us. Don't become too dependent. And then at the same time, different values that I'm not kind of phrasing this right, but at least in the context of disability, it's, the assumption that you're going to be dependent, and then we don't give you opportunities to practice independence. But at the same time, what's so wrong with needing other people? Shouldn't we need other people? And why? Who gets to be independent and whose dependence gets to be valued, and who gets to be, independent and their independence be valued or characterized in a certain kind of way?
Yeah, back to Professor Gaughan's point, there's the model of the independent liberal individual is a model that actually described no one ever. It was just that the people who seemed to be independent were the ones who had a lot of people in the background making them appear independent, right? Professor Loy, I think you had your hand
I don't
up.
want to stand between people and lunch.
No, you're not. No, you're not.
I think one thing that I'm just maybe echoing more than anything is in terms of when we think about individualism or collectivism or intra-dependence or interdependence, in a lot of ways, we make it seem like they are on the polarities. Kind of, I like what you said about duality. I tend to maybe think about even each of those styles, if you will, have pros and cons depending on what we're talking about, depending on the functions, sort of how people also make meaning of collectivism. Like, for example, we've done some work sort of understanding collectivism among Asian and Asian Americans, and there are actually, yes, it can kind of have a sense of cohesion and supportedness. At the same time, there are some are perceived as a duty or obligations. Like, if you think about my identity, I don't represent just me. I'm not my own person. I also represent my family, and shame and honor. So if I am not doing well, that means my family is not doing well. And that could be a burden, and that actually can have negative consequences to young people's or even older adults' mental health as well. So I think it's kind of, it's neither or, it's holding the dialectics and kind of it's both and kind of depending on sort of the functions of some of these beliefs and values and how they apply to certain maybe outcomes or behaviors or we're speaking to. And I think that makes it's interesting, but a lifelong journey of kind of thinking about these issues. So I think that makes it important to kind of think about when we, maybe teachers or professionals working with individuals, how do you make meaning of this particular value? How do you live it? What does that mean for you in X, Y, and Z outcomes or behaviors?
Can I just add, there was a question about why people need these same race, same gender spaces. And so Black culture is glorious, right? It drives popular culture. When I'm around other Black people, I feel safe, that safety. I feel like I can be all of who I am. I can ask questions, and not have people think a certain way about me. So Black, queer, and trans people need those spaces because it may be one of the only spaces where, they feel seen, where they, can be all of their glorious self. And so for people questioning why folks want to be by themselves, it's probably one of the few spaces where they can be all of who they are. So, yeah.
Maybe one last word about independence and interdependence, which is to say that all of humanity has the capacity for and has to engage in both independence and interdependence, depending on context and so on. I think maybe the way I think about this is that these are cultural affordances, and that different societies socialize people into differential resting or familiar or customary ways of engaging in those different options. And so really it's a question about what are the resting, normative, or familiar styles that are called for in terms of these self-expressions and self-configurations in given societies and at given moments. And so of course all of us feel connected to our families and have obligations to our kin and those kinds of things. But for some families, it's incomprehensible that you would go away to college 1,000 miles away and then take a job in a big city across the country. Incomprehensible. Like, who would do that? They are abandoning home, family, all that matters, versus others for whom that's so normative, it's not even ever asked as a question of whether you should go to the most elite school as far away as it is, because, of course, you're trying to advance your career, build your network, and express yourself in choice and freedom, in finding happiness through money or career kinds of things in the way we do in America.
Because our speakers have all been extremely diligent in staying into the time frame, we actually have time for another question before we will adjourn for lunch. So thank you to all of you for actually reading the part that asked you to confine your remarks to half an hour. You've all done it. That never happens.
So Dr. Ryder mentions the importance of honoring the knowledge that already exists within the trans community about health and well-being. How can institutions, communities, educators, caretakers, and peers honor the knowledge that adolescents of diverse identities have about their lived experiences? Often adolescents are discredited for being young and naive.
Yeah, I think that adolescents are amazing. I love talking to adolescents, and
there's 3 adolescents.
Yeah, I was like, that was it. No, I really do, and I think that they hold so much knowledge that similar to what this person was saying, they get discredited or they get dismissed, but they have so much to give, and I think that this is important in the systems that we're in, like to actually listen to all of the communities that we're working with. And I know that for adolescents and trans and queer adolescents, it's been really important for some healthcare institutions to even have a kind of an advisory group. It's sometimes it's called a patient advisory group where they actually are advising in some kind of ways. And I think that it's important to have spaces like that. Also get feedback, right? There's a lot of ways to do that. There's ways that you can give surveys or actually have people built who are in community listening, because communities talk all the time. They tell especially in trans communities and and I know other marginalized communities, they tell each other this provider responded in this way to me, in a positive, neutral, great way or negative way, and then some people will never go to them or will go to them. There's this networking that happens, and some people are willing to share that and say here's how you can improve, but it's actually giving youth and others the space to actually do that and compensate them for their time.
Other thoughts about adolescence and the power that they hold to transform society?
I'll just note that I've recently become aware of some of you probably already know a lot more than I do about this, but a term, youth participatory action research, which is sort of a youth version, I think, an extension of community-based participatory research. And YPAR is the acronym, YPAR, just something to look at more and read more, because there's a whole kind of thriving network nationally and internationally of researchers and youth organizations and youth. And the basic idea, I think, is that youth are not just being asked what they think, but they're actually co-leading the research and the programs that come out of the research.
Well, thanks to all of our panelists. And just a reminder that you have lots of opportunities over the lunch hour. There are 2 new sets of workshops, also the Learning Lab and the Mental Health Fair in the basketball part of Lund Center. Again, you can walk in the Arboretum. It's another beautiful day, or tour the Nobel expansion. Use the facilities of the Bonnier Interfaith Center or the Christ Chapel if you would like some contemplative time. And again, I think it's page 27 of your schedule includes information about food. We will reconvene for music at 1:45 this afternoon, and the lecture will begin in the 2 o'clock zone. So enjoy yourselves over the lunch hour. Thanks.
Great.
Or hair. I'm scared. Or should I keep I'll keep my hands here.
Okay. Hi, everybody. Welcome back. This is the live stream of the 58th Annual Nobel Conference at Gustavus Adolphus College. My name is Tane Danger. I am a 07 grad of Gustavus, and I'm your host for the live stream. We are taking this time while everybody at the conference is going to lunch to do a little debrief, to check in with some folks who've helped pull this conference together, and I think most fun and interestingly, actually get some reactions and feedback from students and faculty who are immersed in this work. So we heard this morning two really powerful lectures from two of our presenters, followed by a very thorough and engaging Q&A session with all of our panelists reacting to that. So hopefully you got to see all of that. What we have now are two students who actually were hosts of one of our speakers and obviously have been connected with and part of this conference from the beginning. So if you all don't mind, would you please introduce yourselves?
Yeah, I'm McCall Walker. I'm a senior psychology major here at Gustavus.
And your role with the Nobel Conference is?
Yes, I am one of the two student hosts for Dr. Ryder.
Fabulous.
My name is Jay Michelizzi. I am a senior philosophy major, and I am also a host for Dr. Ryder.
So you both got to spend some time with Dr. Ryder before we got started, and then you got to see the presentation today. Reactions, things that you saw or heard that were like, oh, wow, this is really resonating with me. I'm still thinking about this.
I think that this was a topic in which we were able to hear both about trans identities and people of color, I think is amazing, because often we only are allowed, I guess, to hear about one marginalized group at a time.
Yeah.
And so I think, the intersection of different identities really changes the conversation. And so being able to have that space to talk about that, I think, was really, really important.
Yeah.
Yeah, I would agree. Their focus on intersectionality is really important. I feel like especially in science and in psychology, we get such a Western and white and heteronormative view of everything. So we were also able to engage with them in a student discussion yesterday where they kind of gave us even more insight on like how hard they've had to really fight and push to be able to study what they're really passionate about, which is really cool.
Can you tell us more? Because this is a little like behind the scenes thing. I mean, the vast majority of folks who are watching at home, like, will ever get to be part of one of these student engagements. Just what is that like? Kind of paint the picture for us of what that was like and what you all got to talk about.
Yeah, so we were in a exclusive student discussion.
Very cool.
Where we had Dr. Ryder and Dr. Gahn actually at the same time, and we were able to ask them specific questions about their work, or even just like how they've become so successful in the field. Dr. Ryder specifically talked about how like mentorship was really huge for their journey, and how having supportive leaders in the field and people who push you to be, brave about what you're studying is really important.
Yeah, and I think that it's really important for people who are non-binary and gender non-conforming to be able to see like a role model. Right. Someone who has a platform who they can look up to and say, like, I can be that. Because I know Dr. Ryder had said both at the student conversation, and I think they mentioned it briefly in their talk as well, that, oh no.
No, I was actually going to say the same thing. Like at the very beginning of their talk, they mentioned that, this talk is for you, for transgender, non-binary, because we aren't often represented enough in our own work in this space, and that's really important.
Yeah, I remembered. I was gonna say like that. It's not a trend. Like we're allowed to be in professional settings. We're allowed to be present, and I think that is really, really important to see that.
Yeah, absolutely. We're going to bring in, we have actually one other guest who folks probably saw actually do the introduction for Dr. Ryder and was the faculty host for Dr. Ryder. Hi, welcome. Hi. So glad that you're here. Do you mind quickly introducing yourself, your general role here at Gustavus, and then here with the Nobel Conference this year?
Yeah,
Larsa Donnellan. I'm faculty in the physics department and gender, women, and sexuality studies. I'm also the faculty advisor to our Queers and Allies student org. And my job here is to be the faculty host for Dr. Nick Ryder.
And we were just having a conversation about Dr. Ryder's presentation, things that struck out to each of us and are still resonating with us. I'd ask you the same thing. You know, I know you got to spend some time with Dr. Ryder before, and now we heard the whole presentation this morning. What's still sort of rattling around for you?
I really appreciated the conversation on intersectionality and how there can be these multiple forms of stigma and discrimination that intersect to create these unique and complex experiences, and that you can have multiple identities.
Yeah. Yes. This is, it's like that is one thing I think we all were really taken by how strongly that was made and concisely that is a huge piece of this puzzle that, you know, we heard a little bit of this yesterday, and then I think Dr. Ryder today really drove home, like, you can't boil this down to one thing. It's all these different aspects together. Can I ask you two about a conference like this, these conversations that we're having, thinking about how that potentially informs your studies now, but then also like where you might go in the future? Are there things that you're like, yeah, I'm holding this and it's really valuable as I think about what I'm doing now or what I might do next in my life?
Yeah, go ahead.
Okay, so I'm a psychology major, so I'm incredibly interested in working with youth, mental health, trauma, all of those hardships that come with racial identity, or just any marginalized identity as is. Dr. Ryder has also written works and done studies on like protective factors and stuff like that, which is really interesting to me because I think that so often we are very reactive to our youth and we just kind of wait for something bad to happen before we can like interject. So their work on that is really, I think, going to help me shape how I interact with people as well and trying to prevent these things from happening or protect them. So
yeah.
Yeah, I'm a philosophy major, but I want to go into social work. And I think seeing all of the different disciplines that can come together to study youth and their mental health is really important, and seeing how taking an interdisciplinary approach is like super beneficial to these studies. If we only focus on one aspect of it, we're really only getting one type of picture. And so, yeah, I really value that.
Yeah. What are the pieces that both Dr. Ryder talked about, but then our first session this morning also talked about, it came up yesterday too, is this importance of having groups, having identity groups that you both fit into, that also potentially stretch you. As we said, a lot of this gets complicated because we're looking at it intersectionally, and yet that's a really key piece of this, how we identify both individually and in community. And so, Professor, maybe I'd turn to you as part the work that you're doing with the student groups on campus here. Can you just talk about how that sort of shows up and how you see that with students, the group particularly, some of the Queers and Allies kind of groups here on campus?
Yeah, in our groups, it really is important to have these spaces where you can be your authentic self and do not have to hold back. I know for myself in physics, it's oftentimes very much a male-dominated field, and I've certainly had pressure where you need to be a good role model for women in physics and be super feminine to show that we need more women in physics. And I'm like, well, we also need more non-binary people in physics and queer people in physics. And that's the same across all disciplines. So anywhere where I can be in a space and I can take a breath and I do not have to worry about how somebody's perceiving me is fantastic. And I want to create a space like that for the students as well.
Yeah. I mean, this is the part I said before we started. I want you to just be honest and like tell me, but do you find that like there are spaces for you on campus where you feel like I'm able to create community here, find community here, or And I should say, I imagine it has been challenging, in particular, over the course of time that you all have been students.
Yeah, I mean, I can touch on that, I guess. As a Asian woman being on a primarily white institution, I think that I've had to kind of create opportunities for community myself, and that's more just, that's not necessarily a bad thing on the institution. Like, we want people within those communities to be able to pave the way and create a space that serves them. You know, like, you don't want, I wouldn't want somebody else to make a space not knowing the experience and stuff like that, but I think there's opportunities to grow, and there's a lot of community here. There's just some instances where you may need to go looking. It's not just going to be readily at your doorstep, personally.
Yeah, I would say definitely with the pandemic and things being put on hold, it's definitely been a different kind of struggle to build communities. And honestly, that kind of shows how important those communities are.
Yeah.
Like, the absence of them really strengthens how important they are. Yeah, so I think that's like been a really big learning thing at school.
And to try and tie together something that we talked about yesterday, there's a big focus on technology, right? And social media, other ways of connecting across different types of platforms and whatnot. And one of the tensions that we heard yesterday was this can have a very, detrimental effect in some ways, but then it can also be a way for people to find community and to connect in different kinds of ways. And again, this is one, I would turn to all of you, but maybe I'll start with the two of you on like how you see that playing right now, like as students, like in a college community. Do you feel like it's one or the other? Do you feel more connected, less connected? Does it depend on sort of the day and which app you're on, or?
I personally choose not to post on social media, but I do choose to engage in social media with people in communities that I'm similar to, and people that are different than me, as a learning tool. And I find that, I know TikTok's been brought up a few times over the conference, and I love the platform because it gives the ability, it's a more accessible tool than something like YouTube, because it's a short video, to share like snapshots into different kinds of people's lives. And so I really love that. And having said that, anybody can post on social media and get into these groups of different marginalized people and start posting hate. And so it's a very complicated thing. I think that technology can be a tool for good and a tool for bad. And so I think it's just a really complicated thing, as we've seen the conversations play out.
Yeah,
I agree. I feel like as humans, we're not built to have that much access to other humans. Like,
I kind of very much agree with this.
I get really fatigued at times, and just like being able to see what everyone's doing all the time is like awesome for maybe loved ones that you've already like built a connection with in person. I mean, I've also have friends that I've met online that I really care about, but I think with COVID in school too, there was that fatigue factor where I'm both addicted to my screen, and it's like making me really tired and like wanting to hole up, I guess, was COVID. But
yeah, and then you're often in a role, I imagine, where you're both, you live this, but then you're also probably trying to help provide guidance a lot of times to students who are navigating this. So I'm curious, like, what some of those conversations are like.
Yeah, so there is going to be some things that can spread great joy for something on social media, but then there is also a lot of discrimination and hatred. And I've sort of learned over time, and it's not just on social media, but when do I want to get involved and speak up? Because there's some times where it's just going to be so much emotional labor without having something done, and it may be easier to go past it and forget. But that can also be difficult. Just like with faculty, when we're reading our teaching evals, you could have 95% of them be very good, but it's that 5% that are bad that stick with you. And that I think is something that can happen on social media. So sometimes having to decide whether or not you can handle interacting with it or not.
Right. And this is a huge piece of this, what we're talking about. Like, some of people may know, like, I'm from a theater background, and so there's an element of this that resonates with me of, you read the reviews, and most people I know who are in any kind of arts, like, remember those negative reviews. But then in the social media context and a lot of what we're talking about here, it's not the play that you are in or the essay that you wrote or something. It's you that all of a sudden feels like it's being reviewed in a way that is really challenging and hard and unfair a lot of times and difficult. And yet, as you all said, there's also so much joy, and we heard a little bit of that, particularly in the Q&A and the power of that. So in the time we have left, I'm curious from each of you if there are things from any part of the conference, either from Dr. Ryder or any of the other presentations that you're still sort of chewing on, or like you maybe are looking to hear more about in the time that we have left this afternoon, or you're planning to sort of just dig into or think about more going forward after this conference ends?
Personally, yesterday during panel discussions, the topic of ethics was brought up, and also just discussing it with students and other hosts and stuff about like the weight of the material. I've been thinking about a lot too, where it's like, this is such an important thing to research and to discuss, but it's also so hard to like maneuver through the complexities of identity and access and all of that too. So I think that's just something that I'm gonna have to think about for a while. Like, how do we best serve these communities without making it worse in some ways, I guess.
Right, and it's fascinating because the panelists, these folks who are, top of their field in this, we're also struggling with that exact same thing. Like, they don't have the answer either because it's a challenging question.
Yeah, I think I was thinking about something similar of just how do we research people in a way that is ethical, because especially marginalized communities, because we don't want to make things worse. I know that Dr. Tynes in the podcast on ScienceWise for the Nobel Conference was talking about how people who don't have experience researching Black people should not get grants to research Black people because of the harms that it can do. And I think that that's so important, that people don't go into researching communities without first taking a step back to know the community.
Mm-hmm. Yeah, that's very good advice. Yes.
I would like to focus more on Dr. Barretto's issues on loneliness and how we need to look at the issues and not just the individual person.
Yeah, that's a really powerful thing, and it was one of the questions that, again, we were kind of grappling with yesterday of why are a lot of these things going up? Because I think that there's agreement. You can do, everyone I think probably agrees it's good that there's more access to mental health services and people are seeking it out more. And yet there's something at the root of that, and until you kind of get to what that is, and we heard some of that today, you can kind of treat it all you want, but it's trying to get to the heart of that. Any last things, though, just quickly? We have literally like 30 seconds left, so if there's anything that you would just sort of encourage people to really listen for or think about more from any time the rest of the Nobel Conference. I'm really trying to push people to not just take this and be like, all right, I'm done, but we want them to live this and own it.
Yeah, everybody has a mental health. And so this is a conference that applies to every single person watching this. And so I would encourage people to really take in the information and really reflect on how this not only applies to you, but also applies to the mental health of other people that you live with and live around.
That is absolutely perfect. You nailed that. Okay, thank you all. Thank the three of you so much for being here. I really appreciate it. We're going to do a quick transition and bring in our other guests. So thank you to the three of you. If you are, I'm turning to the camera here to create the transition. So we are right now at the 58th Annual Nobel Conference. If you're just tuning in, my name is Tane Danger. This is the live stream of the Nobel Conference at Gustavus. This year's conference is focused on mental health in young people. We are actually about halfway through day 2 of the conference, and we are taking some time while everybody else at the conference is eating lunch to check in with folks who have been helping put this together, with students and faculty who have been hosting some of our speakers, and as my next guest is going to talk about, helped put together some of the things that I think really makes Nobel a uniquely amazing, interesting, beautiful conference. Because yes, it's a science conference, and yes, it's an ethics conference, and it also brings the arts into this. So do you mind quickly introducing yourself, what you do here at Gustavus generally, and then your connection to the Nobel conference this year?
So my name's Michelle Rosinko, and I taught in the Department of Theater and Dance for 34 years. I actually retired in May of 22, and as I mentioned last night, I'm rather spectacularly failing at retirement because having more time allows me to really throw myself into things I care about.
That's very cool.
Yeah.
I'm sneaking your microphone this way because I got a note that it's blocking you.
There we go.
Yeah, there we go. Okay, so you are failing at retirement.
I am. So part of that looked like, so the director of the Nobel Conference, Lisa Heldke, who is a longtime friend, we were both started at Gustavus in 1988. So we've walked this path together. And she asked me if I would be willing to organize the arts and humanities, the performance part of this. And since I care about young people and mental health, and I'm passionate about the power of the arts to impact lives, I said yes. So I organized a performance last night called Resonance, which featured 3 student a cappella groups.
Wow.
2 dances, 2 poets, and 1 actor.
This is really failing at retirement. To bring all of that together for one show. That is amazing.
And I just felt it was, first of all, so important that we have student voices, that we have young people's voices. And I think we've done that throughout the conference. But I wanted to bring it out this way. And if you'll permit me a little rant.
Please.
I love the Nobel Conference. I love to look at research-based evidence and critically engage with all of it. And I love to wrestle with ethical and moral issues. But I also like to investigate it experientially.
Yes.
And that's what we get to do in the arts. And to go to maybe a little silly of an example, but I'm going to go to a positive emotion. Let's say the Nobel Conference was on love, and we looked at all the critical research on love. And you looked at what neurotransmitters are elevated and what parts of your brain light up, and you would gain some wonderful information. But then you actually fall in love, and your body is just flooded with new information, new and valuable information. That's the experiential information. And that's what we try and do in the arts. We try to really investigate that experiential information, and then we try to find a way to share that so that the audience experiences what the performer experiences.
Absolutely. Yes. This is the one, I said this at the top, but I think that this is one of the best things about this conference is that it is not trying to say, this is the way to understand this, because there isn't one way to understand any of these things. And the whole notion of a liberal arts education and what we're doing here is that you have to come at this from different angles. So I should just say, folks who are watching, we're actually going to rebroadcast this entire performance over the lunch hour. And so basically when you and I are done chatting here, we're setting this up. Folks will be able to see this entire performance that was done last night. So you gave us a little bit of like who all was involved, but just what can you give us sort of a teaser of like how did this come together and like what did the students want to do with these different aspects of it?
Well, when we first started thinking about this last spring, we thought about the 3 student a cappella singing groups. Now we have this rich vocal tradition at Gustavus, and we often think choral music. But what's really on fire right now is the a cappella tradition. So we have GWAC, the Gustavus Women's A Cappella Group. We have G Sharp, the men's group. And then we have Legacy, which is the mixed voices. So I first asked them to spend some time this summer thinking about, was there music that they wanted to perform that really connected with this theme? And they came back to me with some choices. And then I read a poem by John Riddell called My Brain and My Heart Divorced. And I was so taken with this poem that I wanted to choreograph something to it. So I gathered some wonderful student collaborators to really investigate this poem and how we experience anxiety, regret, sadness, hopefulness, how we experience these things in our bodies. And I wanted to make that really visible. So those students came back a week early to school, and we created the piece that opens the concert.
Wow.
And then the next part, 2 senior English majors who are both poets are reading some very heartfelt and vulnerable poetry. Listening to the students before, they were talking about first do no harm. This was delicate.
Sure.
I mean, how do you invite people to be very vulnerable and talk about their own mental health issues in front of a whole audience,
right,
live streamed to many? And these 2 students, it was very invitational, but they came forward and said, I would love the opportunity to do this. And their poems are amazing. And one other piece I really want to mention is a piece towards the end of the concert. I always forget titles, so I have my cheat sheet, called To Be in the World. One of my longtime colleagues, Sarah House, who I have known for 30 plus years, her daughter, Cecilia, is about 14, 15 now, and has been amazingly transparent about some of her own struggles. And when we think about young people struggling with mental health, parents struggle with it too. And so I approached Sarah last spring and I said, what would you think about doing a duet with your daughter that explored this?
Wow.
And they created a piece together that they wrote. It is recordings of their conversations, which are so heartfelt and powerful. And then they dance together. And the piece is impactful and incredibly hopeful. And we almost needed some tissues in the audience last night because it was really powerful. It does, I will say, for people watching it on the live stream, in the beginning, the stage is completely dark and you're just hearing the conversation between the 2. So there's nothing wrong with your computer. There's no picture in the beginning. You're just listening to the 2 of them talk, and then the lights come up. So that's kind of an overview. I reached out very invitationally, and I said, I know this is asking a lot, but would you like to share about your experience through your own art form about this? And it just makes my heart sing. People just rallied, and last night's performance was so alive. I can't even begin to capture it.
I am so grateful that you did this, that you pulled this together and brought this to this year's Nobel conference. I 100% am on the same page as you that this is what the arts are for. And it's not sort of a nice to have, it's like a need to have.
Absolutely.
You can't make sense of a lot of these things that we're talking about. You can't unpack the ethics and science that we're trying to grapple with here without these tools. I 100% believe. And so folks who are watching at home, this is really something special. This is first ever performance of this amazing show. It is music, it is poetry, it is dance, and it is grappling with all of these things that you have been listening to wonderful scholars talk about for a day and a half now, but in a whole different kind of way. So thank you so much. for doing this. I'm going to shut up and turn this camera over. Please, everybody, this is the replay of last night's concert. Resonance, songs, dances, and poems exploring mental health inequities in young people, part of the 58th Annual Nobel Conference at Gustavus Adolphus College. Please tune in, enjoy, and I will say we'll be back at the end of that with Dr. Lisa Helke coming back and join us. But please, enjoy this performance.
Good evening, and welcome to Resonance, Songs, Poems. Is this working? Okay, wasn't sure. Songs, dances, and poems that explore mental health and inequity in young people. I'm Michelle Rosinko, and until May of 2022, I taught in the Department of Theater and Dance at Gustavus Adolphus College. Now, some might say I am failing spectacularly at retirement. However, I think of it a little bit differently. I'm grateful I have the opportunity and the time to use my signature strengths of curiosity and creativity to shape a performance about subjects that really matter to me: young people, mental health, and the power of the arts. This evening, we will see courageous young people sing, dance, and share carefully crafted words that explore issues of mental health and inequality. I am in awe of the bravery and vulnerability embodied within these pieces. During the Nobel Conference, we take a subject and we explore it through many lenses. We critically examine research-based evidence, as well as wrestle with issues of ethics and morality. And through the arts and humanities, we take the time to investigate an issue, both intellectually and experientially. There is something magical that occurs when words, ideas are transformed into a poem, a song, or a dance. Something essential is distilled and has the potential to communicate a complex feeling for which words alone are inadequate. This is the power of the arts, the ability to speak from one heart to one heart without intermediary. And that is what we hope to do this evening: speak from our heart to yours. Enjoy the performance.
My brain and heart divorced a decade ago over who was to blame, about how big of a mess I have become. Eventually, they couldn't be in the same room with each other. Now, my head and heart share custody of me. I stay with my brain during the week, and my heart gets me on weekends. They never speak to one another. Instead, they give me the same note to pass to each other every week, and their notes they send to one another always says the same thing. This is all your fault. On Sundays, my heart complains about how my head has let me down in the past. And on Wednesdays, my head lists all of the times my heart has screwed things up for me in the future. They blame each other for the state of my life. There's been a lot of yelling and crying. So lately, I've been spending a lot of time with my gut, who serves as my unofficial therapist. Most nights, I sneak out of the window in my rib cage and slide down my spine and collapse on my gut's plush leather chair that's always open for me. And I just sit, 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 until the sun comes up. Last evening, my gut asked me if I was having a hard time being caught between my heart and my head. I nodded. I said I didn't know I could live with either of them anymore. My heart is always sad about something that happened yesterday, while my head is always worried about something that may happen tomorrow, I lamented. My gut squeezed my hand. I just can't live with my mistakes of the past, or my anxiety about the future. I sighed. My gut smiled and said, "In that case, you should go stay with your lungs for a while." I was confused. The look on my face gave it away. If you are exhausted with your heart's obsession over the fixed past and your mind's focus on the uncertain future, your lungs are the perfect place for you. There is no yesterday in your lungs. There is no tomorrow there either. There is only now. There is only inhale. There is only exhale. There is only this moment. There is only breath. And in that breath, you can rest while your heart and head work their relationship out. This morning, while my brain was busy reading tea leaves and my heart was staring at old photographs, I packed a little bag and walked to the doors of my lungs. Before I could even knock, she opened the door with a smile, and as a gust of air embraced me, she said, "What took you so long?"
senior English major with a concentration in writing and a minor in sociology and anthropology. The poems I would like to share with you tonight are called Disassociate and Intrusive Thoughts. I've never been very good at talking about my feelings or mental health, particularly because I struggled to find names for the symptoms I experienced. Since I didn't have the words to express what I was going through, I spent quite a bit of time imagining ways to describe them. For these two poems, those descriptions came out rather humorous, despite the more serious nature of the subject. Please know that these pieces were in no way meant to make light of those struggling with mental health, but more they were a way for me to start my own healing process without straying too far from my comfort zone. Anyway, during these readings, I would appreciate for you to take in the interplay between the absurd imagery and particularly with intrusive thoughts, note the relative frequency with which disturbing thoughts often occur. Thank you. Intrusive thoughts. Intrusive thoughts aren't always the little voice in your head saying jump. Sometimes the little voice is telling you to throw a raw egg up in the air and not catch it, to hear the sound it makes when it cracks. There are lots of times when the little voice is telling you to pour your coffee all over the floor, to see the pattern it makes when it splashes. Occasionally, the little voice is telling you to bite down hard on the thermometer to find out what the liquid inside tastes like. Most of the time, the little voice is a bastard, telling you to do things you probably shouldn't. If I were you, I wouldn't listen to what the little voice says. But then again, you don't have to listen to me. After all, I might be just another little voice in your head, telling you to do inadvisable things.
Hi, I'm Cadence Paramore. I'm also a senior English major here at Gustavus with a minor in film and media studies. This past summer, I self-published my very own poetry book titled From Me to You, where the poems I'm going to read originate from. The first is titled Mute. Jagged glass in my throat, a mass in my brain stretching my skull to its limits, demanding to be birthed. I want to sob, but the sobs kill each other in my mouth. I don't make a sound. I seal my eyes and drown in dense static, growing, 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 devouring my organs. If you look, you will not find me. I am not here.
Disassociate. I turned translucent today. My body, soft like water, contracted and curved, surface tension breaking as the world passed through me. Untouchable me, swathed in layers of soft cotton thoughts, protected from everything, seeing yet hardly existing. Then, all at once, I found myself feeling like a goldfish in a bowl, far removed, trapped, watching, forgetting, unable to do anything but swim in circles, admire the view, and pray for the day when the cat paw descends.
This last poem is titled Overboard, but not Off Course. Salty sea air mixes with blood in my mouth. My movements are stiff. The ocean has found a way inside me, filling me up with cold so razor sharp it fillets my bones. I am nothing but stretched skin holding the shape of waves, my own personal tombstone. Unfortunately, fortunately, I've made this journey before. It never lasts as long as the waves whisper to me it will. I swim or I float, but I never sink. I never sink. Thank you.
I'm breathing through window eyes. Is anybody waving when you're down in a forest and there's nobody around? Do you ever really crash or even make a sound when you're down in a forest and there's nobody around? Do you ever really crash or even make a sound when you're falling in a forest and there's nobody around? Do you ever crash or even make a sound when you're falling in a forest and there's nobody around? Do you ever really crash or even make a sound? Did I even make a sound? Did I even make a sound? It's like I never made a sound. Will I ever make a sound? On the outside, always looking in. Will I ever be more than I've always been? 'Cause I'm tapping on the glass. I'm breathing through a window. I try to speak, but nobody can hear, so I wait around for them to appear. While I'm watching people pass. I'm breathing through a window. Can anybody see? Is anybody waving? Da-da-da-da. Is anybody waving? Waving, waving. Regrets collect like old friends, here to relive your darkest moments. I can see no way, I can see no way, and all of the ghouls come out to play, and every demon wants his pound of flesh, but I like to keep some things to myself. I like to keep my issues strong. It's always darkest before the dawn.
My name is Sydney Dimipelis, and I'll be performing a monologue called Focus. Thanks for coming here, Mrs. G. Every year, I'm sure that you know, there's these teachers that know that I'm struggling with focus. Every year, in every class, I feel like I'm a troublemaker. I just can't focus. I can't do it. I tend to draw a lot. I just start working through my brain and start coming up with these characters that go through my brain, and I just can't stop. And I know I shouldn't doodle, and I know I should listen to the lesson, but I don't know if you know this, but 3 years ago, I was diagnosed with ADHD. And they started prescribing medicine for it in 6th grade. And well, after a while, the medicine started to not work. And in 7th grade, it was worse than in 5th grade when I had the medicine. I was just the same. So they started increasing the dosage, and it still felt the same. And you know, I felt like I was struggling more than other kids. I started getting placed in all these advanced classes, and I felt that there was something wrong with me. I mean, it's not really great when it's announced to the whole class when you get a frowny face on your chart, or why you even have a chart. And like, people start asking things like, why do you have a chart, and why were you gone at the guidance counselor for half the period? And it starts to feel like there's something different with you. So, after being placed in all these advanced classes, I was relieved to find out after all this to be placed in a regular math class. You know, to just be average, being the average kid. That was my dream goal after that. And it felt great. And the problems kept persisting. I mean, people started to ask if, because I was different, is there something wrong with her? That's what they would think. And, well, I know I'm different, and I know most of my problems are internal, so I really appreciate when you start to talk to me about my problems privately. Something I really appreciate. But next time, it would be really nice if I could sit next to a friend in class, or at least someone I'm friendly with. Kind of helps me focus more, and I don't know. I just really wish that I could sit next to a friend. I just want to make this year different. Thank you.
This next piece is an original composition by 2021 grad Henry Santelman. This piece speaks about how light defines much of our perception of reality, and about how lights are never truly lost, but rather are transferred into different forms of matter, energy or potential for light, and how that feels the same for people. It is about coming together as a community to uplift the lights of those who are struggling and to carry forward the lights of those who have passed, because ultimately it is all the same light.
The glimmer of a ray of sun that shines forth at the dawn reminds us of the burning hope that eternally lives on, starting small and growing from the long night where we've been. Sunrise carries the light for each new day to begin. So I'll carry your light like you've carried mine, and I'll shine for you when it's too hard to shine, and when the world makes your light feel small, we'll still carry your light, 'cause the same light is in us all. Although the light may ebb and flow, it never disappears. Though what we know may come and go, our light is always near. Changing forms after dusk when the moon reflects the sun, or in the deepest darkness when the light defines our love. So I'll carry your light like you've carried mine, and I'll shine for you when it's too hard to shine through, and when the world makes your light feel small, we'll still carry your light. The same light is in us all. I'll carry your light like you've carried mine, and I'll shine for you when it's too hard to shine through, and when the world makes your light feel small, we'll still carry your light. The same light is in us all. In us all.
Right after I threw the bowl, I remember running to your room and crying and saying, I don't know why I did that. I don't know why I did that. I shouldn't have done that. It just happened. I don't know why I did that. I just kept saying that over and over again. I was so stressed. Feeling anxiety and feeling waves of emotions, it felt like it was out of my control. Cecilia's control. And that was really scary because there was like anger inside of me that I could not control. And it was also scary for my family.
I just remember you saying that you were worried that you'd get put in jail someday. And it was so hard to hear that you were so afraid of your emotions and that you were going to lose control. And when you have a third grade daughter worrying that they're going to get put in jail, it's like, you know that you've got to do something.
My experience with anxiety is that it has become a pushback in my life. I think of a tide pulling against you when you're trying to swim forward, a barrier that you just have to get through.
I just remember when you got on medication, you were like, I just feel so much better.
Yeah. There's something that moves out of the way. It's like there's a weight that has been lifted off of my shoulders. That was a crazy experience for me. Like, I didn't know I was capable of certain things until my anxiety left my brain. It's like a relief.
And I was relieved.
Yeah.
I wanted you to feel better. My brain is darting around all the time and I'm coming up with solutions. This is my way of being in the world. I look at other people and you think, God, I wish I could think like that, or I wish I could be directed and capable like that at all times. They seem so together. But like you've pointed out, like everybody has their challenges and their strengths.
Mm-hmm. Like I used to see being sensitive and being anxious as a weakness, but now I see it more as a strength. When you're sensitive, you can identify how other people feel in a much more accurate way and a much faster pace. So a lot of people would call it illness, but I call it strength. This world is still not really formed for people with mental illnesses. If somebody is experiencing something and in your brain part of you is like, oh yeah, that's bad, that's weak, catch yourself. Be like, wait, no, it's not weak, it's a different experience. And so I shouldn't be quick to judge.
There's all kinds of ways to be in the world, and that's the beauty of it, all the different ways that we are.
Yeah, facts.
I love being your mom because like, you just like, like your brains can connect. Like right before you said catch yourself, I was just like, catch yourself, and then you said it, and I was like, oh, that's so cool.
I know, we connect a lot.
Yeah. Wasn't there something else we were just about?
It happens every day.
Yeah.
It happens every day. We like think the same thing and then we say it at the same time. Or like you text me and I'm like, I was just about to text you.
Yeah, that happens a lot. And just with the Kate Bush song just a few moments ago, we were like, yeah.
You're singing at the same time.
Yeah, it's fun.
We're connected.
unbelievable and so inspiring. I've learned so much from you, and I look at you sometimes and I can't even believe it, how much you've learned from living this life that you're living. My whole lens has been broadened because of parenting you. I've learned so much. It's awesome.
Sometimes in our lives we all have pain, we all have sorrow, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I'm gonna need somebody to lean on. You just call on your brother when you need a hand. We all need somebody to lean on. I just might have a problem that you'll understand. We all need somebody to lean on. There is a load you have to bear that you can carry. Right up the road, I'll share your load. If you just call me, call me, call me, call me, call me,
So many of the different fields in science, most people aren't exposed to in their day-to-day life. The more you can get out there and communicate to the young people coming up that are the future of science, the better. You never know what's going to grab one individual, and so that's vital to inspire the next generation.
The Nobel Conference brings together students, faculty, and members of the general public to explore revolutionary, transformative, and pressing scientific questions and the ethical issues that arise alongside of them. We bring leading researchers to Gustavus, including nearly 100 Nobel laureates. We're trying to explore the ideas of science using all of the liberal arts, so the arts, the humanities, the social sciences, all of them working together.
There are a lot of people who are not scientists who like to share in the adventure of discovery and to be able to share that joy with people who also get it, that there's something really exciting and cool going on. It just makes it just an enormous amount of fun.
There's sort of a festive atmosphere, which makes it part of a broader experience.
There aren't that many forums for us to have the discourse at that level with that sort of range of expertise, yet still focused on one sort of overarching topic.
One of the wonderful things about the Nobel Conference is it does give people the opportunity to ask people questions in an informal way, and you never know what statement somebody makes or what interaction that happens will make a change in somebody's life.
It's always very, very encouraging to see other colleagues of yours who are at the top of their game, and it makes you want to lift your game.
As you can feel the audience, and you can really feel when you've helped people to know something that they never knew before. It's really a feeling of discovery that you share.
Happy face.
Hi, welcome back to the live stream of the Nobel Conference at Gustavus Adolphus College. This is the 58th annual Nobel Conference, this year focused on mental health inequities in young people. My name is Tane Danger. I'm your host for the live stream. We are actually a little bit past now, halfway day 2 of the conference. So we have had a lot of great presentations and Q&As. We've been spending parts of the live stream chatting with students and faculty, people who both help put this conference together and who are working on some of these mental health issues here on campus. So it's been a really rich conversation. We have a couple more presentations and one final Q&A this afternoon. And just to sort of help set the table for that and give us a little bit of, where have we been? Where are we now? We have the director of the Nobel Conference, Dr. Lisa Helke. Thank you so much for taking a little time out of, again, very busy couple of days to check in with us.
That's great.
So we kind of set this up a little bit this morning, but just to catch people up, yesterday, a little bit of focus on technology, online communication, some of those issues around mental health. Today, I think it's fair to say we've really had a focus on identity, community, intersectionality with mental health.
Yes, exactly. So yes, yesterday we had three presenters who explored the ways in which technology is, surprise, a double-edged sword or a double-edged knife, just like knives are, right? That they're incredibly powerful and useful, and they're incredibly powerful and dangerous in our lives, right? And so today we had 2 presenters who really explored the ways in which community formation and community, sort of infrastructure, can enable people to cultivate the capacity to be themselves in the world, which, surprise, surprise, is an incredibly important feature of mental health.
Right. And to go through those things this morning, our first presentation was on loneliness.
Right.
And I don't know, we talked a little about this yesterday, but can you again kind of just explain, how do you find this part of a topic and this kind of a speaker to be here, and how did that happen for loneliness as a topic?
I will admit that I often sort of blur my eyes while the committee is making decisions because I don't want to get too invested in people. I will admit I failed a little bit for next year, and I put my thumb on the scale for someone. But for the most part, I try to say, who do the people in the room who are really experts in this field or in this set of fields think should come? So I'm not absolutely positive, but I know that when they were exploring speakers, that the BBC Loneliness Experiment, it's not a misnomer, there was some experimentation in it, that project was just kind of coming to a close, and that Professor Barreto was one of the chief investigators in that project. And people started thinking about again, this was pre-pandemic. Who knew how much we were all going to be thinking about loneliness and am I lonely right now, or am I just okay being home in my own house watching Netflix endlessly?
Right. Yeah. And that talk this morning by Professor Barreto was so interesting because she really challenged us to reframe loneliness from an individual kind of construct, I am lonely, to how did we set this whole thing up so that people end up lonely?
Yes. I have to say, each of these presenters has made me rethink many features of the world and my place in it. But I have to say there are ways in which, when you think about revolutionary, pressing, and transformative scientific questions, for me, she has been the most pressing for me, because the way in which she has said, let's not think of loneliness as a problem with your or my personality. Let's not even think of it exclusively as a public health matter, which I think, even that was a big deal. But as she said, well, we could fix that with a pill, right? But to think about it as a social justice issue. And Tane, yesterday you and I talked about how every scientific question is an ethical question. This is a perfect example of it. So if we actually think that we create societies in which people are likely to be more lonely. And I know the question didn't get tons of traction this morning, but I thought it was really interesting when someone said, isn't it interesting that we live in societies, we in the US live in a society that so emphasizes individualism.
Yeah.
And we value, I've got lots of friends. Look at how many Facebook friends I have, or look at all the clubs I'm involved in. Isn't there some kind of a contradiction? The panelists were saying we can mediate between those two, but I think in terms of messages that we receive, perhaps particularly as young people, how do you put those two things together? Be independent, be able to be on your own all the time, except make sure you have a circle of friends that you can point to.
Yeah. And there is a piece, I don't know if you would call it attention or not, but to that exact thing where we are focusing, and I think rightly so, on the individual experiences of mental health in different communities and how that shows up, and that lived experience is different for people of color, for transgender, gender nonconforming people, for, as we'll hear this afternoon, Native American communities, across a whole wide spectrum of diversity and demographics. And there are themes that do seem to come up across that, around some of the push to drive an individual construct of like who we are, the push to sort of chase certain aspects of what sort of society drives us to, that, you know, without wanting to say this is the answer for everybody, does seem to be a thread that runs across some of these things.
Yes, yes. And in fact, I think it's wonderful in that regard that we have Daniel Eisenberg this afternoon also, because he's been a voice that has, and not that he's unique in this, but he has been a voice that has said, you know, look, let's not lose sight of the fact that there are trends long term. Growing up, as the little Gustavus video says, growing up is hard, and it's always been hard. It's been particularly hard right now, we think, although I'm betting there have been, probably it wasn't a picnic in other pandemics either.
Right.
Growing up in the Black Plague era was probably not fun.
Yeah, you
if you were lucky enough to grow up.
You imagine somebody in 1912 being like, you think that, you know, a plague is bad enough. Imagine adding World War I on top of that.
Exactly.
So, yeah,
exactly.
There have been, but that's not to sort of diminish.
Right.
These last 2 years have been very complicated.
Really complicated, yes. And so Eisenberg's work with the Healthy Mind Initiative, of which he was the founder, it's a kind of a complicated, no, it's not complicated, it's a survey instrument that is interpreted by a team of researchers, and they kind of go around to colleges and universities and perhaps secondary schools also, and they help communities identify trends in their student population and help them to think about how can we get in front of those trends. And so he will really be able to speak to that matter of what are some of the threads that maybe thread across different demographic groups, or that connect those, maybe the way to put it is that connect those groups together. Not that we're all in it together. I mean, I think both our presenters this morning, Professor Barreto and Professor Ryder, really sounded the note clearly that we can't just think, hey, let's build a loneliness app.
Right.
There's no one size fits all.
Right.
And yet, perhaps, in good Wittgensteinian manner, maybe we can see the family resemblances between and among those different kinds of issues, and make some common cause among different groups. That was why I brought up, for instance, the matter of food policy councils, because it seems to be an instance in which people are saying, gosh, I think of us as completely different, and yet you also are having trouble finding the food of your people in this place.
Yeah. I do want to spend a moment talking about Dr. Ryder's presentation this morning. Professor Ryder was, as we said, the talk was Radical Healing and Inclusive Change-Making, Centering Transgender and Gender Diverse Communities. And again, it added a whole piece to this picture of how we think about identity, how none of our identity is just this one thing. It is a variety of things, and yet that informs both the things that we carry and we hold, and then what kinds of impacts different things have on us. And their work, I think one of the things that was very interesting to me of the presenters that we have, they're here in Minnesota, and they are at the University of Minnesota, and so they are actually working with students and population right now in high schools and whatnot all over our state.
Right. And they also mentioned, I believe, and now I've forgotten the name of the instrument, but there is a test or a survey, I guess, that is done of Minnesota students, K-12 students at particular ages. I can't remember, maybe ninth grade. I'm never good on these particularities. But at any rate, I think it's administered at 3 different times in students' education. School districts can choose to take it. And this time through, Nick's team, I believe, got a question added to that survey that was about, have you felt, they did work on whether people traded sex for basic life needs. So I think they asked 9th graders or 12th graders, have you been in an experience in which you have used trading of sex as a way to fill your basic needs as an individual, for food, for shelter, for those sorts of things. And so they are, as you say, doing work on Minnesota people. Their talk here was focused on this really interesting art-related or creative visual presentation-related work on, how powerful it is to be able to manifest your identity in a work of art that others are interpreting.
Right. And that is a good tee up for me to say, one of the things I really love about Nobel is that it is this very interdisciplinary space.
Yes.
I think that probably a lot of people, they first hear Nobel, just the name, they see the topic, they're like, oh, it's a science conference.
Right.
As you and I talked about, it is definitely a science and ethics conference. And our presenters bring in the arts and the humanities in a variety of different ways. And then folks actually who have been watching the live stream just got done watching the performance from last night.
Which was just spectacular.
Which was students largely crafting pieces responding to this question about mental health and equity in young people.
Right, including really powerful spoken word pieces, poetry, dance, and folks who are, the word courageous is overused in this sphere, I guess, and I'm just appreciative that people are willing to interpret their own life experiences in a way that helps the rest of us understand something we didn't understand before. And as Michelle Rusinko so eloquently puts it, sometimes all the words that you philosophers have just don't cut it. We need to see it, we need to feel it, we need to hear it with our musical ears.
And that is literally what Professor Ryder's talk was about to some degree, right?
Yes.
Was that it's a different experience if you ask a young person to visually communicate something versus write this down, write an essay about this. Both have value, and yet, of course, we know we're getting something different if we ask to use different parts of our brain to respond to this.
Absolutely. And one of the things that's cool about this work is they work with the community that created the work to say, where would you like to display this? I said, well, so Nick, are you going to have an art show? I think I asked on the podcast. And they said, well, that will be for the creators to decide how this work is used. Imagine that. Actually asking the artists what they want done with their work.
Yeah.
So,
well, let me ask you, this is something that I've been wondering about because I've had this great opportunity experience to have students come in and respond to a lot of the presentations and talk about it. And I will, folks at home, if this is your first time tuning in, you may not know, this is also the first time that there's sort of been a live stream presentation like this.
With separate live stream only.
And so, there's a part of me that's been wondering, though, the responses from the students have been so profound and honest and oftentimes vulnerable. Like, we've had students talking about, like, yes, these things that these presenters are talking about, I, see on campus, or I have experienced, or, I deal with, or whatnot. And we talked a little about this yesterday. That does feel a little different to me than some other Nobel conferences.
Right.
This is like a lived real world experience.
Absolutely.
I am wondering if that's, how you're thinking about that then for the Nobel conference. If that's something to be like, maybe we need to be doing more of that.
Right. It's a really excellent question. This conference has over the years been many different things. If you look at the history of the topics, they've been all over the place. I was going to actually ask you what the topics were when you were a student. When I was here, one of the topics was the aesthetic dimension of science, which was, for me, sort of a sweet spot, a heartbeat topic. But it turns out probably that wasn't the case. Not every student, found that to be really important.
There was one the year while I was here that I remember about the body which is fascinating. But I distinctly remember one of the presentations was about what happens to your body as you get to old age and like what happens to your knees. Literally, I remember the presentation and whatnot. And I remember being probably like 19 years old and being like, I'll check back in a few decades. Like, so. Well, I'm almost there. I know. Yeah.
So, but back to your question, one of the things that we try to do is sort of circle through disciplines. Now, I try to make these topics really interdisciplinary. This one is perhaps a little bit less so, but so that different departments really have the opportunity to have their students think, wow, I really want to sink into this. But also, it is wonderful to have topics that really speak to our students. And in that regard, not next year, but the year after that is about sleep. And honestly, it's not only young people who struggle with sleep, obviously, but college is a terrible time for sleep, right? People do all kinds of crazy things to their sleep lives. So I feel like that's going to be another topic that's about, this is where you live. You should think about these issues.
Yeah. That's very cool. And you're going to come back at the very end of the conference to do a little bit of wrap up today, and then we're going to preview next year's conference too. So people,
with one of the chairs of next year's
one of the chairs of so this is my teaser to try and encourage folks to stick around with us through the live stream, through our afternoon presentations, and then all the way to our closing chat here. But before we do that, we do have two more great presentations. Can you give us a little bit of a preview?
Sure.
Our next two that we're going to hear.
Yep. So Daniel Eisenberg, as I mentioned, was really the creator of this thing called the Healthy Mind Initiative. And they, this is a wonderful organization. He founded it with some undergraduate and graduate students when he was just himself a brand new professor. And it's really built up into this amazing network. And they try they're so willing to try strategies that might be effective in helping population level. So this is going to be really population level, at a college or university, struggles with particular mental health issues. So do tiny little videos about wellness moments, do those help people? Well, no, it didn't turn out they did. So what else should we try? So they work with individual institutions. And then Joseph Gaughan, our last presenter, is going to present a model that really says, are we thinking about this whole matter of certain kinds of mental health in the wrong way altogether? And he's going to explore the ways in which, from the vantage point of colonized people in the U.S., the way we need to start thinking about this is that depression, suicide, alcohol use, and these others are conditions of colonization. And so he's going to really leave us with the challenge to think more broadly about what we even mean by mental health and mental illness. And I think we heard from him earlier saying, if you have a choice between a psychologist in your community and food security, you might be choosing food security.
Yeah. And then we have our final Q&A session.
Yes.
Which, for folks who've seen the Nobel conference before, frankly, the last Q&A session oftentimes is the richest because we've gotten all of the presentations, all of the presenters have gotten to hear everybody else's talks. And now it's just sort of what does everybody think about this? And so that we have at 3:30 today for folks who are watching. And as always, it is open for you all to submit questions. So they can, folks, if you're watching online,
please do.
nobelconference@gustavus.edu. Just email them in nobelconference@gustavus.edu.
And we will certainly save the last portion of that question and answer period for questions, frankly, that will enable more than one speaker to talk either with each other or in contrast to each other. Questions that enable people to talk across their different disciplinary strengths.
Yeah. And again, I don't know, I don't mean to stir the pot, but I do imagine that there are people who are watching who are like, I don't know if I agree with that, or I want to know more about this piece of it, and that's very much encouraged.
And we saw that we saw some disagreements. I mean, yesterday more than this morning, but we certainly see that people have different notions about what kinds of research methodologies should be used, and our presenters want and need that kind of feedback, and frankly, our students really appreciate seeing, this is what scholarship looks like. This is what intellectual discord looks like. This is useful.
Yeah,
absolutely.
It's very useful. I'm going to do one last thing before we change off with you, which is I'm going to make the pitch that the Nobel conference, this wonderful thing. If folks have been watching for this long, they probably get why this is such a valuable, important thing. And there's a piece where it only happens because people support it and people contribute and help make it possible. And so I believe that there's ways people can actually go on the Nobel Conference website. If you have been enjoying this, and you've been enjoying this live stream, which we've noted is something that's relatively new, and again, there's a whole team of people behind the scenes here that you can't even see who have been spending days and days putting this whole thing together. If you appreciate this and think that it is valuable, help make it possible. Help make it possible for next year by making a donation and a gift to the Gustavus Nobel Conference. Because it is 100% true that we can't do this without people like you helping bring it to life.
Thanks, that's absolutely true. And I will say no gift is too large. And we love people who would like to sponsor at the lectureship level. So if you have the means to support a lecture at the level of $10,000, that's wonderful. If you have the means to support it at an additional purchase of a ticket for a friend, that is also wonderful.
Yeah.
Thanks for that.
Yeah, and again, it's something that's wonderful for you and getting to, be a part of this thing. And there's hundreds and hundreds of students that I'm seeing who are getting to be exposed to literally some of the best minds in the world coming here to Gustavus, and that is just like an invaluable thing that you help support by supporting the Nobel Conference. So you have to probably go get ready because there's more lectures to do, and then you're going to come back at the end of the day. So don't go away. Come back for that. Thank you so much, Dr. Lisa Helke. I have got somebody. We're doing our transition here. We have folks coming in the room now. I will say quickly as we're doing that, this is the 58th annual Nobel Conference at Gustavus Adolphus College. This is a conference this year focused on mental health inequities and young people. We are at the sort of last part of day 2 of this conference. We have been listening to presentations for all of yesterday and today. We've got 2 more today. And look at, I have an amazing, I love that this happens. I turn this way and then I turn back and there's a whole panel here to come talk to me. So I just do this, again, not because I'm lazy, but because it's just more fun. Can you each introduce yourselves and say both your role here at Gustavus generally, but then your connection with the Nobel Conference this year?
Yeah. My name is Maddie Hessian. I'm a senior here at Gustavus. I'm a biology and law lax double major with a Spanish minor, so I have lots of stuff going on with that. And I am the student host, one of them, for Dr. Gahn.
I'm Nissa Parmer. I'm part of the English department, and I'm the faculty host for Dr. Gahn.
I'm Mary Enright. I'm a biology and Japanese studies double major, and I'm the other student host for Dr. Gahn.
So thank you all so much for being here. I've just been asking everyone when they first sit down, and you all have the benefit of, we've been here for a day and a half now. Are there pieces that you've heard already from any of the talks that are just really resonating with you, that are still sort of rattling around in your head and you're like, oh yeah, that's something I got to chew on for a long time?
Mm-hmm. I thought the talk about loneliness was really fascinating, and looking at how it's not a deficit in an individual, but a deficit in the community, and how we can work at that level to try to kind of fix that problem. That was one thing that stuck with me.
And I think not just in that talk, I think a thread in many of the speakers' talks has been this idea that we have thought traditionally about psychology on an individualistic level, especially in the West, and that really the problem exists outside of the individual, and that's where it will need to be solved if we want it to be properly solved.
Yeah.
I found the conversation around the role of social media in mental health very interesting, because you have that dynamic of you can find your own community on social media, but you can also face a lot of hate for being a minority, for example. And so just that dynamic presents a lot of great discussion.
Right, and this is something I've been fascinated to hear, frankly, particularly students talk about. We were making this point yesterday with some of the talks that we heard, as you noted, that the lived experience of someone, frankly, that's your age is very different than my age, or probably some of the folks watching, who I grew up at a time when social media was just like kind of getting out there and like just starting. And you all, it's part of your lives sort of from day one. And so, yeah, when you say that this is like a complicated thing, can you talk a little bit about how it's shown up for you, or how you feel like you maybe grapple with some of the things we're hearing them talk about in some of these talks?
Yeah, growing up, I was able to like form my own sort of community online. Like I'm a more introverted person, and so being able to reach out with people online is so beneficial, but it can also, like spending a lot of time online can also make you feel lonely in your like in-person interactions with people. So just finding a balance there, I think, is hard to do.
Yeah.
Yeah, I would totally echo what you said. Also, I think one thing for me, at least with social media, and I think with a lot of other people, is you need to be able to recognize, and it's hard to recognize, that it's a highlight reel of people's lives. So there's a lot of comparison that can happen, and I think that is a big factor in influencing mental health as well.
Right. And then there's the benefit piece that we've talked about of being able to find your community potentially, you know, find people that can help you resonate with different things. I mean, Professor, I've got to imagine, you know, there may be aspects of this story that feel familiar from, you know, teaching English for a number of years, of people like finding like, oh, this like body of literature, this body of work like has, I finally found myself in these writers or these kinds of things. But it's obviously like, it's all of a sudden like on this totally different level or happening in this totally different medium. I don't know, you seem like maybe you agree or maybe not.
Well, I mean, it's unmediated,
Yeah.
and I think that's what makes it. I don't know. People call the internet the Wild West. I mean, for a reason, and I think there are some great things about this lack of mediation, and this has been a thread too of the talks as well. Is the way then it can evolve organically and sometimes authentically in ways where my practice as a professor is to really curate things, and so then of course you lose freedom and you lose perspectives anytime you curate something. And so there's a way it opens up a space for perspectives that haven't been heard to be heard,
Right.
but then also to be potentially stigmatized and attacked. So,
Yeah.
yeah.
So we are getting ready. We've got 2 more lectures this afternoon. Can you all help give us a sense of what you're still hoping to hear or looking forward to hearing from our talks this afternoon?
Mm-hmm. Well, we can probably speak more to Dr. Gogg's talk.
Fair. That's
because
fair,
he's
yeah.
our speaker that we've been working with. But one thing I'm really excited about, which I also think is a thread throughout today especially, is his focus again on community. He is a clinical community psychologist, which is a bit more of a unique degree. So he directly works in partnership with communities. He has a relationship, for example, with the urban American Indian
Community in Detroit, yeah.
in Detroit, and has been doing programming with them. So he has a really unique style of research and work, I think.
Yeah.
Go ahead.
Yeah, Dr. Gunn works with indigenous communities, Native American communities, and I'm someone who myself identifies as Native American, and so I think that that's so important to have that type of representation at a conference like this, to speak to an audience that maybe doesn't know a lot about mental health in Native American communities, and I'm really looking forward to hearing his talk.
Yeah.
And I would just add, and just not just his presence, but also his style of practice, which draws on indigenous knowledge and indigenous medical and healing traditions, and also culture, just more broadly. And he applies that to his work, and his work offers a larger critique to Western psychological practices.
Right. And I thought that actually we I don't know if it was intentional or not, but Dr. Barreto had almost a nice tee up for this talk during the Q&A, where there was this question about like, if you could take a pill to cure loneliness, like, well, what are we even really talking about then? Like that, even that concept seems like farcical. And yet, that is often how we sort of think of like mental health treatment, is like, oh, well, is there a thing you can take or a thing you can just do for you to like fix it? And it does seem like the talk that we're going to hear this afternoon from Dr. Gaunt will be a different way of even framing that kind of a conversation. Last thing in like the about minute that we have left is I've been asking especially the students, are there things that you've been hearing either from the talk so far or potentially from our talks this afternoon that you're thinking, yeah, this is really important and I can imagine taking this forward with me in the rest of my academic career or into my professional career someday?
Well, I am on the medical field track and want to go into healthcare, so a lot of these talks are super applicable, but Dr. Ryder's talk I thought was really amazing of just recognizing trans and gender diverse communities and working with them, getting their input on how they want to be treated and the respect that they deserve in that setting.
Yeah, Dr. Gahn's research regarding Native American communities kind of got me thinking from like the biological perspective. In physical health in Native American communities, I know that they struggle a lot with things like diabetes, and just finding ways to apply physical health, like ways to benefit them, is important, I think.
I so appreciate all three of you taking time to talk with us, give us a little bit of a preview for this afternoon. Thank you, all three of you. I am turning it over to Lund Arena, where the Nobel Conference is picking right back up. We have a prelude right now by the Gustavus Jazz Ensemble, which will lead us right into our next lecture after that. So please tune in right now, the Gustavus Jazz Ensemble at Nobel Conference 58.
Take your time. We're doing good on time. All right. We're all good on time. All right. Really good. Let Nate get comfortable too. Reposition.
She's going to try to escape, but I'm going to make her come up here, Barb Larson-Taylor. Barb Larson-Taylor, paging Barb Larson-Taylor. Many of you say all kinds of nice things to me about being involved in this conference, and oh gosh, it must be so much work. I want to tell you, Barb Larson-Taylor is the person who actually makes all of this happen. Along with the team, yes, but it's Barb Larson-Taylor. And for the last 2 years, Barb Larson-Taylor has been the Nobel Conference Czar, in addition to being the Gustavus COVID Czar. And so she really has been doing at least 2 full-time jobs in addition to her regular full-time job for the last 2+ years. And so really, thank you, my friend. I'm the luckiest person in the world to have her as my sidekick. So thanks, Barb. And thank you. Sorry, music ensemble. I was afraid she was going to sneak up, but thank you to you. And thanks to all the music ensembles. We're so glad to be back in person where we don't have to worry about the vagaries of recordings. While I'm thanking people, I also want to thank the many people who make this go smoothly, including physical plant, custodial services, the dining service, campus safety, all of those folks. Again, a big shout out to Heroic Productions, who do such an incredible job of making this be beautiful. And of course, thank you to all of us who are joining us virtually and in the flesh and in all of the other cyborgian ways that we can join things now. If you are coming to us from the future, thank you for being there then. And with that nonsense conclusion, I want to invite to the podium my colleague in Economics and Management, Vita Fajczuk, who will introduce our next to the last speaker.
Today, it's my honor to introduce Dr. Daniel Eisenberg, who will talk about investing in youth mental health at a population scale. Last year, the US Surgeon General called mental health in youth an emergency state. In the last 15 years, the number of young people reporting suicidal thoughts, depressive and anxiety symptoms increased dramatically. COVID-19 made things even worse, with isolation and disrupted routines. What should we do about this at a college, community, state level? There are so many solutions available, from hiring more campus school counselors, expanding health insurance coverage, more training to faculty and students, to incorporating teaching coping skills in our curriculum. The problem, however, is we cannot have it all. College and state budgets are limited. So how do we know what programs we should invest in? How do we know which one has the biggest impact? Economics is all about answering those questions. Economics provides tools and a framework to evaluate different options and select the best use of our limited resources. For almost 20 years, Dr. Eisenberg has been applying his economics training to evaluate different options and help public policymakers, college administrators to select the most effective and efficient ones. He is one of the top experts in this field. Dr. Eisenberg is a professor of health policy and management in the Fielding School of Public Health at the University of California, Los Angeles. He has PhD in economics from Stanford University. In 2005, he founded Healthy Minds Network, a research center that to date conducted surveys of student mental health already at more than 500 colleges. I encourage all of you to check the network's website, healthymindsnetwork.org, and specifically the materials of their annual symposia. It contains vast resources for student advocacy, faculty, college administrators, and parents. Dr. Eisenberg has over 100 published research papers under his belt, and most recently finished a book called Investment in Children's Mental Health. His recent research topics include using mobile technology and cognitive behavioral therapy to reduce mental health disorders in college students, depression among student athletes and ways to promote coping skills, inequities in access to mental health resources among college students of color, transgender, and gender-diverse youth. Please welcome Dr. Daniel Eisenberg.
Hi, good afternoon. Thank you so much for the wonderful introduction. And I could spend my 30 minutes actually thanking all of the wonderful people who have made this a unique experience for me. I think in my other co-speakers here, really everyone here, I've learned a lot from you all, my fellow speakers, and the hosts, and actually a lot about the Gustavus as an institution. It's the kind of place where I hope my daughters, who are now 13 and 11, can go in the future for college. So, although as Professor Faychuk just described, a lot of my research has focused on college student mental health, I actually decided to do my talk on actually a different topic. So I hope that doesn't disappoint anyone, but I am happy in the discussion to talk about the student mental health side of my research. But I thought what might be more helpful for this kind of very broad discussion is to focus more on my perspective as an economist and this book project, which is really about kind of an economic perspective and a policy perspective on youth mental health. So I think I just want to first kind of make the case for why this is such an important topic and why an economic perspective and a public health perspective are useful. I probably don't need to do a lot of convincing, so maybe think of this as more, for this audience, maybe think of this as more as kind of ideas for making the case yourself, as if you're already on board with this case. Public health, of course, is dealing with all kinds of massive challenges. Healthcare costs, our healthcare system in the US, which seems to be quite inefficient in many ways, the opioid epidemic, gun control, gun violence, obviously the pandemic and other pandemics potentially in the future. But I would argue that youth mental health is right up there in that first tier of most important public health issues. And so let me explain why. First of all, there's a high prevalence of mental health conditions among children and youth, not just in the US, but pretty much any country where we've had epidemiological studies of youth mental health. In the US, it seems there's approximately 1 out of 5 children, about 20%, who meet criteria for what would be considered a severe or serious emotional disorder with significant functional impairment. And worldwide, the World Health Organization, World Bank have done a project called the Global Burden of Disease Project, where they tried to quantify what's the overall burden of disease for different types of disease, different parts of the world, different age groups. And for young people, where I'm defining that as 0 to 24, although all of us are young at heart, but children, adolescents, and young adults in the US and many other countries, mental health conditions together comprise the highest burden of disease, the highest category of disease. So I'm going to share a little bit of data. This is actually maybe the only data chart that I have from our student mental health research, but this is from the Healthy Mind Study, which was just briefly mentioned. This is a national sample of colleges and universities where we're doing a representative sample web-based survey over the years. And one thing that we've seen, first of all, is that there's been, as you've already heard in this conference, a steady rise in various aspects of psychological distress. And in this chart, it's depressive symptoms, but it would be similar if I showed you anxiety or suicidal thoughts. Also, we're seeing persistent inequities across different dimensions. In this chart, I'm showing across different gender identities, but I could show you similar types of inequities across different lines if we had more time. So that's one reason why it's such an important topic. Another important topic, kind of from a more positive perspective, is that there's such an opportunity to have an impact. And so in 2009, for example, the Institute of Medicine produced a report on prevention of mental and emotional and behavioral disorders among young people, and I had an opportunity to contribute a little piece to that report, which was an estimate of the overall economic costs of these conditions among young people in the U.S. It's a very rough estimate based on a lot of assumptions, but we approximated that it's on the order of $240 billion of economic costs. And I won't get into the details of where that number comes from. I know it might seem a little mysterious, but it's significant for society from that perspective as well. Another reason why it's such an important topic, also such an interesting and complicated topic, is that for children and youth, and really for any age group, mental health cuts across so many different sectors of our society and so many different types of service. So there's a concept called system of care that became popular in the US in the 1990s and since then, and the idea is that we need to better integrate our approach to supporting youth and children mental health across not just mental health services, but also social services, educational services, substance use, vocational, juvenile justice, school, special education. There's just, mental health touches everything, and it's affected by everything that's important in our lives, and therefore it's complicated to deal with, but it's also kind of a great opportunity because there's so many different ways we can make a difference, as we've already been talking about in this conference. So the way that I think about this topic as an economist is, and what really got me interested in this topic to begin with, is the idea that we probably can make some really good investments. As Professor Fajczuk just described, we don't have enough resources to do everything we want to do with respect to youth mental health. So we need to make hard choices. We need to allocate our scarce resources and our scarce time, and that's what economics can help think about. And so for me, kind of the questions that I want to try to help answer, and sort of the way our book is organized, is first of all, what are the best investments from from the limited data that we have? Lots of caveats in the book. And then, to what extent are we actually making those investments? Our focus is the US in this book. And then, given that there is, in fact, as you might guess, and as we've been talking about, there is a large gap between what seems to be the best investments, the best approaches, and what we're actually doing, how can we do better? How can we close that gap? That's what we try. We're just trying to, first of all, state these questions explicitly and at least provide a starting point for answering them. Certainly we don't have the definitive answer. You can't just read our book and then solve all these issues, unfortunately, as you might have guessed. Oops, wrong button. So this is my co-author, Ramesh Raghavan, who's at NYU. He's been wonderful to work with, so I want to give him credit and a little bit of screen time with this wonderful audience. And our book should be coming out in Oxford University Press, hopefully later this year, but although I've learned since my first book that everything, it's kind of like maybe home renovations, everything takes longer than your whatever estimate you or someone else might tell you. So first of all, as I like to tell my students, especially my PhD students who are doing research, first of all, take a step back. What's the conceptual framework? What's the theoretical framework? Before we get into data and data analysis, what are we even talking about? And let's kind of name some of our assumptions. So first of all, what do I mean by investing in children's mental health? That could mean a lot of different things. And first of all, what is mental health? One definition that I like is from the World Health Organization, where you can read it here, but basically it's a holistic definition. It's not just about mental disorders, not just about psychological distress, but it's also about realizing one's potential, coping with normal stressors of life, working productively and fruitfully, able to make a contribution. So it's a lot bigger than just a mood, and it's a lot bigger than kind of deficits. Next, what do we mean by investments? So economics has, of course, a lot to say about this, and to be clear, I'm an economist, but sort of. I'm in a school of public health, and I certainly have strayed far from the canon of economics in some ways, so I'm very open, I think, about the limitations of economics and really enjoy working with psychologists, communication experts, sociologists, the kind of types of perspectives that we've been hearing from as well here. But first of all, economics has a health and human capital framework where we think about, as people, we have certain assets that are important to us, our health, and our human capital refers to our skill and our knowledge, basically, that kind of help us in the workforce and employment. That's some traditional economic frameworks that are, I think, somewhat useful here. And we can similarly think of our mental health as a key component of our health. That's an asset that we need to nurture, and not just as individuals, but as a society, as we've been talking about. And then also economics has a framework for evaluating comparing different alternatives, strategies, cost-benefit analysis. Probably most of you have heard of that, but I'll say a little bit more about that. So more broadly, there's economic evaluation is sort of an umbrella term for not just benefit cost analysis, but a whole kind of family of methodologies that they all basically have the purpose of trying to quantify what do we get for the use of our limited resources. So the costs are basically not just financial costs, but the human cost, the time costs of actually implementing a strategy. That's what we're giving up, in a sense, from an economic point of view. And what do we get? What are the benefits? And can we quantify that? Again, lots of assumptions, lots of limitations to actually quantify things as complicated as mental health and health. But the basic, so lots of limitations, but I would say the reason why I find these still compelling frameworks is I think we have to at least try to quantify. If we don't even try, if we don't try to put numbers to it and then be very open about our limitations, then I think we're kind of in a world where we're going out just on gut instinct, and we're going on maybe kind of whose voice is louder. So this is sort of an objective system for considering alternatives. Plenty of limitations, again, that we can talk about, but it's a useful starting point. So now, in terms of thinking about a framework, we're thinking about, well, what potential strategies should we consider? I want to just note, I think there's a thread that's been common through maybe all of our presentations so far, and I'm guessing that my friend Professor Joe Gahn is also going to have this thread in his talk when he goes next. But basically, that we need to think above the individual level, or outside of just the individual level. And the social ecological model is kind of the classic that was already shown in a previous presentation, where there's the individual, interpersonal, but also organizational, community, and policy levels that we need to think about when we think about strategies for improving youth mental health. Also, which maybe we talked less about, there's a developmental framework we have to consider. The fact that children, of course, grow and mature, and their needs and their assets and their strengths and limitations evolve quickly over time. So we need to think about whether our various approaches that we have are matched appropriately to the developmental stage of the young people who are experiencing those strategies. And then I really find very compelling when we think more specifically about frameworks for thinking about youth mental health, the nurturing environments framework, which I think has a lot of parallels of what we've been talking about. The idea, one of the most compelling ideas in this book and this framework, on the what is that, the right side of the screen for you as well as me, is that we tend to address issues like, say, substance use and violence and mental health, and say education. We tend to think we have separate agencies and separate strategies, separate approaches, but in fact there is, again, a common thread that is supportive for young people, and it's what they call a nurturing environment, and they spell out kind of what does that mean. But I think really what we've been talking about a lot here is that social relationships, social support, the social environment is so fundamental to young person's mental health and to older person's mental health as well. Now turning to, again, how do we choose the best strategies, the best investments? I do think we have to look at evidence. And I know we've already talked some about the limitations of evidence and the fact that sometimes evidence is created in a context that does not necessarily apply to a different context. So we have to be humble in our interpretation of evidence, but we still need, and we need to build the evidence base. We need to build it so that it's more representative, more diverse, more appropriate. We need to adapt interventions, new interventions. We need to ask communities for interventions. All that said, I think what we don't want to do is throw up our hands and say it's impossible to get all the evidence that we need to make informed decisions. That I think it's tempting sometimes because it is so complicated to get evidence that really fits for the context that we're trying to make decisions about. And in fact, I think in the US and federal policy making, at least during the Obama administration, for example, there was a move towards a greater use of evidence in policy making. For example, as part of the Affordable Care Act, there was a serious investment in home visiting programs for especially low-income families with newborns and with various other risk factors. And the idea is that a nurse or another trained professional, or even a peer sometimes, can visit a family periodically and help support a more kind of nurturing environment for a child at the beginning weeks and months of life. And that policy came along with some stipulations that we need to be investing in programs that have evidence, because there are programs that have evidence. We also need to build the evidence for programs that have maybe promising but not definitive evidence. I also want to just point to you another resource out there that I think is worth looking at in the future is what are called registries, or sometimes called clearinghouses or repositories of evidence-based programs. Some of you might be familiar with these. In the context of youth mental health, I think one of the most useful registries is called the Blueprints Programs for Healthy Youth Development. It's based at University of Colorado, and they have a large database of basically social and health-related programs that support youth development and mental health, and they rate the evidence. They put the programs or interventions in different tiers, like model is the highest tier, and there's very few in that tier. Promising, and then, actually just model and promising. There's model plus, I think, is kind of even a more select group. And they have very high standards for what to be a model program. I think that's useful if you want to really kind of hone in on the programs that have the most substantial evidence. They also have a lot of information about, this evidence, who was it created for and with, what groups, what were the demographic characteristics of the evaluation studies, for example? Were there differential effects by different groups? So I think to some extent it gets at some of those issues, but we have a long ways to go in that respect. Another great resource is the Washington State Institute for Public Policy, especially in terms of economics. So they basically, they provide benefit cost results for a large number of social and health programs. I think not just for young people, also for older age groups as well. And they actually work, their mission is to inform the Washington State, this is the state of Washington, legislature, so that they make better policy decisions with their limited resources. So they have benefit cost estimates for a wide variety of social and health programs. Okay, so just to kind of summarize what the second question that I posed for our book, now that I talked a little bit about what are the best investments, what might they look like, is, how well does current practice in the US line up with that evidence? First of all, that's really hard to say, because unfortunately there's a lack of comprehensive information about what we're actually doing in the US to support student mental health, or our youth mental health, because again, first of all, because mental health interventions are cut across so many different sectors, so many different types of approach, so it's kind of hard. You can't just look at one kind of sector or one agency and say, okay, what are they doing? What are they doing in Minnesota? It cuts across too many boundaries. And so I think, first of all, we need to do a better job of actually documenting what are we doing in terms of particularly not just clinical services, more importantly, kind of community-based, community-level, public health level approaches to youth mental health. We need to know more about what we're actually doing. But with the limited information that we do have, I think we can confidently say that there's a huge gap between what we're doing and what the evidence says we probably should be doing. And so just to take a couple examples, and I'll talk more about the SEL, social emotional learning programs in schools. That's been a kind of a fad or a trend in the last 20 to 30 years in the US. And some of these programs actually have good evidence that they're supportive of youth social and emotional development, but the ones with the best evidence are being used in less than 5% of schools. So we're not actually implementing that evidence on a large scale. Similarly, with substance use prevention, Some of you probably remember the DARE program, Drug Awareness and Resistance Education, which actually was the most widespread substance use prevention program in the US for a long time, and actually turned out to have very poor evidence once we actually evaluated it rigorously. And still today, or in recent years, it's only about a quarter of schools nationwide that seem to be using the programs with the best evidence of actually reducing substance use. And lastly, adolescents with severe behavioral concerns. These are often adolescents who are at risk or already in contact with the juvenile justice system. We tend to take a very punitive approach. We in a very kind of institutional approach, as I think many of you know. We tend to prosecute these young people. We tend to put them in residential treatment centers. We tend to remove them from the community where they actually might receive some support from their family and their friends. And less than 10% appear to be getting what I think would be appropriate services based on the evidence that really more therapeutic, systemic approaches are what work best. So why is this the case? Why is there such a gap between what the evidence suggests we probably should be doing and what we're actually doing? I'm sure many of you have great ideas on this. We've talked already about some of these things, but just to kind of summarize in 30 seconds, some of the major categories of barriers, there's organizational factors, of course, the leadership for many organizations and policymakers. They may not have the attitudes or knowledge or the structure or the incentives that actually align up with using the evidence for what's going to work best. Financial incentives don't tend, well, I just said before how we're so fragmented in terms of the agencies that support youth mental health, and therefore the money, on the public side, for example, the money is going in 10 different directions. And so no one organization or agency in a community actually has a financial incentive to invest in the evidence-based program because they're not going to benefit financially. They can't afford it because the finances are just spread across all these different groups. And then political constraints, of course. I think the basic problem there, as with many issues in public health, is that the best investments tend to be those who have longer-term rewards. We invest early in life, and then we get good outcomes for young people far into the future. But it's an upfront investment with a long-term payoff, and that doesn't line up very well with what politicians are faced with in their incentives. They need quick wins. They need immediate evidence of success. Their election cycles are much shorter than the cycles for these types of interventions. Okay, so our book, to make this big topic more manageable, our book goes through a series of case studies. It's just a selected set of studies intended to kind of capture different age ranges, different types of approaches, by no means intended to denote that these are the most best strategies above all or the only strategies. But here are the case studies that we go through in our book. First of all, we have a chapter on home visiting programs such as the Nurse-Family Partnership. We have a chapter on parent training programs more broadly. Triple P is one example. And then we have a chapter about social emotional learning programs, which I just spoke about. And that's the one I'm going to get into more detail in just a moment. I only have time, I think, to go into detail for one of these case studies today. But also just want to highlight what else we're looking at. Multisystemic therapy is a kind of social ecological intensive intervention for adolescents who are often have behavioral issues that are that cause them to be at risk or in the juvenile justice system. And the whole idea there with MST is that let's as I think previous speakers have said, let's take the focus away from this being the child is the problem and think about the problem is what's surrounding the child, the community, the relationships, the system of support is not working for the child. And let's strengthen that, and let's look at the assets that are already in place and strengthen those. And then lastly, community-set care is kind of not a specific intervention, but it's actually kind of a whole framework for a community to come together, assess its own needs, and then make a plan for reducing youth substance use. That tends to be the focus, and then maintaining that over time. So just quickly, I'll say a little bit more about SEL, social emotional learning programs. And I know some of you, if you've read about SEL in the news recently, you probably, I think actually maybe Lisa Heldke referred to this earlier yesterday. about how it's getting kind of mixed up in the culture wars, so to speak, or the political wars about what are we teaching our young people. And so unfortunately, SEL has now become a politically divisive term, even though it really does not need to be. And I think you'll agree when I kind of tell you more about it. So what it is the idea that in schools, it's not just, I think primarily this has been done at the primary level, elementary level, but also secondary schools as well, and even higher education has SEL components to it. The idea is that we shouldn't just be teaching math and science and so on, but actually we should be supporting the social and emotional development of children. That's not a new idea. I think any of you who is an educator has probably always appreciated that fact, that as educators, we're mentors, we should be role models, not just for how to compute a really complicated algorithm, but how to actually make our way through life. But SEL is trying to say, okay, let's explicitly do that with a formal approach, and it has various components to it. Self-awareness, recognizing our feelings as children, being aware of our emotions, then having ways of managing those difficult emotions particularly, and then making responsible decisions. That comes into play, I think, more as you get into adolescence. Also awareness, so that's not just about my feelings and how I'm feeling as a child, but actually how do my peers feel? How are they reacting? And then in turn, kind of how can we develop our relationship skills? So there's many dimensions to SEL, and I don't mean to imply this is a panacea for young people and mental health. It's just, I think, one approach that can be helpful. And there is quite a bit of evidence now. There's hundreds of studies, a lot of randomized trials, and actually quite a diverse set of communities and populations that are consistently showing not massive effects. Because you think of this as a pretty light intervention, and it doesn't cost that much. It's sort of it's done often at the school level or classroom level, but small to medium effects in kind of effect size terminology. There are major limitations to this research that we need to continue to push on. The outcome measures are often subjective. It's often the teachers or parents' report of how the child's social and emotional development, which is, can have its biases. And also there's limited follow-up. It rarely goes beyond 1 year, if that, in a lot of these studies. So we don't know necessarily whether these are lasting impacts. The economic evidence also looks favorable for some of these programs. Positive Action is one example of a program, and PATHS, that's a long acronym, is another program that seems to have strong effectiveness and cost-benefit evidence. However, as I've said before, there's a gap between what seems to work and what we're actually doing. Some of the model programs like PATHS and Positive Action are being used, as I said before, in less than 5% of schools. Many districts have no program at all. Although I haven't seen definitive data on this, I'm quite sure that there is a socioeconomic disparity in terms of which school districts have more robust programs, because it doesn't require a lot of funding, but it requires some funding. And also, I think a lot of school districts are dealing with what they probably rightly view as more pressing issues than implementing a new SEL program. Implementation also is often weak, so there might be a program in name, but in practice it's not really being used intensively enough to have an impact. And I had the opportunity to visit, I'm not a qualitative researcher, and I'm in great admiration of some of the qualitative research that we've heard so far, but I did have an opportunity to dabble by visiting the Cleveland School District, and which was pointed to me by one of the national SEL experts as a model of success in some respects for implementing SEL effectively. And so they were really nice in showing me around their district, allowing me to sit in a couple of classrooms at a couple different schools. One of the schools was 100% black students. The other school was predominantly Latinx students, and those were two of the schools that were, according to the administrators there, and actually and based on my own observation, were most successfully implementing SEL in Cleveland. But there are major limitations. It's hard to fit it into the school curriculum. It's hard to train teachers and other professionals sufficiently to actually implement it. And there's a lot of turnover, as you know, in schools and district leadership. So you might get an SEL program off the ground, and then the principal leaves, and then you kind of have to start all over. And funding is not insurmountable. It's not a huge amount of funding, but it is not trivial either. So there's a lot of currents that need to be that we're swimming against. One kind of potential solution to this issue that it's hard to fit into the curriculum, which I wanted to point out, it's also a broader concept, not just for SEL, called a kernel approach. I don't know if anybody's come across that, but I was really compelled from the moment I first read about this. The idea is that when we think about interventions and programs, let's not just think about these like kind of big package standardized programs like a whole curriculum that goes over a whole year, but let's also think about like little kind of micro practices that are beneficial, that we can sort of sprinkle in skillfully and flexibly, and actually allow teachers to decide how to like kind of mix it in to their school day, or allow principals to help figure out how can we mix it into the whole school experience. So they're kind of like little, like for example, in the paths program, they have a lot of these little kernels within them, and one of them is called the turtle technique, which is essentially to think of a turtle as sort of a visual aid or a metaphor for when you're experiencing really difficult emotions as a child, but really maybe any of us could do this. And you first of all, one thing you could do is kind of go into your shell, not in a bad way, but to kind of retreat and allow yourself to process that emotion, identify that emotion. You're hurt, you're angry, you're surprised, you feel let down, and identify that emotion, and then kind of have a moment to think about, well, what do I do with that emotion? And what would be a behavior then, or a response that's going to be productive for myself and is going to maybe not escalate the situation with my peers. So that kind of technique can be taught to young people actually pretty quickly, and then there are ways you can kind of weave it into the day rather than having like a whole laborious curriculum, which is hard when you're competing with other priorities in schools. Okay, so to summarize with SEL, I'd say it's a promising investment. There's still lots of things that we need to learn. Exciting opportunities for growth, since only less than 5% of schools are actually doing what seems to be work best based on what we currently know. And so the research needs to learn more about the long-term investments. It needs to learn more about actually objective outcomes, and also more about the mechanisms, the active ingredients for the intervention, what actually makes those interventions effective. And that's going to help also when we try to adapt the approach to various other settings where we don't already have great evidence. We sort of know at least what are the active ingredients, what's kind of adaptable. Okay, so lastly, just a few quick broad conclusions I'll offer you based on our review, is that there are several program services with quite strong evidence. Not a lot. I mean, it's still probably a tiny fraction, but it's still a good number of programs and services for youth mental health that have strong evidence, and we're not investing, I'd say, nearly enough in those programs, number one. Number two, there's a much greater number of programs and services and approaches that have promising evidence, but still a lot of uncertainty about that evidence. So it's kind of in an intermediate phase where we need to not just prioritize those that already have more definitive evidence, but actually we need to experiment. We need to then evaluate rigorously the outcomes when we do implement these promising programs and resolve some of those uncertainties. Third, I think sometimes there's a debate in the child development world about what age we should focus on, and often people will say the earlier the better, so let's really focus on infant mental health and infant development. But I think, as probably you would all agree, there's no one silver bullet, and we need to consider a diverse set of strategies that kind of build on each other. Scaffolding is a buzzword that I often hear, scaffolding of our approaches over the developmental stages of young people, not just like a great intervention in toddlerhood or infancy, and then that's it. Next, there's some major barriers that are limiting the reach of best investments, as I've talked about, the fragmentation, but we have examples of success. We have states, we have communities that have overcome these barriers, so let's learn from that and let's address these barriers head on. And lastly, many of these investments, I didn't really have time to go into the details, but many of these investments are strong, not just from a benefit cost point of view, but also from an equity perspective. And more specifically, what I mean is that many of the strongest economic investments are also the ones that are targeted or that actually are most effective and tend to benefit the most disadvantaged families. Like home visiting tends to focus on lower income communities, lower income families, and in fact has gotten the best results with those families. I'm saying that as a universal truth because there's definitely some exceptions where we have evidence, we don't have enough evidence, I think, to say that this actually is a program that's going to help with equity, but I think we do have some examples at least. These are just some discussion questions that we don't need to dwell on here, but just if any of you are maybe educators and want to kind of go further with this topic and want to talk about it more with students or other people, these are some of the things I would just suggest you could kind of go on further with. And then lastly, my contact information. I've had a Twitter account for 8 years. I made my first tweet like 2 days ago. So this is my first time ever sharing my Twitter handle, because now maybe I'll think my next tweet maybe will come another 8 years, and I'll still be thinking very hard about what it's going to be. But maybe if I get a couple followers, then maybe I'll actually I'll pick up the pace. Thank you so much.
Sometimes I feel a little silly, like I bet Nissa Palmer, my colleague in English, could have walked up here all by herself and introduced our next speaker, but it is my pleasure to welcome to the stage my colleague Nissa Palmer to introduce our last speaker of Nobel 58.
First, I want to recognize that this conference is being held on the traditional homelands of the Dakota people, as President Bergman and Cyrus and Dave Braveheart reminded us at the conference opening. And I want for us all to reflect on how that reality relates to Dr. Gahn's lecture. Next, I want to express how pleased and honored I am to be introducing Dr. Gahn as the closing speaker of our conference. Dr. Gahn is a distinguished academic who works across disciplines. He is presently a professor of global health and social medicine at Harvard Medical School and a professor in Harvard's Department of Anthropology, as well as faculty director of Harvard University Native American Program. He has received many awards, including a presidential citation from the American Psychological Association in 2021 for, and I quote, his commitment, dedication, and leadership in advancing strategies to disarm and dismantle racism in psychology. His work recognizes the relationships between colonialism, cultural loss, and enduring mental health inequities in Indigenous communities. He is a forerunner in integrating traditional Indigenous culture and spirituality into community-based mental health services and has worked with American Indian and Indigenous communities to improve mental health and promote transformative healing for the last 30 years. His work draws on Indigenous knowledge and medical practice to critique and reform psychology. He's an enrolled member of the Ani Grovant Tribal Nation of Montana, and I would like to welcome him now.
Thank you, Professor Palmer, for that wonderful introduction, and I'm so grateful to join you today and have a chance to share some of my thoughts and ideas with you and to the other panelists who have kept this a lively and engaging affair so far. And our hosts have been amazing. I've never felt so well attended to at any kind of gathering or meeting, and the students have been wonderful. So it's a pleasure to be here. I'm going to see what time we have here so I don't run over today. My name is Joseph Gaughan. That's the English word gone. Sometimes people try to get fancy and say gone or gone. It's the English word gone, and that's because my great-grandfather, who was born in 1886, was put to a federal government industrial boarding school for American Indian youth in 1891 when he was 5 years old. And the practice at that time was to take an Indian kid, his name in Indian, Grovant, was Many Plumes or Many Coups. The practice at that time was to take the father's Indian name as a surname and then give you a Christian first name. So his father's name was Gone to War, so it was just clipped to Gone. He was given the Christian name of Freddie. So Fred Gone is the progenitor of the Gone line at Fort Belknap. The Fort Belknap Indian Reservation is located in north central Montana, where I'm an enrolled citizen. I'm a member of the Aani tribe. There's also the Nakota Assiniboine people on that reservation. My family lines on my dad's side are from the Azure and the Brisboe families, and from my mom's side from the Gone and Crazy families. You can hear that I carry my mom's surname, and I always say it's great that she didn't hyphenate it, or I'd be a psychologist named Dr. Gone Crazy, which might be difficult to attract patients. I just want to echo the welcome that I've received here, and especially to say that I very much appreciated seeing Mr. Braveheart and his son offer a traditional welcome to you as we gathered. This is very important because the problem of American Indian people in American society is one of erasure, which is to say that we're seen as people of the past who don't really exist anymore, and the history of dispossession, so often violent, is really ignored. And yet, not far from this very place, 40 miles away, was the largest mass execution in American history, and that was of Dakota resistance members who were massacred for rising up against really unjust social circumstances. I'm going to be talking to you today about some of the mental health residue or legacy of those kinds of histories. I'm going to be speaking specifically about anti-colonial approaches to community mental health services for American Indians, enacting alternative science. Let me open just by telling you briefly about American Indian mental health disparities. I'll say I use the term American Indian because I'm speaking to a subset of indigenous people in the United States who maintain a government-to-government relationship with the United States, who have a history of treaties, and who are sovereign tribal nations. And there aren't other terms that capture that exact status in the way American Indian does or Alaska Native does in the Alaska context, so that's why I use that term. We can talk about terminology also afterwards if you'd like. But American Indian people have been shown to experience and contend with mental health inequities. There are epidemic levels of distress in many of our communities. Particularly, there has been found to be high prevalence of trauma, substance abuse, and I could add suicide. And yet, the community mental health services that are on offer to remedy these problems are often underfunded, which means that we kind of have this large unmet mental health need in Indian country, if I may. So, we might imagine that the remedy to these inequities or disparities is fairly straightforward. We have pronounced mental health problems in many of our communities. The mental health services on offer are underfunded. The solution looks like it should be simply expand mental health services. Let's get those funded up to where they need to be. Let's get more providers in there. Let's get counseling and therapy available to American Indian people in those communities, right? Well, in fact, I learned very early in my career a very important lesson by going home to my own community, the Fort Belknap Indian Reservation in Montana, to conduct discovery-oriented, open-ended inquiry about these very questions that led me to reconceive or reconsider what the solution to American Indian mental health inequities might be in places like my own home. So, in the late 90s, my very first postdoctoral research project, I conducted interviews on the Fort Belknap Indian Reservation. These were ethnographic style interviews in the way anthropologists would go about doing their work. So what I had to do in this project was to set aside or bracket all the professional knowledge and training I had as a psychologist. You know, how we think about mental health and how we think about the origins and the impacts and the treatments for those. And instead, set that aside long enough to ask questions of people in my own community about how they understood the rise and the connection between problems like depression and drinking and well-being. And so I did these interviews in such a manner as to really hear and listen to what my own tribal members had to say, to understand local construals of culture, drinking, and depression. I ended up focusing on a particular case study with an individual because of how illuminating it was on these issues. He decided in our work together to go by his Indian name of Traveling Thunder. And as I'll unpack for you in a moment, Traveling Thunder had a very specific explanatory model about the relationship between culture, drinking, and depression in American Indian communities. An explanatory model is kind of a concept from medical anthropologists that captures the idea of how local people make sense of and understand the origins, the sources, the impacts and consequences, and the interventions or remedies for different kinds of health issues. And so I was trying to understand better, again, locally, how people construed these things. And Traveling Thunder had an explanatory model that was very, very clear from the things he had to say. And essentially, this explanatory model involved 4 historical epics, as he talked about this relationship between culture, drinking, and depression. The first era he described was one that sounded much like paradise. It was the era of pre-colonial American Indian existence, and here's how he characterized that first era. Quote, "See, there was no drugs, no alcohol in this continent years ago. There were no problems, no domestic problems, no social problems. Everything was good because everyone lived according to a custom and teachings. There was no jails, no hospitals, there was no prisons, no insane asylums. There was none of that stuff because everybody lived according to a strict custom." And so we see this era of pre-colonial existence that Traveling Thunder had in mind was one that was governed by custom, teachings, and it led to perfect harmony, as he said. But of course that era wasn't to last. There was, in fact, this second era of colonial contact, leading in many instances to forms of conquest. And here's how Traveling Thunder described that second era. Quote, "But when the white man came, they forced the Indian people to get rid of their way, their religious, spiritual beliefs. They forced them to trade their economy, which is based on the barter system and on living off of the land, the wildlife, fish, and herbal medicines. Then they turned around and forced their culture on them, their religion, their beliefs, their foreign ways onto them, by taking all the young people out of the schools, of the homes, and putting them away in boarding schools, and forcing the white man's teachings on them. It's genocide." And so Traveling Thunder identified the key signature aspect of this second era as the kind of annihilation of custom that had kept things in harmony and balance prior to the arrival of Europeans. Obviously, this had some impacts, and so Traveling Thunder's discussion of the third era was one of the post-colonial effects of this conquest, an era characterized really by loss. And here's what Traveling Thunder had to say about this third era. Quote, "If you don't know your own true oral history, your true oral traditions and customs, and where you come from, and what's supposed to be important to you, well, you're going to feel empty. You're going to feel like you don't belong, because we don't fit in with the white man's system. We never did, and we never will." It basically boils down to pride. If people ain't proud of who they are, where they come from, and what they're doing, then they're going to be doing these things: alcohol, drugs. And once you're into alcohol and drugs, you're going to probably get into a depression. You're going to not feel worthy of being a human being, and you're going to want to kill yourself. And so I would underscore here that what Traveling Thunder is capturing is a sense of what we might refer to as psychological anomie. Anomie is a term that means no law, but by extension into the psychological realm, it has to deal with a loss of who you are, where you belong, what you're supposed to do in life, basically how to have a good life and how to accomplish that. And Traveling Thunder's idea here, of course, is that that loss of everything that orients you, like a compass to a life, can lead to pathology. And clearly he's identifying what he refers to explicitly as the white man's system as pathogenic, as the cause of these kinds of problems. Fortunately, there's a fourth era that goes beyond this, according to Traveling Thunder, and it's an era of potential post-colonial remedy in which there is an opportunity for revitalization. And here's what Traveling Thunder had to say about that. Quote, "After we looked around and realized that we left something behind, we started going back to the hills to fast. We started going to the sweat lodges to pray and to sweat. We started going to the elders to learn. We never was happy living like a white man. I would give the credit to the Creator and to the spirit world for pitying the people to allow us to get our sacred traditions back. To me, what that ceremony does is you're calling on the Creator, the spirit world, for life or for good health or for a good, clean mind, an alcohol and drug-free mind, or you're calling on the spirit world for guidance, or for survival even survival. And so we have here, if you will, a kind of return full circle to sacred custom. Again, the custom and teachings that kept things in balance and harmony prior to the arrival of Europeans is what Traveling Thunder and others who share his view are hearkening back to as the potential remedy for the problems of conquest and coloniality. Just to be a little more precise, we can unpack Traveling Thunder's explanatory model in some detail. First, he identified a very clear pathological process, that there was colonial subjugation that was realized through all kinds of cultural repression that would then lead to a form of psychological anomie. That anomie could lead to substance abuse and in turn depression, a sense of worthlessness, and ultimately suicide. And that's exactly the order in which he said these things in the quote that I read to you. Interestingly, Traveling Thunder had very little to say about personal distress or the individual experience of these things. It was not what we're familiar with in professional psychology at all. There was no talk of brain chemistry or predispositions in genetics or bad family dynamics when you're growing up or psychodynamic processes gone awry, the kinds of things that we're trained in psychology. He offered a relatively non-biological and non-psychological account. In fact, the little psychology that's in here, you kind of wonder if he didn't address that because I was a psychologist asking questions in a way that sort of touched on the psychological in some ways. Instead, Traveling Thunder really emphasized history, culture, and spirituality as integral to an explanation and account of what gives rise to problem drinking and depression in our community. Moreover, he really clearly attributed all of this to the pathogenic aspects of the white man system. In other words, he's identifying colonization as the original formative cause of native distress. And in doing so, he really emphasized systemic factors over intrapersonal factors. He's talking about systems and settings and policies and the way people have control and exercise that over others. He's not talking about anything going on inside the individual human, the individual Indian person. Moreover, he's talking about shared community vulnerabilities. He didn't distinguish between, this person or that family. He's talking about American Indian people almost in the general sense, because these experiences of colonization and conquest and their after effects, he would argue, are something that we all inherit as Native people and must contend with. Today, we have a language to talk about this in a way that Traveling Thunder did not, and it's the language of historical trauma. And for those of you who followed the development and circulation of historical trauma within Indigenous circles and settings, it is essentially this account of colonial injury and the resulting impacts that trickle down through the generations. There's one key distinction that I do want to point out that I think is important and that we can discuss more later if you like, but he didn't actually reference, that is, Traveling Thunder didn't actually reference the word trauma. And again, he mostly used an psychological language and framing. And so it's interesting to think how trauma has kind of come to the fore as the way to talk about this. It is a psychologization, if you will, of this sort of account in a way that's interesting to think through what its implications are. In any case, you might wonder, like I did, in the light of this explanatory model for the rise of problem drinking and depression in an Indian community, what then is the relevance of kind of psychosocial interventions, mental health services, counseling, therapy, that kind of thing? And so I said to Traveling Thunder after listening to all this, well, under what conditions would you, if a loved one was suffering, going through a really tough time, would you take them down to the Indian Health Service clinic at Fort Belknap Agency and get them to see a psychologist or a counselor for help? Well, he grew quiet in response to that, and he thought sort of soberly. It was a noticeably long pause before he said the following, quote, "I guess it's like a war, but they're not using bullets anymore. They want to wipe us out, therefore the Indian problem will be gone forever. But they're using a more shrewder way than the old style of bullets. If you look at the big picture, you look at your past, your history, where you come from, and you look at your future, where the white man's leading you, I guess you could make a choice. Where do I want to end up? I guess a lot of people want to end up looking good to the white man. Then it'd be a good thing to do. Go to the white psychiatrist in the Indian Health Service and say, well, go ahead and rid me of my history, my past, and brainwash me forever so I can be like a white man. I guess that'd be a choice each individual will have to make. I was very clear in saying this, that this was not a choice that he would make for himself or his loved ones, that this was something that he thought was actually not helpful or therapeutically beneficial at all. So in making this statement, Traveling Thunder, I felt, was making a couple of observations. The first is he recognizing that mental health treatment can, in some circumstances, be a cross-cultural encounter. And in this case, he's really identifying the fact that there are people in our community for whom white psychiatrists are unintelligible in terms of the work that they do. But in terms of cross-cultural encounters, one can have a little hope that, you can have a meeting of the minds, you can exchange and harmonize and come to an understanding and find your way through in the way that people who have met each other cross-culturally for millennia have done. But Traveling Thunder was going beyond that by also identifying mental health services as a potentially tacit or implicit form of Western or modern or professional cultural proselytization. And I use proselytization deliberately because, of course, American Indian communities have long had missionaries in our midst, often with government sponsorship in running boarding schools, for example, to assimilate and civilize our people. That proselytization or conversion or missionary work is sort of a way of recognizing the agendas at stake, and that those agendas might be, in fact, ideological, not just neutral in some sense. So in calling attention to these issues, not only is Traveling Thunder recognizing cross-cultural difference, but also differences in power. And so we return to the initial supposition we might have had in recognizing the problem of American Indian mental health. And that's that simply expanding services may not actually be the answer at all, because we have these problems. First, we have this problem of cultural difference, that American Indian communities and the communities that psychotherapy and counseling were developed out of in Europe and then came to the US were really historically distinctive cultural enclaves. And that the cultural enclaves that gave origin to these practices persist in some of these cultural practices, to differential degrees, no doubt, but still persist in ways that have links to psychology and mental health. And so one thing that is often said in cross-cultural psychotherapy guidance about American Indian people is we prefer indirect forms of communication, that our style may be a little more terse, that we don't look people in the eye, for example. Well, that has to do with the cultural commitment to not intruding on the autonomous personhood of other people. And so, look someone directly in the gaze might be a little too intrusive, actually. So you might stand a little askance when you talk instead of looking directly at each other. Well, that has cosmological implications that ripple through religious understandings as well, in terms of the danger that can happen if you inadvertently offend those powers above through behavior that maybe you didn't even intend. But you have to be very careful around other persons, whether human or non-human, to make sure that you are respectful and interacting appropriately. And therefore, there are kind of cultural, psychological aspects of experience that persist in these ways that matter for mental health as well. Ultimately, the culture of the mental health clinic is not the culture of the Native community. It's probably not the culture of lots of communities, in fact, which is important to recognize in terms of the implications, but certainly not the culture of the Native community. So we have this problem of cultural difference that makes a simple expansion of mental health services problematic. But really, it's the problem of cultural dominance that really definitively complicates this issue, that we are heirs to colonial subjugation that taught us and told us that we were inferior, that we were savage, that we were inadequate, and didn't deserve to survive into the modern world unless or until we could assimilate to modern life. And this was most evident in the slogan of the industrial boarding schools for our young people for so long. The slogan was "Kill the Indian, save the man." The idea that the savagery can be civilized, and that's the only hope for the future of Indian people. Fortunately, that hasn't turned out to be true, and yet there are a lot of casualties along the way in order to determine that. So we have these enduring power asymmetries today that structure all of these dialogues, discussions, allocation of resources, policies, and so on that are not properly taken into account in terms of the work that we might do. This gives rise to what I have called the post-colonial predicament of mental health services for American Indian communities. I put the post in parentheses because it's not entirely clear that we're after colonialism. There are some ways that we are and some ways that we aren't, and so I'm leaving that a little bit indefinite. But on the one hand, we have urgent community needs. Many of our people grow up in impoverished, high-risk settings that wouldn't be good for anyone to grow up in. And the result is a documented literature of disparities in our mental health status that call for some kind of intervention or redress. On the other hand, the kinds of clinical services that are on offer to address these issues are too often incongruent, at least with some swath of our populations. It gives rise to this concern that Traveling Thunder had, that seeing a white psychiatrist in the IHS is basically an invitation to brainwash me forever so I can be like a white man. And this has been attested to by community anecdote and by research evidence. It gets picked up in research studies. For example, Les Whitbeck and Melissa Walls have done a lot of work on Great Lakes reservations around mental health issues. And when they ask community members, parents of children who are in the study, for example, who would you turn to and prefer to see in a time of great crisis or mental distress, mental health professionals don't even make the top 10. It's just not in keeping with what people in our communities see as most beneficial. And that's true for other communities too, of course, as well, as part of the point. Well, I've told you a bit about Traveling Thunder's explanatory model. I've linked that to historical trauma. And in the short time that I have left, I just want to embed all of this within a broader framework that has come together over the decades since I interviewed Traveling Thunder to try to characterize and describe the kind of really parallel but alternative frame of reference that I find everywhere I go in Indian country when it comes to mental health and mental health services. And so in this conference, we've been talking a lot about mental health in a way that, sometimes seems a little transparent. Yes, we know what that means. And yes, we have clear ideas about what to do. But in this presentation, I'm trying to articulate a different set of orientations and assumptions that call into question maybe some of what we take for granted in mental health professional and research circles, to rethink in relationship to local community responses how we might undertake this work. So I'm thinking of an alternative science. Alternative, I presume you get science. It's kind of a weird way to spell science, right? We're used to science, S-C-I-E-N-C-E, as being, the pinnacle of knowledge production. It's how we actually get as close to the truth as possible about how the world works. Spelling science in this way, I think, tries to trouble those sets of assumptions a little bit. First of all, we have PSY for science, and that refers to the psi disciplines. Psychoanalysis, psychotherapy, psychology, psychiatry. These are disciplines that have created knowledge in concert with the arrival of modernity in the past century and a half in really important ways. And yet we tend to think that authorized knowledge, if we're not careful, is just like truth. If we called it science, we might think, that's how the world is, that's how people are. And yet there's an awful lot of cultural assumption and orientation that undergirds this authorized knowledge in the sciences. And so I'm also trying to call attention to the fact that this knowledge is historically contingent and culturally myopic, that it's one way to sort of see these things and not necessarily the only way, and that might have implications for how we go about important mental health work. And so I have 4 domains here I'm trying to just briefly unpack because I know our time is short. Distress, well-being, intervention, and evaluation. These are 4 domains where everywhere I go in Indian country, I hear an alternative way of thinking about the way this might be done relative to professional knowledge in general. First, in terms of distress, it's not mental disorders. It's not DSM categories and classifications. It's historical trauma. And in part, that's because the DSM was designed to be pretty decontextualized, pretty atheoretical, or people are trying to, not have partisan debates within psychology about what a mental disorder is. Historical trauma is trying to re-socialize all of this to say, hey, the reason we have an epidemic of addiction and trauma and violence and suicide is because of what happened in history that violently dispossessed, contained, and mistreated us and created a situation in which generations of our people didn't learn how to be parents, and therefore early family environments can be chaotic for a small subset of people in our communities that then is not good for the well-being of our young people as they grow up. So not mental disorders, but historical trauma when it comes to distress. In terms of well-being, this is a little bit abstract. Mental health professionals don't often talk about well-being. It's sort of implicit that we're trying to get you back to some state of health without really saying or setting out what that is. But, one familiar way to think about well-being in middle-class America is what we might call neoliberal individualism. It's this idea that we're all free agents navigating free markets in pursuit of happiness and wealth. Well, that's not what well-being looks like in most Native communities. Instead, it's the kind of sociocentric or relational forms of personhood or self-configuration that I've kind of referenced in some of the panels already. The idea that your identity is not just about you, but about your family and your kinship, that your obligations aren't only to human kin, but also to non-human kin in religious fashion, etc. So, the understanding of what well-being is alternative as well in the work that I do in these communities. Intervention, different. It's not in terms of professional, like in the way that Professor Eisenberg just talked about, evidence-based practice or trying to deliver empirically supported treatments that science has vetted and determined will help people reduce symptoms and improve their functioning. But rather, and it's important to say almost no Indians have ever participated in any of those studies, okay? It's really reclaimed healing traditions or practices that get Indian people fired up in terms of what to do about addiction and trauma and suicide. Traveling Thunder himself talked about, I asked him, what's the alternative? He said, well, you put up a ceremony and you call on the grandfather spirits, and if you do so with a sincere heart, they say 50% of the time you'll get help. He thought that was a lot better than, quote, locking them away in the state mental hospital, in terms of a form of help, for example. So reclaiming healing traditions and practices is what Native folks see as really important for addressing the mental health issues in our community. Finally, evaluation. How do we even know what works? And in Indian country, there's not a lot of faith or enthusiasm registering for scientific studies, of testing therapeutic outcomes from particular kinds of counseling strategies and so on, but increasingly indigenous ways of knowing. That there are indigenous knowledge traditions that trace back to pre-encounter, some of which persist to today and offer alternative approaches to figuring out what works for whom and under what conditions. I would say the chief one of these would be the valorization of firsthand personal experience. If you think of an elder instructing young people in our communities in an organic fashion, it's often a bunch of stories about their own experiences and what happened to them. And that really is, the most privileged form, the most authoritative form of knowledge, firsthand personal experience. And incidentally, the elder doesn't really then unpack that to say, and for you, that means you should. It's, again, a violation of people's autonomy to tell them what they should and shouldn't do. Instead, you leave it out there, and you even leave it, in some ways untranslated, because that's the person's job, is to figure out how it applies for them in a way that is very agentic. So, whether it's distress, well-being, intervention, or evaluation, there are these alternative perspectives on how the mental health endeavor might take shape in response to the colonial legacy that Indian people contend with. I've written a lot about these things. I can't have time really to unpack this today, but each of these domains I've had stuff to say. You can find more about it here from my website, which again is my family name, Gone to War. It's been a pleasure to talk to you, and I'm looking forward to the conversation we'll have as we gather around the panel. Thank you so much.
Feel free to have a little stretch break as we prepare for our last panel discussion. Reminder, you can submit questions either via Nobel Conference at gustavus.edu or on paper, and please feel free to submit questions about any of our talks. I encourage you to think of a question that might enable our presenters to talk cross-disciplinarily, cross-culturally across their different presentations. We'll reserve part of our time for particular questions about Professor Eisenberg and Professor Gaughan's talks, and then we will have a more general discussion to wrap up this year's conference. So submit any questions.
Hi, and welcome back to the live stream coverage of the 58th Annual Nobel Conference here at Gustavus Adolphus College. We just wrapped up our final presentation of this year's Nobel Conference. My name is Tane Danger. I am your host, or have been your host, for the live stream coverage of the Nobel Conference. Don't use this as an opportunity to click away. I don't think people can click away really from a live stream. I guess you would just shut it down. Anyway, don't do that because we're just getting ready for the final and I think probably most interesting Q&A session of the conference. This is where we bring all of the speakers and panelists back on stage. We do this several times throughout the conference. This one is particularly usually very interesting because we've gotten to hear from all of our speakers at this point. And frankly, yeah, it's a bit of a free-for-all. It's a bit of a grab bag of what all each of them have heard in each other's talks and are thinking about, reflecting on, want to ask more questions about how the different things that they brought to the table work together, maybe where they want to push back on each other. So we are going to get to that in just a couple of minutes. This is also, though, a good opportunity for you, if you are watching at home or at school, at the office, to send in your questions for any of our panelists about whatever we've heard today that you want to hear more about. You can email questions that you have to nobelconference@gustavus.edu. Again, that's Nobel Conference, all one word, no period or anything in the middle. nobelconference@gustavus.edu. Submit your questions. We heard from Lisa Helke, the director of the Nobel Conference, earlier, that during this last session, they lean more heavily on questions that all of our panelists might be able to respond to or might have something that they want to say about. So again, if you have things that you are wondering about on this topic of mental health inequities in young people and would like to pose to the entire panel, this is your chance to do it. We got to meet some of the students yesterday who actually sort through those questions and help bring them to the front of the stage, both from online and in-person audiences. And so they're anxious for your questions, so send them in. I will say we've had a big, exciting, full 2 days now of presentations on a variety of dimensions of this topic of mental health in young people. Yesterday, we had 3 sessions. There was a theme that sort of emerged between them on the impacts of technology and oftentimes social media, sort of internet connectivity technology on mental health in young people. We heard some points about sort of the increase in examples of issues that many young people deal with, having some correlation, if maybe not causation, with rise in social media and connectivity. Again, like very challenging to sort of say like this causes this, but that we did have some reason to believe that this is, as Lisa Helke has said many times, a double-edged sword at best, the technology piece, because we also heard that there is a huge piece where technology helps people find community, find some of their peers that can actually decrease some of these issues, which led us into today's conversation, which is very much about identity, community, and how we find people who hopefully help us create the connections and bonds that change some of the trajectory that we've seen in some of these other folks. So, as you just probably saw, I had a panel that just walked in and joined us, which I'm very excited about, who are here to help us sort of just reflect for a moment on what we've heard. And yeah, actually, I'm sort of sad because this is my last sort of panel with students after 2 days of chatting. So I don't know, I won't be sad too much. I'll just ask you if you're willing to quickly, people just saw you, but if you don't mind reintroducing yourself briefly, each of you, who you are here at Gustavus, and then your role with the Nobel Conference this year.
Hello there. So my name is Vita Fejčak. I'm assistant professor at the Department of Economics and Management. So I'm here in this conference, I'm a faculty host for Daniel Eisenberg.
Fabulous.
I'm Lisette Salgado. I'm a senior, psych and LALAX double major and a Spanish minor. And then I am the student host for Daniel Eisenberg.
I'm Genesis Tompkins. I am a senior psychology major, double minoring in political science and economics, and I'm also the last student host for Daniel Eisenberg.
Okay, fabulous. So I'll just ask you, that was the last talk that we just heard, was Professor Eisenberg. Reactions, thoughts, are there pieces that for each of you that really sort of resonated or you're still thinking about from what you just heard?
Well, for me, I am really interested in like children mental health. I want to pursue that, hopefully, especially with the Latinx community. So hearing and learning more about his research was very interesting to me.
Also, on top of that, just hearing the economic point of view from it, we have a vast majority of different like disciplines that were here today, and honestly, just hearing the economist side of it just like gave me a new perspective into mental health in adolescence.
Yeah.
I guess for me, the most shocking thing was the gap between the programs that we do and the evidence that we have. Like one of the numbers he cited, less than 10% of the programs that we implement have any good evidence that they are working. So we are basically making decision, I don't know, out of the blue.
Yeah.
And sometimes that decision is not reliable.
Yeah, and this was a really interesting piece to this because we've been talking throughout this live stream coverage about what the Nobel Conference is, and one of the interesting things is that it is this multidisciplinary conference, and this was very interesting because he's an economist, and that's the discipline that he brings to some of this, and was framing some of these conversations that we're having. And how do we actually assess whether some of these programs, some of these interventions are working? I might ask the students, like, are there pieces of that were interesting to you all, either in thinking about the coursework and what you're doing here as students, or even thinking about, going into the future, your careers and work someday?
For sure, being at Gustavus, it's great that I'm able to do a lot of different departments and work in different areas. Like, I'm a psychology major, but I'm also in the economics department, and I'm also in the political science department. And then I can take classes in communications, and it counts for another credit.
Yeah.
So it makes a lot of sense, and I'm glad that we were able to see professionals come and talk about their interdisciplinary as well.
Yeah. Okay, I am very short on time, so I'm going to just ask very quickly if any one of you wants to jump in and say, we're going to go to the Q&A here. Is there anything that you're hoping that they still talk about, or any last question that you're hoping that, or topic that we get to still in this last sort of Q&A session that we have?
I'm hoping they will discuss, especially Professor Eisenberg, will discuss how whatever he learned in his research, how it helps him to inform his work as a faculty advisor, as a parent.
Yeah. How to actually put it into practice that way.
Yeah.
Yeah. Okay. I so appreciate all of you coming in. I really do apologize for having to cut it short, but I'm getting the signal that they are literally on stage right now, all mic'd up and ready to go. So with that, thank you to the three of you. Everyone watching at home, we're going to go back to Lund Arena right now, where we've got the entire panel from the entire 58th Annual Nobel Conference lined up, ready to go, and to answer questions from each other and from you in the audience. So without further ado, we're going to go back to Lund and Nobel 58.
Thank you.
Thanks.
Okay, so let's reconvene for our last panel discussion. And as I noted, we will devote the first portion of it to questions specifically directed at Professor Eisenberg and Professor Gaughan, and then we can conclude our discussion with questions that might bring our panelists together to have conversations across each other or with each other. And again, Marie Walker will be in charge of us.
Okay, well, this is our last chance to hear you and get your ideas and thoughts on this really important issue. I do want to just start out just to give a shout out to the Nobel Committee members who brought this wonderful panel of people together. And it's been an ongoing process where some people have had to drop out and some of them became faculty hosts. But I just want to say their names here. And so that's Angelique Dwyer, Darcy Donnellan, Hannah Godbout, Heidi Seltzler-Barr, Patrick Heath, Steve Bennett, Emily Odermatt, and Roxanne Anderson. And others who along the way helped in this process, I want to thank you very much too. Now, to get started, of course, we want to open it up to the panel. I know it's the end of 2 days of lots of information, but I wonder if we could maybe start off by talking about any thoughts, questions, comments you have for Dr. Gahn or Dr. Eisenberg on their talks. Yeah, please.
Traveling Thunder is a king, an icon, like a scientist. I think I love him. His analysis, I mean, so the white man system that he talked about, the whole framework, I just think is genius. And you said that you had, like, people have similar analyses as you talk to them. Can you say more about just how widespread, like, or how consistent his analysis is with other people that you've spoken to over the years?
Yeah, thank you. I think when you do interviews and you find a particularly illuminating interview, it's one thing to unpack it and talk about what's there. It's another thing to try to really establish its generality. And I think the proof of the generality of what Traveling Thunder had to say in most aspects is the fact that when we talk about historical trauma in American Indian and Indigenous health circles today, it is essentially that model. It has to do with colonization leading to these impacts that then, there's a intergenerational transmission of something, and what that something is open for debate or up for grabs, that then put current generations continuing at risk. And really it's trying to historicize and contextualize the kinds of suffering that we see in Indian countries so that it's not just me as an individual being defective in some way or being deficient. And that can be paralyzing when you feel that way and you don't ever try to maybe reach out for help because you're so hopeless in some respects. But historical trauma, we have what we call the 4 C's of historical trauma that kind of capture it. It's colonial in origin, that's really important. It's cross-generationally transmitted. So, kids who grew up in these boarding schools who didn't have good parenting and weren't really well cared for at these schools, are trying to raise their kids on their own, and maybe they're not so good at it for a bunch of reasons, and their kids, so that's intergenerationally passed down. It's cumulative. So, like on the Northern Plains, our peoples, in some instances, were first, killed off by the army. Those who survived were locked away on a reservation, which was essentially a prison camp. Then they were promised rations and food and survival goods that never came. That was the origin of the Dakota War here in this area, for example. They were starving because the government goods that were, agreed to by treaty didn't show up. And then you've got disease, and then you've got your kids taken out to go to these schools that you weren't really approving of and not what you would have wanted, etc. So it's cumulative, it snowballs across all of these different instances of colonization. And finally, it's really important that it's collective, that it's everybody has been touched and carries this legacy and has to grapple and navigate it. Now, I think sometimes historical trauma can be a little overreaching. Like, I do think that there are more responses to colonial subjugation than only, traumatic injury. I think we can also get angry. I think we can also resist. We can also bounce back. A lot of people do. And, the Indian narrative, everyone in America knows about Indians to the tiniest of degree. And if there's one thing that everyone in America knows about us, it's that we're tragic, right? Mm-hmm. But if you come to our communities, there is tragedy in our communities, but there's also a great deal of fortitude and resourcefulness and resilience and humor. I mean, Indian people can be very funny, and it's just the times when I laugh the hardest are at home or with relatives or family. And that's the part you don't get to see or don't get to hear. It's not represented. And so, yes, we have our problems. You know, it's a subset of people, families in our communities who have these problems. It's a larger subset that you might find in Middle America for some of these problems, but the majority of people don't have these problems. And yet are trying to contend with poverty and all of the disadvantages and adversities that are the errors of dispossession and, you know, getting a raw deal in America.
Yeah, please, Dr. Barrett.
Thank you. Thank you both for very interesting, very different approaches and talks. And I do have a question at the end of a few sentences of what I'm going to say, and that refers to the idea of the evidence gap. Daniel was talking about the evidence gap, referring mainly to the idea that the evidence we have is not always attended to and that we don't always do the right thing, let's say, in relation to that evidence. And I guess on that, just a quick note to say that we also don't capture always evidence of best practices. So just to complete that idea, there's a lot going on that is amazing, but if it's not captured, and if it's not captured, it can get lost, which connects then to the idea that Joseph was pointing out, which is we don't need evidence as much as we need to listen to the ways people find meaningful to address their needs. So it all seems to be connected and contradictory, but I wonder whether the way out of this contradiction is to think that perhaps we do have a place for evidence that is perhaps an important place to gather the kinds of resources we need to support the activities that are needed, but there are many different ways of gathering evidence and there's many different types of evidence, and perhaps that's what needs to be focused on. But I don't want to give the answer. This is just my interpretation of where the middle term might be. What do you think?
Maybe I'll add, I think there's another angle that could help reconcile the kind of what looks like a contradiction between the two of us is actually economics, for all its limitations, I think one strength of economics is that it basically says the best judge of whether an individual is better off is that person, the choices that person makes. So what better way to determine whether somebody wants to or is better off doing something or receiving something than actually whether they decide to participate or receive that. And the problem, of course, is that a lot of our evidence, as Joe mentioned, a lot of evidence does not include certain groups. So we don't even know, we don't have the evidence, but I think if we did collect the evidence and we based our outcomes on what are the valued outcomes for the people with whom we were collecting the evidence, then I think we could actually use evidence to support our decisions.
Can I just follow up with that? I just had some concerns and like similar questions about, who published the, papers on the evidence. Like, were they qualified to know whether these programs were good for people of color? And as you work on your book, I'm sure they're going to be, the world basically is going to be looking at your book and thinking about, well, do these programs work? And in most cases, we actually don't know if they work for everybody. We might know if they work for white kids, right? And so do you explicitly say in your book that you are not speaking for all populations? The evidence might be sound for, white populations, but not for others.
Yeah.
And I have concerns because I have sat on review committees for social and emotional learning, Institute for Education Sciences. They repeatedly fund, majority populations who have zero training, with people of color, aren't qualified to, in a lot of cases, to collect data, to design programs for people of color, but yet consistently they were the ones getting funded, right? And so just like questioning, you know, the evidence.
Yeah, thank you. Yeah, I think I'd say we've partially, I think, made those points, but I think this is really helping me. We're in the final stages of revising the book, so I think we're going to now do it more effectively, so I appreciate it.
And did you want to respond to the question as well? And
Yeah, so we can question what counts as evidence and why, and alternative construals of evidence. And then the problem, I think, is that one group's evidence can be another group's lack of evidence, you know. So evidence-based practice in mental health is premised on the idea that we can't know off the tops of our heads what really helps people recover from mental health problems. That's a very difficult thing to know. And the late clinical psychologist Scott Lilienfeld published a paper that has something like almost 30 reasons why you think a treatment worked when it really didn't. So off the tops of our heads, there's sort of limitations in our ability to reason. And the idea of these kinds of scientific approaches is to try to expand or extend our rationality and to see or detect patterns that we can't see without statistics, for example. It's in some ways like a cognitive prosthesis, these statistics, these scientific approaches. It extends our ability to know things. Well, if Indian people are saying, especially with traditional precedent, that first-person experience is the pinnacle, well, you've got a huge divergence right there in terms of the deep skepticism and suspicion of personal experience. Like clinicians will tell you, I do what I do because it helps my patients. I don't need to know how scientists have vetted and validated these things because I know it works, I see it every day. And yet, as Daniel pointed out, you know, the uptake of these evidence-based approaches is so small for the very reasons I'm saying. So, you know, I think it isn't always just a question of definition, it's also a question of what counts as what for whom and how to have those dialogues and discussions. I think Indian people can be engaged in a dialogue in which there can be skepticism about personal experience in a way where they might be more open than otherwise. But I'll tell you this, Indian people have been subject to bureaucratic rationality for so long in our history that our faith in that ability to improve our lives is nil.
yeah, Dr. Alper, please.
Yeah, I had a question for Joseph in particular. I guess thinking about the youth angle on some of the work that you're doing, and I guess for me is so focused on like how young people are using technology to connect with one another. I'm specifically thinking about other young people, but very often that positions young people against adults, like adults not understanding what kids are into and interested in, but you're also kind of, you know, really a paradigm shift around that where elders are so central to a culture. And so the idea that, oh, adults don't understand our culture because it's youth, that like youth adult doesn't operate in this space. So that's, I think, really interesting because I realized I was gonna ask a question about, you know, I also know that internet connectivity is something that's very like choppy, that is not necessarily, broadband is not widespread, you know, across sort of Indian country, and that's also like a failure of the government on another level. But to what extent is social media, like young people connecting and sharing, I don't know, like resources, if it's about creating one's own community and sharing one's own culture, and now we have, I guess, other tools for digitally creating resources, or, you know, being able to archive history in ways that didn't exist before, and whether that's like native medicine, or, you know, that but that's also maybe in contrast to oral culture, or, you know, the culture of physical gatherings. So I guess that's a lot of different questions altogether, but yeah, just the question of sort of young people's relationship around these mental health issues with elders in the community, and to what extent peer support, the internet. But I'll add another caveat there, that the internet I know can be a minefield for Native youth. Like nobody needs to see like somebody's Halloween costume and like a Native headdress and then be exposed to that, because, you know, being online also exposes you to some terrible imagery that doesn't make you feel good either necessarily. But yeah, so that's sort of my question.
I mean, anyone who's Indian in America and accesses popular culture in any sense encounters those stereotypes all the time, every day. I think I said to the students in our meeting yesterday, Indians are simultaneously everywhere and nowhere in America. You can drive down your streets and see the street names, the mountain names, the streams names, the state names, the city names that are native names, for example. And yet, in terms of ever interacting with an identified Native American person, that's a pretty rare experience for most Americans. In our community, elders are venerated precisely because they have a long duration of that very first-hand personal experience that is the most authoritative way to know things. And so whether we call that knowledge or wisdom or whatever, they are, so important. And my people, the Aani people, were one of 5 tribes in North America to actually be literally age-graded for men. That men sequentially moved through a bunch of stages together over the course of their adult lives, recognized by different ceremonial inductions and some cohorts of men. And the elders, of course, ran everything. In fact, I think from a young person's perspective, you could almost criticize that of being a gerontocracy. I mean, I don't know what young people. I don't know how much power they have, potential, and they did things, but it was old people who called the shots. And it still is the case that old people call the shots on many important things. But the other counterbalancing aspect is this respect or regard for personal autonomy, and that you don't intrude and make other people do things, except in very rare circumstances. So maybe there is some counterbalancing to that. With respect to young people, I think that there are a lot of interesting projects that use technology like photo voice, which we heard, and Nick, you talked about that as a methodology, where people are trying to wrestle with their experiences and get that photographed and set to music. And those have been really interesting to see how young people are working on identity issues in Indian country through projects like that. Another big way that young people are reproducing indigenous cultural forms is through language revitalization. That's really common around reservations throughout the country. Most communities are concerned with that, and digital platforms play a huge role in that, from recording and having a video of elders speaking. And there's been great stuff even around this old form of what was called sign talk. On the plains there was a sense of when you talked, you gestured in accordance with what you were saying, so people could meet and talk who didn't understand each other's language, but could still understand each other because of the sign talk was what was common, not the spoken language. And so this system of gesture and communication was such that, a video is necessary to sort of, I could still see my grandma telling me stories in which how she held her body, how she used space, how she, that's the kind of thing that won't be reproduced unless, people are learning that in sync with language stuff. And so I think digital access in that front has been really important for that effort. Facebook is huge. Why? Because it's free. You can Facebook message people. You can communicate over Facebook without paying money. And if you live in a poor community, that's really important. So that's I think other youth cultures might have left Facebook behind long ago. That's not true in Indian country. Anyway, those are some thoughts. And the orality, I wanted to say. I think some of the work that I do is taking the writings of my great-grandfather, Fred Gahn. I told you his story. In 1941-42, he was employed at the Fort Belknap Reservation to record, folklore was what it was called. He wrote 700 longhand pages of biography, of coup tales, of myths, and a biography of our most famous medicine person. And I'm in the process of trying to edit that and get that published as an entire collection that's faithful to the way he recorded it and so on. But the issue there is the transition from orality to literacy, and there's been scholarship about, the different kind of mentalities that are associated with oral tradition and written traditions. The main difference being that writing distances from things. And there's all kinds of implications from what that distance might mean to making science possible in the way we think of science, like in university modern life, and so on. And so I do think that it is interesting to think about what the oral tradition means when it's recorded and archived and online. If an older traditional model of what it means to give thought life through breathing and vocation is like an impact metaphysically on the world. What does it mean if that's recorded and put on a website? So I think there are implications of these things that we haven't traced out in all kinds of interesting ways.
Mm-hmm. I cannot help but say at this moment, my entire discipline is grounded in the work of a man who did not believe in writing. Socrates objected to things being written down, and we venerate the writings about Socrates, which has always seemed to me a deep contradiction and a suggestion that, Western philosophy ought to stop right now, perhaps. And I'm just kidding.
We do have some questions here. Are there other things that, before we go on to those, that you wanted to ask or add?
I would like to ask Daniel a question. So you were talking about the social emotional learning programs, and of course I don't know a lot about how they operate in the US or what the discussions have been, and maybe that's exactly what's been discussed, I have no idea. But one of the things that strikes me is that there was this, for example, this whole relational aspect to it, right? And of course, relationships are governed by different norms in different subcultures. And so I wonder whether those programs tend to be culturally informed or whether they are actually, which would be favorable for inclusion and for people to be able to be flexible about accepting and valuing and celebrating each other's ways of being social, or whether they are actually assimilative tools.
Yeah, I mean, there's hundreds of SEL programs, so it's I think it really varies by program. I certainly don't know about all of them. I do think, related to your point, I think SEL programs have come under fire recently from, I think, kind of more conservative parts of groups within the country, because some of the programs do have kind of social justice elements to them explicitly, and even have been accused of incorporating critical race theory. And so I think, I mean, SEL, and I think it makes sense because social emotional development, a lot of it has to do with understanding the cultural context that we're all in, and the differences and the backgrounds of people around us, and identities that lots of people have within each community. But it has made it more complicated, I think, from a political point of view. And now like the state of Florida is trying to practically ban SEL programs. So I know that that's not quite a direct response to your question, but I think it gets very complicated. I don't know if Brandisha, maybe you might know more than I do about kind of how some of the SEL programs might actually incorporate the considerations she's asking about. I don't know, from your education expertise, but from what I've seen, it's not, for most of the most evidence-based programs, that's not a big emphasis. It's really an attempt to kind of hone in on some things that we hope might be universally helpful. But, the caveats that we've been talking about all apply.
Okay, well, thank you. We have some interesting questions, and I think this one in particular, there's talk of, and there has been for a long time, of reparations to both peoples identifying as American Indian and Black Brown people. And so how, if this were to happen, what do you think of reparations, and what, if anything, might be a better alternative, or whether it might impact the mental health of young people in some way to make them?
I think it's for you.
Pardon me?
I know you was looking at us, but I think it's a question for you.
Yeah, Joseph and Dr. Ghana, and of course Dr. Thomas.
I teach at Harvard. Harvard just released a report on Harvard and the legacy of slavery last spring. And in that report, it traced the tawdry history of the fact that Harvard has been deeply entangled in the legacy of enslavement of African American people and of Native American indigenous people throughout its history. Slavery in New England, when it began, was native slavery, actually. But most of the enslaved people who are named in that report were of African American descent. And so Harvard set aside $100 million to try to engage in ongoing repair and reconciliation around those issues, including to both people of African descent and people of Native American indigenous descent. And I'm proud that our president, Larry Bacow, took this initiative on and is trying to make some effort, not only to apologize and to admit wrongdoing, but to find a way forward. I would say for indigenous people, repair and reconciliation in general is a very important thing to do. For us, the issue has been land and dispossession of land. So one way to think about America is that it was founded on stolen African labor and stolen Indian land. And the violent dispossession that led to the taking of land everywhere throughout America is a history that has been erased. And so recovery of that history and recovery of renewed relationships through reconciliation, I think, is crucially important. I think that Americans cannot have an appropriate understanding of themselves and their nation without being in proper and restored relationships to Native and Black people, among others. And so I think it begins with outreach and connection to and dialogue with surrounding Native communities. There are lots of Native communities in the state of Minnesota. There are some not far from here. And a recognition and acknowledgement of those histories, including the ugly facts of something that happened here at Mankato in the 1860s, for example, and the details of the Dakota War, and the long and tawdry history of neglect and abuse and those sorts of things. Because until those histories are acknowledged, apologized for, and some repair is made, we can't tell an American story to be proud of that isn't false. We need a new way to talk about who we are as Americans that is inclusive of all of us. And so I think it's crucially important that institutions and communities reach out and undertake this effort.
Okay. Okay, thank you. I think I'm going to move us more towards more general questions for the panel and talk about, someone has given in the question about a public health crisis, and if we looked at this issue of mental health in young people more widely as a public health crisis, as Dr. Loy, Dr. Alper, and Dr. Eisenberg had mentioned, especially within the context of racial ethnic differences in mental illness severity. So how might this affect factors like stigma, bias, or access to care?
I can at least talk about it in the context of autism. So there's a really storied history of like how autism came to be diagnosed and who was studied under the first sort of models of what autism is, but it's in its contemporary form, especially through the DSM, there was a moment where sort of autism was defined as a category to be explicitly a white diagnosis, which led to then certain kinds of resources being associated with it. And childhood schizophrenia got to be then the category that children of color got to be kind of under, which was not then connected to the kinds of resources that autism was connected to. And that history of misdiagnosis or of gaps in receiving a diagnosis sort of traces to this day, where you have kids who, and I write about in my book, who receive emotional disturbance diagnoses as opposed to autism, and then they miss out on all of these services that could have helped them as they grow up, because they don't then get connected to that in terms of public school education here in the US. So I think some research has shown that those gaps are starting to close somewhat, but the whole aspect of culturally specific services, culturally rooted, like who's delivering the services, and primarily how white the delivery of those services are, continues to be a repeated barrier in how effective any of those services can actually be. Like the service professions are very white and like cis women oriented. And so how, and whether or not those systems are then appropriate in general, thinking about Professor Gahn's work, that system itself might not then be a functioning system to begin with. But I just think I personally think learning the history of diagnosis and medicine in this way, like the way that the DSM pathologized, being gay, the way that it was, constructed as a pathology, that I think that's a history that people don't talk about when we define what is healthy, what is considered quote unquote normal, and how normal gets constructed around these specific categories. That I just think that I wish that was part more of general education, more broadly.
Mm-hmm. Yeah. Does anyone else want to address that sort of mental health treated as a public health crisis? Or I can go on to the next question, or no?
I guess maybe I just in terms of you mentioned access to care in that question as well, and while we haven't I think emphasized clinical services all that much in this panel. With another aspect of the so-called crisis is the difficulty in finding a provider for those families and children who do want mental health care, whether it's a psychiatrist or a therapist. And it's even that issue is even worse, I think, for families of color who would like to find a provider who shares some aspect of their identity. So I think and particularly not just because it's partially because of where people live and the availability of providers in those areas, and partially because there's underrepresentation of people of color in the workforce. So that's another dimension of the issue in terms of access that I think it's going to need a lot of work.
Okay, thank you. Yeah.
I guess, so not so much on the mental health aspect of it, because my expertise is more on loneliness, but on loneliness itself. So there's a parallel there, because there's a lot of people writing about how it is an epidemic and how, and so on. And that has been a double-edged sword. So it has, of course, been helpful in one way, because it has drawn attention to the issue and liberated some resources to start thinking about the issue in more concrete and effective ways and so on. But at the same time, it has led to a lot of popular writing that has been highly stigmatizing, a lot of media coverage that, calling loneliness the leprosy of the 21st century, or equating it to a plague, or talking about loneliness as contagious. It's counterproductive, really, because who wants to go close to someone who's contagious? And being close to someone is the whole point when addressing loneliness, of course. So we do need to be very careful about how we talk about these things to reap the benefit of the attention that is drawn to them. But I don't know if there is a clear parallel in mental health.
Okay, thank you.
I would just quickly add that, as I tried to say in the wake of a presentation like I offered, that no amount of mental health services, or indeed of any health services, is going to remedy the ills of Indian country. The problems that we have are, as Traveling Thunder talked about, historical and spiritual, and they have to do with legacies of disadvantage that healthcare cannot fix. It's not designed to fix those kinds of issues. And so I think the larger question this raises is to what degree is medicalization useful? Under what conditions is medicalization useful? We're talking about youth mental health, but a lot of what we talked about isn't mental disorder. Again, it's stress or distress, or maybe shading into injury. Some cases, maybe mental disorder, although there can be resistance to even whether some things are best thought of as a mental disorder. But in any case, I think that, if we medicalize those things, we get the benefit of access to resources and an access to someone who we can say it's your job to fix it. But there's very strong limitations on, and there's actual, side effects, if you will, of doing that, of medicalizing things as well, in which, social justice issues get reframed as a problem between an individual patient and her doctor. And that's not how social justice issues are going to be, ultimately resolved. And so I think we have to be careful with the tantalizing allure of medicalization and the healthcare sector to solve problems. So let me just close in my remarks today just briefly with a comment to young people and mental health. I can understand why young people are contending with mental health struggles in this day and age, given all that's gone on in the past 15, 20 years. 9/11, and you've got the war on terror, then you've got 2008 and the recession, and a whole bunch of people, not just working class people who've been struggling for a long time to find ways to continue to make a livelihood, but suddenly middle class people, college graduates weren't able to be on the usual expected path to careers. And, that's the middle class sort of, the value of freedom and authentic expression. A career is the way that's done. And when that gets even for the middle classes, then you've got trouble. We've got a looming climate crisis that's, and not much being done about it. That we've now got racial reckoning that sort of seemed like it could be possible, but it's not clear what's happened to that at this point. There's so many troubles in the world right now that I think if I were young, I would be very disappointed. And I think, if we take a lesson from Traveling Thunder about the consequences of anomie, of a loss of a sense of who you are, where you belong, what you're supposed to do, what's your purpose, then we can recognize that, it could be a really tough time. And yet, I will just suggest that maybe the answer to this is not so much counseling and psychotherapy, and I don't want to, those things can help, take advantage of them, but probably getting involved in some kind of purposeful action to save this planet and to restore this society. And I know you all are already doing a lot of that, but finding common cause around those kinds of issues might in effect resolve some of the loneliness and some of the uncertainty and some of the alienation, etc., that otherwise are so difficult to face and contend with. And Lord knows you have a lot to sort out, I'm sorry to say. Thank you.
I'm sort of torn because it seems to me that it's like, okay, so what do we tell young people? What do we tell practitioners? We have a bunch of questions. I don't know.
You're the boss.
There are different themes that are coming out of this. And I know at lunch we talked about what are questions that are important to ask. And what are your thoughts on what we do now for people who are practitioners, people who want to help young people, researchers, and for the audience, the people who are out there who want to help themselves or help their families? Where do we go from here? Yeah, Dr. Alper.
I think I'd be like reading books, but books are knowledge and are power, and it might be a zine, it might be, something else, but I think that there's so many forms of knowledge that are outside of like textbooks and, journals that are prestigious, that have high impact factors or whatever, but the ways that community knowledge gets shared, like someday, it might be on Twitter these days, it might be collected in self-published books, it might be, through these more creative practices. But I think looking outside of the forms of how knowledge is produced that have been historically gatekept, that kind of curiosity without also being, feeling like you know because you finished the book or something. But I think that kind of innate, developing that kind of innate curiosity to wonder how much you have not been exposed to, and then follow through with that kind of a disposition, because people get very defensive very quickly and very easily. And so I don't know how that comes through in the kinds of classes that people take when they're in these kind of programs that are meant to, train folks. But I just think that, at least when I think about in the disability community, how much folk knowledge and wisdom is so counter to what the textbooks and what the published literature says, and how harmful that material is, and yet people keep getting trained on those same literatures. This comes up a lot, is them citing and giving reference to those people. So sometimes knowledge gets extracted and then not acknowledged and not given credit to. So I think more of that can happen for clinicians and practitioners in a broad way.
To help them take perspective and okay, yeah. Are there others that have something to add to that about what researchers or...
I agree that books can be amazing sources of knowledge about other types of lives, other worlds, other ways of being. Films also, but I also think about representation, really. I think we talk a lot about that, but perhaps it becomes a little bit banal. But if you think of schools, for example, to actually encourage teachers to represent different types of identities and show students the example and be a safe haven for the student if they have questions or want support, but also bring in speakers to schools that talk about lived experience of this and that and are able to then stay longer and talk to students. That kind of thing can really make all the difference between feeling valued or not, having the vocabulary to express yourself and your questions and your doubts or not. So, I'm sure there's a lot of schools already doing this, but not all of them are. And a lot of it is because they don't have the resources to do it. So we go back to the big picture again, but it has to start somewhere. And I do think that gathering the evidence will be important to get those resources to multiply and to continuing.
Okay, yeah.
I think we've partially maybe kind of painted a gloomy picture about the situation facing young people today, but I think we maybe haven't talked enough about a reason to be very hopeful, which is an asset that young people have today, which is that I think it's clear that young people are more knowledgeable and more motivated to address mental health than ever before, more familiar. Not that, of course there's variation across individuals and so forth, but I think we have all kind, even I'm sure at Gustavus there's probably multiple student organizations dedicated. I've heard about some of them dedicated to wellness in the community. So I think more broadly, there's just an opportunity to empower young people to actually be a part of the solution and to promote well-being within their own communities, which they understand better, I think, than we do as researchers, like kind of external folks.
Yeah, thank you. Dr. Lloyd, Dr. Lloyd first, and then.
I think sort of maybe part of I've been thinking, just absorbing. So sort of to your previous question about maybe pertaining to ethnic and racial disparities and what does that mean in terms of stigma, I think what I've taken away from the other presenters and kind of shared conversations here is that we can all learn from one another, and by contextualizing and decontextualizing sort of, and then putting it back together, what it means by mental health, and from very different perspectives, different ways of expressing distress, different ways of understanding distress, not necessarily as disorders, but as historical trauma, as systemic oppression and racism, and all forms of isms. Hopefully, I think, kind of like Dr. Eisenberg just mentioned, empowered in a way that we can maybe start to really destigmatize mental health problems and allow people to talk more about sort of what environments are doing to us and not just something wrong within us. And maybe then we can collectively come together and kind of have those conversations and solutions. So I'm a clinical psychologist by training and still, work with clinical psychology doctoral students and folks who want to go into the traditional American health professions, and we oftentimes get to the point about not only racial trauma, but just all kinds of trauma and distress and problems that we see in the consulting room is, well, it's really not just really psychopathology, it's pathology in our society. So that kind of goes back to your question of now what? Like, what do we do? I think as maybe clinical psychologists I sometimes feel like our hands are a little bit tied. We have some tools to help one-on-one, but we need to go broader than that.
Okay, yeah, thank you. Dr. Tynes?
So this is in response to the question about, what we do. I think both as, a college student or the lay person here and researchers or people who are serving communities, we need racial literacy. Yolanda Seeley-Ruiz has a racial literacy development framework that I recommend everybody sort of take a look at. And a part of developing racial literacy, and I think this is important, in the U.S. context, but also around the world because white supremacy is global, and so an important part is this archaeology of self, where you're really sort of doing a deep dive, a deep excavation of, your own beliefs, and how you have come to know what you know about different people. And I think also, as you develop your racial literacy, sort of having a sense of humility, and learning everything that you can, just devouring, like I said yesterday, the banned books and connecting with people, getting mentors to help you on your racial literacy journey. And I think once you have racial literacy, from policymakers to teachers to, everyone, to clinicians who are serving people in terms of their mental health, once they have racial literacy development, you have a base. You can actually begin to change the world. But yeah, I think that's a key for just about every stakeholder involved in our journey to equity and mental health.
Okay. Dr. Ryder.
Yeah, one of the things that I would add, and I know I've said this before, but I encourage people to be in community with youth, talk to youth, ask them what they need, ask them to be involved in the decision making. So the project that I presented, and I think it was Dr. Eisenberg who actually used the language of YPAR, so Youth Participatory Action Research, that project falls under that category. And I think it's important to to name that because, the communities that we're talking about, so much information is often extracted and also is not credited to them, and also they don't get to be the decision makers. And for projects like that or being in conversations, you can have them be a part. So when we're talking about research, have them be involved from the beginning to the end. The participants in the presentation all gave me permission, so to speak, to be able to present their work, right? They are involved in all of the decisions around it. And also how the data will be used, and I think that this is important because it is their words. This is what they want people to know. And they want people to know the hardships. They want people to know the joys that they have. And they also want people to know that the system is broken for them. It was never designed for them, and they want to figure out a way to fix that. And to Dr. Joseph Gahn's comment around thinking about ways to be more action-oriented, this is also what they're asking for, at least for trans youth and trans people of color. There is research that says one of the biggest resiliency factors that they ask for is to meet other trans people and also specifically other trans activists, because then they can be in the action of actually creating something different for themselves. It's this part of dreaming and doing that is so important. And I think so so much gets consumed in like the adults are making the decisions because we're the ones with the jobs or with the power to give out funding and all of that, but really like we need to have their voices in it.
There's another question from our audience, and it is, accepting that there are cultural differences, can the panelists talk about some things that all young people require for their mental health, regardless of their culture? Can they talk about what they are and how they can be provided?
I'm sorry, what was the last part?
What young people require for their mental health, regardless of their culture, can they talk about what they are and how to provide them?
What those things are that young people
Yes,
need.
and I think that's maybe speaking to nurturing environments. Okay, next question. So, these are some.
Maybe I'll just state the obvious. I think like there's kind of like what we often call basic needs, like food security, safety, and I think for young in a shelter. So I think those are sometimes underappreciated. I think aspects of what leads to mental health, and I mean I don't know for sure, but I would venture to say those are universal across cultures.
Okay.
Yeah, I mean, I don't want the person to think we don't find the question important. I just think we feel that we've been talking about that precisely. So probably the question was posed some time ago. But yeah, the kinds of things we've been talking about, I think we all feel these are the kinds of things that need to be provided, really, or need to be done.
Mm-hmm. I think another universal is a good night's sleep. And there's a lot of work on like sleep inequality. So if you can just think about, who has to work overnight shifts and then who has to do then extra work at home afterwards, who has childcare, who doesn't, all that stuff, and young people who may be providing some of that care themselves on top of going to school, on top of working and earning money for their families at the same time. But we know how, there's a lot of research that's saying sleep is important for mental health, but it's unequally studied, especially when it comes to, how diverse are the samples that are being studied that historically have not. So I've talked about sleep a bunch, but it's really so central to how our bodies regulate and how we're able to reset and recover and restore, especially for bodies that are going through so many changes through puberty, through adolescence, like a whole new you each day for a certain number of years. And so I think that that's something where there hasn't been enough research on how, it also, though, of course, then is a systemic issue. It's not like a pill, although so many times that's what the treatment is given. But I think the focus on that, the ways that we can reorganize things like school days or the schedules to make that a priority and not just like an afterthought, is something that, and that goes to the culture of work,
right.
More than anything else. But I don't know, sleep is a big deal.
As luck would have it, 2024 Nobel Conference is about sleep. So we'll be consulting with Dr. Alper, obviously.
So it's really hard to say universals, right? Because there are lots of, racial differences in who actually gets enough sleep. And so, I would say that, love, everybody needs love for, their mental health, but the ways that people feel loved and, the beautiful poem kept repeating, trans loved, right? How we love people, how people feel seen, is going to be different. And so I hesitate to look for universals. We have to do the hard work to figure out what the unique needs are of people and then sort of move from there.
Yeah, thank you. Yeah.
I have two quick thoughts. One is the universals are hard. I mean, I think that there are contours that matter a lot. And on the other hand, I never thought I would be someone saying this on a stage like this. You know, for modern life in particular, in terms of going concerns, I mean, Freud said work and life, right? And I think those are two huge domains that people have to like sort out and make a difference. And the second thought is I wonder if mental health isn't to some degree like happiness. If you aim for happiness, you may not find it. But if you find purpose and a way to contribute, happiness is sort of a byproduct. And in some ways, that's what I'm suggesting. Many of us are psychologists. I don't think all of us are. Many of us are psychologists here. And the challenge of being a psychologist is we're trained and we're interested in thinking in here, right? But paradoxically, that leaves the structural untouched if you only are looking in here, right? It's out there where transformation has to happen. And I do wonder if, you know, the paradox of mental health is to be less in here and more out there, and that good mental health may follow. Just a question.
What do you think must change politically and or culturally for there to be widespread public support to invest financially in youth mental health? So what must change politically or culturally to get widespread public support for investing financially in mental health, youth mental health?
Well, the Senate needs to pass the Equity and Mental Health Act that has gone through the House. Please. Let's start there.
I don't know, I'm gonna say banning assault weapons would be like pretty good to, you know, work on it, considering just how much that is central to young people's like not well-being in the U.S. and the U.S. in particular.
Yeah, I think this is a tricky question in terms of the field that I'm in or that I've been talking about, because there is an incredible like social political backlash happening against trans youth right now, and some of the information that is being spread around is misinformation or misinterpretations of studies and data that is out there. So one of the things that I think needs to happen is that the information that is getting distilled to the people who have the powers to make these decisions need to be critical consumers of this information, because a lot of it is inaccurate and is very skewed. And I also think that for the states that are willing and able to put in the work, which is a lot of states, for them to be refuge states, for them to work with their counties and their state legislators to create that. I think that that would be important, especially with the direction of some of the southern states that have already banned health care for trans youth.
I guess, of course, as an economist, my mind goes to incentives and like, what are the incentives for politicians, and how do we judge politicians' performance? Unfortunately, we have a terrible way of judging. The only numbers we really seem to focus on are like unemployment rates, inflation rates, which, by the way, are not like the president really actually has very little impact on. And so economic indicators, GDP, that kind of thing, which should be very clear from this discussion, is like so beside the point relative to equity and youth mental health. So I guess that, this is not easy, but could we somehow better measure youth mental health and equity, and have some kind of accountability, some way of at least attributing some of that to the people who are making the big decisions and allocating the funds and the power in our society. That might sound like a pipe dream, but I think that maybe is the direction we need to try to go.
In terms of the economics of mental health, what we know and what community psychology that I brought up in an earlier panel really contributes is the emphasis on prevention. So prevention actually is cost effective, and that's in dollars and cents, but it actually prevents people from suffering to begin with when it's done well. And it can be shown to do well. So Head Start was a prevention program, for example, that got widespread public support a long time ago. So there are these initiatives or endeavors that can keep people from ever going off the rails or off track into suffering, dysfunction, however you think about it. And it's actually cost effective. It just doesn't align with the political stuff, because it takes a long time for those effects to really be registered. And so finding a way to invest more in prevention instead of rehabilitation in the way we do in the medical system seems like an obvious thing to try, but somehow it's politically very difficult.
I'd say that in the field of loneliness, one thing that has helped in the UK was precisely that report that quantified the cost of loneliness to employers. Now, obviously, that's only one small aspect of the cost of loneliness, so we need economists to be interested in the rest of life, not just in work and employers. But that's a really key contribution, because politicians and those in power do attend to costs, and that suddenly becomes important as an issue. So, the cost of poor mental health in a more holistic way, rather than simply, how much medical costs do these people represent, might actually be helpful in this regard.
Okay. I guess it's one last question, and this is one that was posed at our table at lunch, and the question is, and this I've got lots of answers to, but I'm leaving it up to you. So what do you want the outcome of this conference to be for youth mental health? You've invested a lot of time, thought, research, etc. Yeah,
I guess
Dr. Loy.
I'll go first and let folks really close off the conference. So I think I had one answer, and then from lunch, and then as the talk went on today, I think I had another added thought. So I think for me, I was reminded after this afternoon's talk particularly, one of my sort of favorite quotes is, I'm paraphrasing, that we are like all peoples, and we're like some peoples, and we're also like no persons. So from a psychologist standpoint that Dr. Gan just mentioned, we tend to think about maybe individual differences, or like we're all similar in terms of our genetic makeup in some ways. So we all have telomeres. We're all gonna, age in some ways. And at the same time, our shared environments also facilitate certain kind of outcomes. At the same time, we're also very unique because the constellations of our environments and our lived experiences and accumulation. And I think what I've taken away from this conference is we have different perspectives, and I think we also shed light on how there are shared experiences and uniqueness from different facets, in terms of sexual and gender orientation, sexual orientation and gender identities, and racial and ethnic backgrounds, and disability and ability statuses, and and sort of indigenous status and so forth. So I think one thing that I think can be maybe a common thread that can hopefully sort of propel some of our continued conversation is empathy. I think that is one thing that I think is so important, and I think at lunch we were talking about, sometimes we retreat from talking about differences or our unique experiences because there may not be shared, like safe spaces, or they may not be the time and energy to communicate our needs and how we live our life and how we make meaning. So hopefully this is a start of some additional conversations about empathy and kind of humility in understanding one another and creating those safe spaces and communities. So that's kind of something that I think what I've been thinking.
Yeah, Dr.
Just go in order or something.
Go down the line if you're comfortable with that. Okay.
Yeah. I'll just say, I guess, two things. One, I hope that everybody in the audience in some capacity has felt seen by the different array of presentations, which I think I can't speak for everybody else on the panel, but the array of perspectives and backgrounds and lived experiences is not typical, especially in like the field of psychology or even economics, and mental health in general. So I think that's a credit to the Nobel. I think the people who brought everybody here together. And then the other is sometimes the word paradigm shift maybe is like too broad, but I think there's a lot of little ways where a lot of people's presentations, I think there's clues that were dropped to reorienting something like what part is the problem and what part is the solution, and is what I thought was the solution sometimes the problem. And it's that kind of fundamental questioning that I hope comes out of, and I know I'm really grateful for anybody who's come up to me after my talk to talk about how maybe some of that changed some of that for them, but I think that those kinds of really turning something on its head in that way is something that I hope comes out of this.
Okay, thank you.
I guess we're going in order. I have a lot of ideas about, what I hope would come out of this, but I'll just say that I hope everybody knows that they can play a role in promoting equity and mental health, no matter who you are. You can change your community. You can better the life of people, who were your friends. You can make sure that, you have the racial literacy that you need to participate in our democracy, to participate in the communities that you live in, and to make sure that everybody, feels like they belong. So just recognizing your power and then, doing the work that you need to ensure that, people around you, that there's equity in mental health, at least in your circle, and then eventually we'll realize it across the country.
Thank you.
I think for the young people in the room or who are listening online, I similarly to what Brindisha just said, I do hope that you realize that it's really not just saying, we really want to listen, and we want to listen to your voices. And we as the researchers, but also the teachers in us, the lecturers in us, and many others, I am sure. So, your experiences are your experiences. We don't know about them from reading books. For the teachers, I hope that there is a bit also more motivation to really try and, in their schools, think about that structure and what is offering and what is not offering, what is asphyxiating and what's actually a space of freedom for their students. But also for the researchers, if any researchers were listening, to really be a lot more open to diversifying their samples. And if not, then make sure that you only talk about the sample that you have and do not extrapolate to the world when really all you're talking about is a particular group of people. This is really a problem in psychology because we do aim to be very universal in the knowledge that we gather, but that aim is really not realized unless the samples we look at are universal and unless they are seen as such and respected in the process as such. So those three for now.
But don't diversify your sample if you don't have the training to study those people.
That.
I think for me, speaking to, since my presentation was specifically to the trans and non-binary community, for people that are listening, one of the things I want them to take away is that you are seen, you are beautiful, and you deserve to have this space. And I think that that is true for all the communities that we're talking about, but because my presentation was focused on them, I wanted to highlight that. And I think, you know, one of the running themes throughout many of the presentations is to remember that so much of what is happening to people is not the individuals, you know, the individual is not the problem, quote unquote, and that we need to think beyond the individual while also not forgetting the individual because they're the person who's being affected. And it goes out to communities, of course. And so we need to be more creative with our solutions. We need to also advocate for those solutions in schools, in education, larger education systems, and at the policy level, and to help them understand like why this is important, because I think there's some people who see it as important and some that don't. And to also not question, and I bring this up only because I felt like some of the questions that we were being asked, like there was this sort of like underlying question of whether racism or oppression is still happening. It 100% is still happening.
My hopes, I think, have a lot of overlap with what has already been said, so I'll just keep it short. My hope is that this conference has helped create and further a sense of shared purpose, and a greater appreciation for the challenge of youth mental health and equity issues surrounding youth mental health, but also of the opportunities. So as others have said, I think there's hopefully a lot of ideas and inspiration to get more involved from whatever walk of life or perspective you might have.
Dan's referencing the challenge of going at the end of this line, right? All the good stuff has been said, the insightful ideas are offered. I mean, I'll just close by talking maybe to young people in this room, and we have very bright lights. I know there's a section up here, there's maybe a little section back there. You know, I think I've made reference already to, you know, how much we spend time in here, how much we spend time out there. They're not mutually exclusive. You have to spend some time in here to know what it is you have to contribute out there. But we have serious challenges facing our society and our species. And you probably are more acutely aware of those in some way that anxiety registers perhaps in a way that someone my age maybe doesn't have to be in quite the same way, because I don't have the same time horizon you have. But we are looking to and counting on you to do the necessary work of, yes, spending time in here adequate enough to be able to get out there and save this planet. And every generation has its trials, every generation has its struggles, every generation has older people thinking they've gone to hell in a handbasket, but we know that's not true of you. We know you will rise to this occasion, and we want to, with breath bated, wait to see what it is you're going to show us over time. So don't get so tied up in here that you lose your way. You've got to find your way out there to save our species and this planet. We look to you to do that. Thank you.
What I would say, and this was something, once again, we talked about at lunch, is I hope 10 years from now, when we are looking back at what has been said, that many of the problems that have been suggested as out there, that they're fixed or changed, or there's forward progress and a better recognition of youth mental health concerns.
Thanks, Marie. Thanks. Thanks to all of our panelists. Of course, thanks to Marie and Angelique and the entire Nobel Conference Committee. Thanks to all the people who have put this together. Thanks again to our audience. And just an invitation, you can see in the program next year's topic. I won't talk about that here. It feels like an odd thing to bring up right now. But please, we hope we'll see you back here next year. Thanks. Safe travels on your way home. And thank you so much for being here.
for the last time, I'm going to say that to the 58th Annual Nobel Conference at Gustavus Adolphus College. We just wrapped up. Wow, that was a really incredible 2 days, very powerful. I was really happy we got with the final talks from our presenters there, the final Q&A, a little bit about what we can each do. So thank you so much for all of you who participated in the live stream, who are watching on this really important topic of mental health inequities and young people. So before we sign off, we very excitingly get to do a preview of next year's Nobel Conference, the 59th Annual Nobel Conference 2023 here at Gustavus. And to do that, I have one of the co-chairs of next year's conference. Do you mind quickly introducing yourself and your role here at Gustavus?
Sure. My name is Margaret Block-Kazi. I am a professor in the Department of Biology, and I am co-chairing next year's conference along with my colleague, Dr. Yuta Kawalasaki, who is also in the biology department.
Okay, so we've narrowed it down. We know it's biology.
Yes.
It's about life. So drum roll, please, wherever you are. I imagine that there's like high school somewhere in the cafeteria. There's like hundreds of students, and then they're doing a drum roll. The 2023 Nobel Conference is all about
insects.
This is very
little bodies, big impact.
Little bodies, big impact. This is very exciting. I'm good. Somehow, magically, this is the magic of live television, live streaming, everyone. Lisa Helke literally ran up 3 flights of stairs to join us here. We just revealed, I know it's probably been revealed, but like next year, little bodies, big impact, the world of insects at Nobel Conference. So we're super excited for this. Can you say just quickly a word? How did this get to be a Nobel Conference for next year? Tell us sort of like why insects?
Yeah. So, first I want to say that this theme is something that was developed with a interdisciplinary, really creative and enthusiastic group of students, staff, and faculty. And why insects?
Yeah.
Well, I think in the words of a famous bug scientist, also known as an entomologist, named Dr. Thomas Eisner, he said that bugs aren't going to inherit the world. They own it now, so we might as well make peace with the landlord. So I think that keeping that in mind, the idea of insects as landlord, is really helpful. Insects do some pretty nasty things. They transmit horrible diseases. They eat our food and food types. They do some things that we consider to be pretty gross. But insects also are very important for agriculture. In terms of pollinators, we've got the U.S. agricultural industry almond industry is dependent on the work of pollinators. Right. And they're beautiful creatures in their own right.
They are beautiful.
Yeah.
And it's sort of, as you said, they are something that we all have a very direct experience with already. Yeah. And so it's, I think everyone's going to bring their own sort of experiences to next year's conference. Yeah. Dr. Helke, can you? This is. I'm just imagining for you, you're literally all right. I just got done with a conversation about mental health inequities in young people, and now literally we're and let's talk about bugs. So can you just talk about sort of
speaking of phobias?
Yeah.
Actually, speaking of phobias, it was one of the things that the committee had some really robust discussions about. Margaret was teaching a seminar class to sort of explore the conference topic, and we in that class had long discussions about, do we want any part of this conference to focus on the fact that many people have horrible experiences, personal or sort of cultural, with insects? Do we want to bring a speaker whose focus is on phobias, for instance? And in the end, we decided, no, we really want to explore the certainly we want to explore insects as pests, as problems, but also insects as architects, as pollinators, as beautiful creatures, as muses. So it's a fascinatingly interdisciplinary topic, and as Margaret said, we had such an incredible interdisciplinary committee. In fact, Margaret, I wonder if you'd like to say a little bit about the way in which insect collecting came to be something that the committee chose to focus on. It was a big surprise to me. I felt so ignorant about the importance of insect collecting.
Well, I think that insect collections are one of those things that lots of people, at least in the United States, have had experience doing through school projects and things like that. And there were several
Accidentally on the
people-
windshield.
Yeah, right, if we're peeling them off the windshield. And so there were several members of the committee who were from non-biological departments who had some experience collecting. And we might do it for entertainment, we might do it because we have to for a 4-H project or school, but insect collections housed in usually universities are incredibly important resources for understanding where insects are, where they have been, over time scales. And so we are fortunate enough to have Dr. Jessica Ware, who is works in the archives at the American History of Natural Science, and is a wonderful advocate talking about the value of collections, as well as who has access to study insects.
Okay, so I am getting excited about this, but I'm gonna pull us back
Reel
for
us
a
in?
second. Reel us
Okay,
just to do,
okay.
because I do feel like that there's some people probably watching who are still like,
Whiplash.
wait, insects? Like what? So I'm gonna just tee up like the obvious question, like make the case that insects like deserve their own Nobel Conference, and that there's something, all these folks who are watching at home now and will hopefully join us again next year should be really excited about.
Well, insects tell us something about us, ourselves. So one of our speakers, Dr. Michael Young, is a Nobel laureate, and the reason that he received the Nobel Award was because of work he's done identifying parts of these internal clocks that we have in our bodies called circadian rhythms. He studied them in fruit flies, but we have the same genes and proteins working in our bodies, and they help regulate sleep-wake activity cycles in our bodies. He's recently, to make a connection, somewhat tangential to this conference, his research now has gone to trying to understand how social isolation results in changes in well-being. And granted, these are work on a fruit fly, which is a very simple organism compared to a human, but nonetheless, it helps us understand some of how our bodies work.
Yeah.
And we were interested in thinking about the insects as model organisms, because as Margaret points out, even though they're simple, they share important features with other biological life forms. I always teasingly say that, I don't know if people realize it, but the fruit fly has won more Nobel Prizes than any other organism, with 5, right, Margaret?
I think so.
Wow.
Isn't that interesting? And I just want to point out that Margaret Bloch-Kazi is herself a researcher whose organism is Drosophila, the fruit fly.
The fruit fly.
Yep.
This is
Yep.
good.
Yep.
I had no idea. So we already name dropped one. Do we want to?
Let's name drop
two.
some more,
Do we want
Margaret.
to say who some of the names folks might be excited to hear about, and just briefly, like sort of some of the kinds of things that we might hear about next year?
I promise.
Yeah. Okay.
Sure.
Well, or whatever.
Yeah. So we have two scholars that are going to talk about insect perception. So this whole idea, there's how we look at the world, but insects experience the world in profoundly different ways because of their small size, the way their nervous system is organized. So Dr. Shannon Olson is going to be talking about her work to try to understand how insects perceive the world. And she also is promoting something called empathic science. So some other ways of kind of looking at how we do science, particularly on non-human animals. And then the other scholar is Dr. Peter Godfrey Smith, and he also does work on invertebrate animals, so this includes insects, animals without backbones, and how they might be perceiving the world. And part of his scholarship also then focuses on the ethics of animal experimentation, given what meaning they may make of the world. So that's two. Shall I keep going?
Yeah, keep going.
Keep going. All right, we're just going to keep going.
I want to hear.
All right. So, we did talk a lot earlier about our discomfort, a common discomfort with insects. We did end up inviting and accepting Dr. Julie Lesnick, and so she is taking a more anthropological approach to study human-insect interactions over evolutionary time, and how that's played out in terms of insects as a nutritional source. And then more recently, she's been looking at across the globe how differences in terms of our contact with insects influences our attitudes about eating insects, which in some parts of the world is not interesting at all because it's so common, and yet for us it's something that we really struggle with.
Yeah, this is a thing. I'm putting a note. We need to make sure that I think that this is okay. We should have crickets that people can eat like next year.
We had cricket
have done it
cookies
before.
at the soil conference, I think, but we were thinking, and Margaret does this in her classes always, has her students eat insects in a more recognizable form, right?
Yeah.
Once it's flour, it's sort of, oh, I can pretend it's not there, but what if you're holding a cricket in your hand?
Yeah. There are all sorts of ways to experience insects, but they're also a very good source of nutrition. So as we think about food security, that's an important consideration.
Did we do all the names or
We did
no?
not.
Okay.
I will quickly. Dr. Seganet Kelamu is a scholar who studies food security.
Okay.
And so she's looking at insects that eat plants, so one of these things that we really do have to be concerned about, and how that influences food security and also local economies.
Yeah.
And so the work she does, while she is working in Africa, she's in Kenya right now doing her work, she also has a vision of expanding their work globally.
I have to say, when I hear that, I think that like once upon a time, literally where we are in southern Minnesota, if you had said, we're going to have a conference about like grasshoppers, everyone would have come because they'd be like, yes,
Because
they're
they
a
would know.
menace. Like, we need to do something.
We used to have plagues, locust plagues here too.
Yeah.
I've got to just mention the last, but certainly not least, speaker is Dr. May Berenbaum, and she studies the insects that eat plants and the chemical warfare that plants wage back at insects.
Wow.
She also has been writing about insects and the gross and fecund and all the weird things that insects do for a long time, and she's a really lucid and really funny person to write with. So I'm looking forward to her really convincing us all about why we ought to know more about insects.
I'm super excited. This is fabulous. Do you have anything else you want to say about next
We're
year?
fixing to do a storytelling event at the conference because of the importance of everyone's experience. So we're thinking that there might be a mothish type event involving story.
I love that. That is very cool. Moth-ish type event, cricket cookies. Yeah, we've talked already about, can we either fill this studio with butterflies, something.
We've been planning.
Cockroach fights?
Cockroach fights.
Probably not.
Okay,
Cricket fights.
it's up to them if
fights.
they want to fight or not. Maybe they'll
Right.
unionize.
Maybe their lovers not.
Yeah, no, love and not a fighter.
This is so exciting. I really am excited about this. If you are somebody who tunes into or comes to the Nobel Conference because you love learning things that you didn't know about the world before, I feel like next year is the perfect conference for you because we're going to learn a lot, both about the insects themselves, but as you said, they tell us a lot about ourselves. So very excited. And the dates for next year are?
October
3 and 4,
Thank you.
2023. October 3 and 4, Nobel Conference 59 here at Gustavus, as well as online. But come on down. We like seeing people in person if you can make it. So
Tickets will go on sale in February.
in February. So that's fabulous. Well, on that, I would say, Dr. Helke, congratulations on a great Nobel Conference this year. I know. I can't. I've been doing all day. Everybody gets the title.
Gets the big title.
Yeah. So congratulations.
Thank you. Thank you very much.
Fabulous Nobel this year. Professor, we're super excited for next year. It's going to be fabulous. To everybody who joined us for the live stream, thank you so much. Thank you for being part of this year's Nobel Conference. As we've been saying, all of the lectures, the performances, everything that we've had on the live stream, you'll be able to watch again later at the Nobel Conference website. So if you missed one of the presenters or the Q&A, or you just want to go back and get more out of it, please stay with us, come back, and again, mark your calendars for October 3 and 4, and we're going to do the World of Insects here at the Nobel Conference. So until then, I will say thank you all so much. I'm Tane Danger, and we're going to sign off for this year for Nobel Conference 58 at Gustavus Adolphus College. So thank you all so much. Thank you, everybody who watched, and we'll see you again next year.
So many of the different fields in science, most people aren't exposed to in their day-to-day life. The more you can get out there and communicate to the young people coming up that are the future of science, the better. You never know what's going to grab one individual, and so that's vital to inspire the next generation.
The Nobel Conference brings together students, faculty, and members of the general public to explore revolutionary, transformative, and pressing scientific questions and the ethical issues that arise alongside of them. We bring leading researchers to Gustavus, including nearly 100 Nobel laureates. We're trying to explore the ideas of science using all of the liberal arts, so the arts, the humanities, the social sciences, all of them working together.
There are a lot of people who are not scientists who like to share in the adventure of discovery and to be able to share that joy with people who also get it, that there's something really exciting and cool going on. It just makes it just an enormous amount of fun.
There's sort of a festive atmosphere, which makes it part of a broader experience.
There aren't that many forums for us to have the discourse at that level with that sort of range of expertise, yet still focused on one sort of overarching topic.
One of the wonderful things about the Nobel Conference is it does give people the opportunity to ask people questions in an informal way, and you never know what statement somebody makes or what interaction that happens will make a change in somebody's life.
It's always very, very encouraging to see other colleagues of yours who are at the top of their game, and it makes you want to lift your game.
As you can feel the audience, and you can really feel when you've helped people to know something that they never knew before. It's really a feeling of discovery that you share.